in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight,
This lad's just ran out across the road.
a boy is run over on his way to school.
Can you move your right arm?
A woman suffers a horrific open ankle fracture.
Nice deep breath,
Well done.
Sandra. That's it, well done. Nice deep breath.
A horse riding disaster,
On the left, on the left part of my neck.
Yeah.
and a man has a cardiac arrest in front of his daughter.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing.
Hello. Are you all right? How you doing?
Critical care paramedic Pete Edwards joined the ambulance service 15 years ago.
Just thought I'd give the car a bit of a clean. Looks nice when it's clean, so...
5 years ago, he underwent specialised training and is now a member of the critical care team.
Nearly done, sorry.
The critical care team rely on their fleet of high-performance vehicles to get them and their specialised equipment to an emergency in the quickest time possible to provide vital life-saving backup to the ambulance service.
This bag, the red bag, or bag 1 as we sometimes call it, is our enhanced care bag. So it's got some equipment in here that they don't carry on the ambulances, and that includes sort of surgical equipment. We've got some advanced airway equipment, extra little bits that the ambulance crews don't tend to have.
Ambulance services, the patient breathing.
This lad's just ran out across the road and I've hit him with the car.
Okay. Where's the pain that he's feeling?
Where's the pain? In his leg.
Is he in the road still?
Yeah, we're in the road.
You're okay, left. 13-year-old Patrick, hit by a car, patient is still in the road. So, yeah, we haven't got a huge amount, we've got an age. The rest we'll have to figure out once we get to scene.
An ambulance has been dispatched, but with the child's life in danger, Pete and fellow critical care paramedic Mike Andrews are also urgently needed.
We'll be there first, won't we, brother?
Yeah, we're going to be the first resource on scene, which is a bit unknown at the minute.
In a 12-hour shift, Pete and Mike will attend up to 8 emergencies. Their skills and training can make the difference to someone surviving or not, but only if they get to them in time.
That's completely blocked that way, Mike, by the looks of it. Some of this might just be general traffic, I don't know, or it could be because of what's happened.
In these freezing conditions, Pete and Mike will need to act fast to stop the child's injuries becoming critical.
Can't go the wrong way around in the dirt as much as I want to. I'm going to park us just in front, okay?
I'll press us in attendance. Mike, shall I get out and jump and have a quick look?
8 minutes after receiving the call, Pete and Mike are on scene.
Morning, how you doing? All right? Hello, Patrick. Hiya, mate. I'm Peter. I'm one of the paramedics with West Midlands. Are you Mum?
Yes.
Hello, Mum.
Listen.
13-year-old Patrick was walking to school when he stepped off the pavement into the path of an oncoming car.
We're going to have a look at him. We're going to look after him for you, all right? We've just got here ourselves. He's talking to us. That's a good stop. Are you hurt?
Just not here.
Just your ear? OK, let's just have a quick look.
It's common in car versus pedestrian road traffic collisions for the pedestrian to have sustained multiple injuries. Using their enhanced trauma training, Pete will need to assess him quickly to prioritise treatment.
Can you move this arm just gently? Yeah, you can move it. Can you move your right arm?
Shoulder.
Your shoulder hurts. And what about your legs? Can you move it a little bit? Don't move it too much, as long as you can move. OK, all right.
Patrick is able to move his arms and legs so Pete can rule out a serious spinal injury.
OK, all right.
But the blood coming out of his right ear is a major concern.
It's a hemorrhage just out of his ear. I'll give him an update, mate.
All right. So potential for a base gun until we investigate it further.
Pete and Mike suspect Patrick may have fractured his skull, resulting in a build-up of blood in the brain. If so, he's at grave risk of a stroke or potentially fatal hemorrhage.
Happy to pass an ethane.
Yeah, mate.
Crew on red backup, just to see we'll get him out the cold, all right?
The Midlands Air Ambulance Service covers a region of 6 counties and 6,000 square miles, the largest operating area in the whole of the UK. Each helicopter is crewed by a pilot, an emergency doctor and a critical care paramedic.
Ambulance service, is the patient breathing?
Yeah, but she's struggling to breathe. She can't breathe in. She had a fall from a horse.
Oh, okay, she's conscious though.
Yeah, well, we don't know if she was conscious when she fell. She was in shock. She walked round, sat down, she can't move.
Is she bleeding at all?
Not that we can see.
03 lifted with an ETA of 4 minutes.
A local ambulance crew, who are already on scene, have called for backup.
This is a female who is riding a horse at a trot. She's been thrown from the horse and impacted into a concrete step. She presents with quite significant pain. She's slightly hypertensive with a very weak radial pulse, looks very pale. Crew is struggling to get a handle on any sort of analgesia, I think due to her query, slight compromise on her pulse, etc. And have requested some support.
The rider's condition is deteriorating, so the air ambulance has been scrambled, with emergency doctor Matt Rowley and critical care paramedic Karen Baker on board.
It does make you concerned when you hear that someone's blood pressure is low, that they've got a very weak pulse, that they're very pale. It does make you concerned that she's potentially bleeding somewhere. So hopefully we'll get a better handle on that when we get on scene and get to have a look at her.
They need to find somewhere to land quickly.
Just coming into the overhead now.
A fall from a horse, even at low speed, can cause catastrophic injuries.
There are horses absolutely everywhere, but there's a field this side. Just giving it a wide berth because our dog walkers making their way across the field, so hopefully they'll be the other side of the field by the time we make the approach.
The rider could have broken her back or be suffering from a potentially fatal internal bleed.
2-3 on the ground.
Finally on the ground, Matt and Karen arrive on scene.
Rachel. Hello, I'm Matt, this is Karen. Where's the worst of your pain at the moment? Inside your chest. Okay.
49-year-old Rachel, an experienced rider, was turning off the road into a field when a sudden hailstorm caused her horse to spook and she was thrown onto a concrete path.
Can I just have a little feel on the front of your chest, is that okay? Just tell me if it's painful when I'm pushing anywhere.
Her daughter Kelly was with her and called 999.
Where's Kelly? Yeah. I'm here, Mum. I'm here.
Rachel, I know we're asking you lots of questions at the moment, sweetheart. So, when you got up and walked from your horse, did you have any pins and needles in your arms or legs?
I can't remember.
Can't remember, okay.
Dazed and in agony, Rachel can't remember the fall. As well as low blood pressure and confusion, she's also showing an increased heart rate. All signs of potential internal bleeding.
Nothing around there?
No,
Ball in your back, okay, sweetheart.
The pins and needles sensation could be temporary, but it could be a sign of a serious injury to her spinal cord. Rachel needs urgent hospital treatment.
Let's do that blood pressure again.
But Dr. Matt knows that moving her risks leaving her paralysed.
Is that your chest again, Rachel? Yeah.
This is a patient that's jumped off the bridge, received.
That's all received, thank you.
The critical care team is available 24/7 to attend to the most serious emergencies, from road traffic accidents to cardiac arrests throughout the West Midlands.
The role's rewarding, I think it's because it is challenging. It's without doubt a huge privilege to do this job and to have this skill set and the capability to help these patients at the worst time of their lives.
Part of their training is in drugs and anaesthesia, normally only used in operating theatres and intensive care.
Just going to pop a little needle into your arm so we can give you some pain relief, OK?
So in the most critical cases, they can take over the basic functions of the body to keep their patients alive until they get to hospital.
We can obviously put people into medically induced comas and stuff to help manage them.
If we have a cardiac arrest and then manage to get a pulse back on a patient, we carry some extra bits and pieces and drugs that we can add to what the crews do to give the patients a better chance of survival to hospital.
Critical care paramedic Jack Lewis is about to start a 12-hour shift.
It's a drug check day, so all of the enhanced care drugs are bags, because if we all turn up at the same job, we all know what's in all the bags, where it all is. It just makes life a little bit easier.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious?
Yes.
Ma'am, what's the problem?
He's really struggling to breathe. He's just literally come on really fast. He's absolutely blue here.
Okay.
All right, okay.
Is he still breathing?
Only just. He's gone all stiff on me now.
Is he taking regular breaths at the moment?
No. Dropping at the mouth.
Is he having a seizure?
I think he's having a seizure.
Okay. Let him go with it.
Come on, Dad. Okay, they're coming now, darling. Okay, I've got no breathing.
Okay, roll him onto his back for me. I'm going to tell you how to give life support. They are pulling up outside, but you need to start this, okay? One hand flat in the centre of his chest, put your other hand on top, lock your fingers together. Keep your arms straight, push down, hard and fast, 2 times a second.
Yeah.
I want you to do that until the crew are right with you, okay?
I know.
You're doing a really good job. You're doing really, really well.
Okay, they're here.
An out-of-hospital cardiac arrest is always a code-red emergency. Without swift action, the man, 79-year-old David, could die in minutes. The local ambulance crew has called for immediate critical care backup.
This is a crew request for assistance for an elderly man. I think the coordination came through is fitting, but is, I believe, now cardiac arrest. And I think they're struggling with some airway management options, which is one of the skills, enhanced skills that we carry.
Thanks to his daughter's prompt action and the crew's response, David's heart is beating again, but without enough oxygen, his life is hanging by a thread. Jack carries drugs and resuscitation equipment that could save his life, but he's still 5 minutes away from the address and may not get there in time.
Downtime has been, I think, fairly considerable now. I think call time was 20 past 2 and we're now approaching 2:40, so we've had 20 minutes of potential cardiac arrest, so it might be that by the time I get there, actually we're past the point of making a meaningful difference for this gentleman and we go no further. 62. Hello mate, how you doing?
Jack arrives at the address and is immediately briefed by the paramedic team so he can lead the treatment.
We have 74-year-old David.
Hello David.
79-year-old.
Yeah.
Collapsed, daughter said his breathing went funny.
Yeah.
She started CPR. Initially querying if there was a carotid when we got here.
Yeah.
There was a gonal breathing.
Yeah.
He arrested at 14:19.
Okay.
And we got a ROSC at 14:35.
Nice one.
Daughter Caroline, who was with him when he collapsed, has been joined by other concerned family members.
Awesome job.
The paramedics have inserted a tube into David's throat, and he is now breathing with the help of a ventilator.
I'm just going to get some midazolam, and then at that point we'll put him onto my ventilator because it's just a bit better for him, if that's okay.
Jack needs to get David to hospital for urgent tests to find out the cause of his cardiac arrest.
All right, Dad. Nearly done.
But for now, he's focused on just keeping him alive.
David's doing really, really well.
When we get him on the ambulance, we'll just have a few minutes, we'll get him sorted.
Back in Smethwick, critical care paramedics Mike Andrews and Pete Edwards are at the scene of a road traffic accident where a 13-year-old boy has a serious head injury after being run over on the way to school.
Just looking at the car for some indicators of how hard the car has hit him and potentially for injury patterns, really. So where he's obviously gone onto the bonnet, but the windscreen is intact. So he's got a head injury and some bleeding from his ear, so we need to look at that quite quickly.
It's likely Patrick's head would have taken the main impact of the blow, potentially fracturing his skull.
Patrick, do you think you were knocked unconscious at all? No. All right, mate, just have a look, just a second.
Checking his pupil's reaction to light will show whether he has suffered a concussion.
Have you got any pins and needles anywhere? No. OK. All right. How bad is the pain at the moment? Your ear, is that the worst pain? And what about your shoulder? Is it just when you move it? OK, all right, no problem. The ambulance is here now. What we're going to do, we're going to get a proper look at you in there, all right?
Pedestrian, 13-year-old male, struck by a car.
As West Midlands ambulance crew arrive on scene, Mike updates the critical care trauma desk on Patrick's condition.
Query basal skull fracture. Well, the patient is conscious and talking to us. He's just got a bit of a hemorrhage coming from his right ear.
Now the ambulance is here, they need to get Patrick to hospital as quickly as possible.
He's got a head injury. I think we need to, get him immobilised. Yeah. So if you could grab your stretcher and scoop. We haven't stripped him off because he's going to get freezing cold.
Yeah.
So are you all right with that? Is that OK? All right.
Let's do a few little checks on you, OK? See how you're doing.
Peter and Mike need to be sure they don't aggravate any undetected injuries when they move him.
I think without the collar, yeah, but what we'll do, we'll get us, he's moving it, just keep your head nice and still, Patrick, that's it. He's moving his head freely and he's moving all his limbs free, he's got no paralysis. We'll have to get this bag off, I think, so it might be just a case, we'll have a look at that in a second. Has anybody got any shears on them?
Keeping Patrick as still as possible, Pete oversees the ambulance crew as they position the scoop stretcher underneath him.
Any pain in your tummy? Nothing? No in your back? Lower back? That's good stuff. OK. Right. Just let us do all the work, Patrick. OK. We're going to just... There's going to be a little bit of movement, mate.
You're going to feel pinch and sneeze, all right?
All right. Now, it might pinch your bum. Tell us if it does and we'll stop.
You got his head just clear of that, mate.
Once the two halves are snapped together, Patrick's head and neck must be immobilised.
Yep. OK, mate.
Before it is safe to move him onto the stretcher.
Got some grazing to the temporal region there. The other thing we need to have a look at is his sort of upper thigh pelvis region, because where the dent is on the bonnet, it looks like that's where it's struck him. Yeah, if that makes sense. So, ready, steady, lift, and ready, steady, down. OK. So that's, you're right. All right, nothing to worry about, we're going to look after you, OK? OK, going feet first, then. What we're going to do, we're going to take some of his clothes off, all right? Yeah.
On the ambulance, Pete can oversee a full body examination. He's worried Patrick may have broken a bone in his pelvis, which could rupture the femoral artery, causing him to bleed out and die.
Take a nice big deep breath in for me. Big deep breaths in. It's clear. It's equal. OK. So I've checked his pupils, they were leaking and reactive right. He's got an abrasion to the top of his the right side of his forehead, and he's got this blood coming out of his ear that I can't see where it's coming from. So in terms of hospitals from here, he's nice and stable, but just because there's blood out the ear, I think sway towards the children's. What do you think?
Patrick is alert and doesn't seem to have broken any bones. Pete is happy he is stable enough to leave him in the care of the ambulance crew to take him to Birmingham Children's Hospital to be further assessed by the emergency doctors. It's the weekend, but there's no let-up in life-threatening emergencies and no rest for the critical care team.
2020.
Critical care paramedic Tom Waters is prepping for his shift.
Saturdays, obviously, more people are off, more people want to do certain things, people are more active. So yeah, I think that could mean a busier day for us. The weather, it's not too bad outside, so we'll see how the day goes, but we're booked on, we're good to go. We've got our drugs out, and it's a bit of a waiting game now.
Ambulance service, is a patient breathing?
Hi, I'm not sure. Literally just seen a crash outside of our house. The car's literally like written off.
Okay, so it's one car. Oh,
Yes, it's one car who's gone into like the wall.
Did you see how fast the car was travelling at all?
It was going quite fast to be honest. Like more than 50.
That's absolutely fine. I am going to be on scene in 30 seconds.
Thank you.
With a car crash in a residential area, there's the danger of multiple casualties. Police, fire brigade and ambulance have been called, and specialist trauma backup is also requested.
RTC, don't really know what's going on, but it's here.
At the scene, a crowd has gathered on the pavement.
Oh shit.
The vehicle, a rental car, has somersaulted into a brick wall and the driver is nowhere to be seen.
Which way did this car come from, do you know?
Probably.
Okay, right. And did you all see it? Okay.
Does that catch you anywhere when you breathe in?
In Wolverhampton, Dr. Matt Rowley and critical care paramedic Karen Baker have flown 9 miles in the Midlands air ambulance to rescue 49-year-old Rachel, who is in a critical state after she was thrown from her horse onto a concrete path.
Any pain in your tummy?
No.
Good, okay.
What were sats on there?
100%.
Okay.
It was just the fact that capillary refill was a bit swollen.
Okay. Any pain there in your tummy? No, okay.
Rachel's low blood pressure and poor circulation, along with her memory loss and severe pain in her upper back and ribs, is a sign that she may be suffering from life-threatening internal bleeding.
Do you want to take the mask off right now and just see how she's saturating without the mask?
What we're going to do is just have a little feel underneath your neck at the moment, okay?
On the left, you know, on the left part of my neck.
Yeah.
If where the ball is, I've hit there as well.
Have you? Okay.
Yeah.
When I'm pushing now on your neck, tell me if you got...
Tiny. No, gone now.
Okay.
There.
There, is that tender in the middle of your neck? Is it where my finger is there? Okay.
Rachel needs urgent hospital treatment, but before Matt allows her to be moved, he needs to be sure she hasn't fractured any vertebrae, which could result in paralysis.
How much morphine she had off your time? Just 5. Should we go for let's go for another 5, and then we can give her another 10 then, can't we? She had any antiemetics yet either?
Yes,
she's had the on-dance charge. Examination's fine. Let's give her a bit more opiates and see how we get on.
Dr. Matt judges the precise dose of analgesia Rachel needs to help her tolerate the journey to hospital without risking a drop in blood pressure that could cause her to black out again.
She'd be good for New Cross.
I agree with you. I think New Cross, you might have something in the right chest. I think we're so close. I don't think she probably warrants giving anything stronger like ketamine or anything.
It's a 9-minute journey to New Cross Hospital. Rachel will travel in the ambulance with her head and neck immobilised in a collar to protect it from any further damage.
Rachel, if your pain was a 10 at the start, where are we now, do you think? About a 3? Okay.
Blood pressure before I get this, so I'll just lock your teeth now.
We'll just give her another 2.5 or something. She's quite comfy, isn't she now? So, initially assessed her on scene, they've been slightly concerned because she's quite pale. Her initial blood pressure is a bit low, and she's got significant pain on the right side of her chest when they're breathing in and out. So, quite rightly, they've been fairly cautious with the analgesia that they're given to start with. Her observations have improved, and that's enabled us to give more morphine.
Right, I am going to go and start loading the motor back up.
Okay.
With Rachel's condition now stable and her pain under control, Matt and Karen leave the ambulance crew to transfer her to hospital.
She's now fairly settled. She's able to take big, deep breaths in and out, and the pain has subsided slightly. So they're going to take her to the nearest hospital from here.
Hiya. I guess it's...
In Dudley, critical care paramedic Tom Waters is at the scene of a road traffic accident.
Hi, buddy, you all right?
Yeah, I'm okay, mate. It's just a few bumps and bruises.
The car somersaulted off the road into a lamppost. Miraculously, the driver, 39-year-old Carl, walked free from the wreckage and is being treated inside the ambulance.
The car is absolutely total, isn't it? It's been through a massive roll, isn't it?
Yeah. And then men flipped like that as well, yeah.
And it was just you in the car, wasn't it?
Me in the car.
And if you hit, I'll go check nobody else has been hit, all right, and then...
According to Carl, the accident happened when he was run off the road by another driver.
Are you happy for me to... He looks absolutely fine, doesn't he?
I don't
like the fact... Yeah, so the fact he's self-extricated, he's walked, he's chatting, his G says 15, he remembers it all. Yeah. If anything, he can go to low... Oh, there you go. Hey, bud. Are you getting your phone? All right.
Extraordinarily, Carl seems most anxious about his mobile phone.
So basically, the one gentleman is the... he's just getting his bits and pieces out of the car.
Well, how's he done this?
Long story short, rammed off the road, hell of a mechanism. He just wanted to check his stuff, so... All right, bud. Do you want me to have a look for you?
Yeah,
do you want... Yeah, go and have... We'll get... Yeah. Go and have a sit down in the... Take those bits for you.
My phone is in there, it's
okay.
On a 20i light.
Okay, well, we'll make sure we get...
I just need to get it because my mum was on trying to ring me while this was happening.
Let the guys just safe it. We'll get it for you. Go and sit in the ambulance. Cheers.
Can I get the phone though before?
Yeah, we'll ask one of those guys. We'll get you the phone. I promise you, but can we get you inside first? What's the... Bloody lucky, isn't he? Yeah. He's really desperate for his phone.
Satisfied that Carl has not been seriously injured, Tom is happy to leave him in the care of the local ambulance crew. In Birmingham, critical care paramedic Jack is treating 79-year-old David, who is fighting for his life after a 15-minute cardiac arrest. Daughter Caroline and other worried family members are also on scene.
So he's had a cardiac arrest. He's had a cardiac arrest that's been prolonged for quite a period of time. Because of that, his brain's been starved of oxygen, even with good CPR. So it's likely that if he starts to try and come around too much, he's going to be very agitated and quite difficult to look after.
As a highly trained paramedic, Jack is authorised to use specialised drugs normally only used by doctors in intensive care in hospital.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing, all of his awareness.
With David barely conscious, Jack must decide whether to put him into an induced coma to protect the vital supply of oxygen to his brain and organs.
OK, so he's had 3 milligrams of midazolam. He's had that now at 14:48.
If he has another cardiac arrest while he is under full sedation, it will be much more difficult to resuscitate him and he may die.
Yeah, so eyes are open, but he's not really responding to you. He's localising, so that's a 5. Yeah. Ben, can I have a conference call, please, with senior cover to discuss some rock?
Rocuronium bromide is a fast-acting muscle relaxant normally used in operating theatres before major surgery.
Hi, Neil, you OK? Good. Thanks, mate. So I've got a 79-year-old gentleman who's had a witnessed cardiac arrest at home.
Jack wants to consult with the senior doctor on call before he decides whether to go ahead and use it.
Giving him a small amount of midaz, so 3 milligrams, just to try and flatten him out a little bit. So the call is to discuss potentially to add rock over the top of that to facilitate kind of a safe extrication and get him off to hospital. Let's try the SIMV first, no problem. Yep, sounds good to me. Thank you very so much, Neil. Have a good day. Take care. Bye-bye.
For now, Jack will keep David on the ventilator at his current level of sedation.
Have you got a full cylinder there, guys, or a nearly full cylinder?
We've got a spare one on the other side.
Perfect. So if we pop that on the where yours is, yep. So what this will do is it will support the breaths he makes, and it'll add a coupling over the top. I'm happy if we want to just break the scoop and we'll start sliding it underneath and get him packaged, but we'll obviously just keep it nice and steady, keep a close eye on him. Looks like he's fighting it a little bit, isn't he?
Really well, David.
It's common for someone who has suffered a cardiac arrest and been resuscitated to re-arrest again on the way to hospital.
We'll get him strapped and packaged, we'll do one last check, and if we're happy, we'll extricate him out to the stretcher, get him onto the ambulance, reassess him there. The way he's going, I probably will end up giving him some rock on the back of the vehicle and just making sure we're settled for the transfer. But if you're happy now, we'll get him out. I'll grab the vent and the monitor.
1, 2, 3.
OK, just watch out for all this. Is nice, slow time. If you keep coming forward, we'll get out behind you. Nice and high there. So just grab make sure I've got the little yellow handbaggy thing with the drugs in it, which should be on the chair, and the red bag. Is that all right? Thank you. All right? Nice and slow.
On board the ambulance, Jack makes his final checks.
That's right, so we've got airway. We've got RGL size 4 on a circuit that's working. He seems to be tolerating it fairly well. I'm not convinced that he's not making very effective rasps. He is breathing for himself, but they're not particularly strong. On that basis, I would feel more comfortable taking over and giving him the rock.
7.8, I think it was.
Having weighed up the risks, Jack decides the safest course is to take over David's breathing entirely.
So once I give him this, obviously he won't make any movement, he won't breathe for himself, but it's really important that we keep an eye out for things like tearing, tachycardias, and a raise in his blood pressure, because those are things that are going to indicate maybe some awareness. OK, so I'm going to give him the rock now.
Once the neuromuscular agent has taken effect, David is now effectively in intensive care conditions. His body unable even to breathe by itself.
60, thank you. We're about to leave for Heartlands. If you're ready for an atmist. He has now had, in total, 8 milligrams of midazolam, and I've given him the 50 of rock because he was struggling to fully synchronise with the ventilator in the end.
Before they set off to hospital, Jack updates the trauma desk on David's condition.
We will be 8 minutes to Heartlands received.
Yeah, sorry, 8 minutes to Heartlands.
That is affirmative.
Leaving one of the ambulance crew members to drive his vehicle, Jack will not leave David's side until they arrive at hospital.
All right, David.
Well done, David.
We're off to the hospital, sir. So just become a little bit hypertensive again. So we just want to make sure that that's not any awareness. He's not becoming tacky.
En route, Jack and the ambulance paramedics keep David under close observation. The slightest fluctuation in his blood pressure could be a sign that his heart is about to stop beating.
You've got some global ischemia, but that's normal. That's for reperfusion, so I'm happy with that.
Arriving at hospital, Jack can deliver his critically ill patient to the waiting cardiac team in intensive care.
Skills that we provided there were the sedation, the advanced ventilation, the paralysis, the management of that post-ROS patient who's potentially very unstable, although he did quite well, and make sure that he was handed over effectively ready for ITU. So we had an airway in place. He wasn't aware of what's going on, he wasn't distressed, he wasn't in pain, and we were able to effectively put him onto an advanced ventilator and ensure that his physiological needs are taken care of. The plan now, hopefully, will be to head back to base, restock, maybe have a cup of tea, but we've still got a couple of hours left of the shift, so I could end up going to anything in that period of time. We're just hoping for a slightly more sedate last few hours, but we'll see what comes through.
The critical care team in the West Midlands are on the road 24/7, 365 days a year.
No problem at all.
At night, the car is crewed by a hospital doctor and a critical care paramedic.
Do you know any raps? Yo, my name is Tom and I'm very woolly.
I'm a bit of a bully, yeah.
Oh, perhaps not that one.
Dr. Tom Woolley is a hospital doctor who works 16 shifts a month for the critical care team. Ryan James is a full-time critical care paramedic, working an average 4 shifts a week, day and night.
I think I'd struggle to work within a hospital environment, certainly in the winter months. You go into work, it's dark, you spend all day under artificial light.
And you don't get to go to these fine dining establishments.
No, you don't get to go to the chicken outlets.
Ambulance service, is the patient breathing?
Yes, it's me. I don't feel my foot's hanging off. Blood everywhere. My foot's it's just detached. I can feel the bone sticking through.
All right, we're not far now, okay? A couple of minutes.
In Walsall, Dr. Tom Woolley and paramedic Ryan James are en route to a code red emergency.
We're going to a 71-year-old lady with what sounds like an open ankle fracture, so there's break to the skin. There's a paramedic crew on scene, and they've asked us to come and assist with them.
Open or compound fractures can have serious complications and need urgent treatment. Wounds are easily infected, and disrupted blood flow can cause long-term damage to limbs.
Just ahead, keep left.
Tom and Ryan are only 2 miles away.
If it's a really nasty, deformed ankle fracture and she hasn't got any pulses in her foot, that might be another reason why they might want to call us to try and realign the fracture.
6 minutes later, Tom and Ryan are on scene.
Reached your destination.
Gloves. Hello. Hello.
Hello. What's your name?
Sandra.
Sandra.
Hi, Sandra.
Can I have a little look at your foot, okay?
71-year-old Sandra has broken the 2 biggest bones in her ankle.
That's a decent fracture, that is, isn't it?
The snapped shards of her tibia and fibia have speared straight through her flesh.
I remember getting across the floor, and all of a sudden my foot was hanging off.
She had a mechanical fall, 6 o'clock.
Yeah.
She managed to crawl out of there,
Yeah.
so call 999, then call back.
Sandra was in such agony after her fall, it took her 2 hours to drag herself across the floor to reach the phone for help.
Sandra,
Yes?
can you feel me touching your foot there? You can.
It's a horrific injury, but Tom is concerned there may also be unseen damage to her nerves, and that could result in her losing the foot.
How's she coping with the Entonox?
Sandra's been given gas and air for immediate pain relief.
Just hold on to that, pop it on your face, and just take slow, steady, deep breaths, OK? Make a full seal.
But what Ryan and Tom need to do next calls for something much stronger.
And you've got IV access, have you? Yeah, and that's working all right, is it?
About a third attempt. Do some of the good stuff as well, Jill.
Before they can move her off the floor, Sandra's shattered ankle must be realigned. So Ryan gives her liquid morphine to help dull the agonising pain as Tom pulls the bones back into place.
Sorry, Sandra. Nice deep breaths for me.
Nice deep breaths,
Well
Sandra.
done.
That's it, well done. Nice deep breaths. Nice deep breaths. Keep going.
Well done.
Doing a great job. Deep breaths, Sandra. Don't hold your breath, sweetheart. That's it. Nice, steady, in and out. Big, deep breaths. Well done. Do you want to split it off
let's
first?
do that first, yeah.
The worst part may be over, but they still have to lift the injured ankle up off the floor into a temporary splint.
Well done, Sandra. You're doing really well.
While maintaining the bones in their correct alignment.
Apologise. You're doing really
Happy?
well.
Yeah, all right. OK, well done, Sandra. Well done, darling.
Sandra. Just keep taking that gas as well. Keep taking that gas.
Nice, long, deep breaths, Sandra. Well done.
Tom and Ryan now need to work with the ambulance crew to get Sandra to hospital as quickly as possible to prevent any further damage to her foot.
We'll get the stretcher in, scoop off the floor and get her on, shall we?
Yeah, yeah. Just take some breaths of normal air in between. Is it still really sore? Just a bit. OK, all right. So you just lay where you are. We're going to get you onto a stretcher. We need to get you to hospital because you've broken your ankle and it doesn't look particularly great.
the bone's, it's an open fracture.
That's right, it's an open fracture.
It's been infected, is it right?
So we need to get some antibiotics into you and we need to fix it for you, okay? She's got quite a nasty looking open ankle fracture. What that means is the bone protruding. And so because it's quite a lot of damage to the skin around, we're going to take her to the QE in Birmingham, which is a major trauma centre, rather than the local hospital, just because she might need orthopaedics and plastic surgery potentially.
While Sandra gathers her strength for the next part of her ordeal.
Are we going to get around this corner?
I think we're going to struggle, to be honest with you.
Yeah.
Ryan and Tom need to work out how they're going to stretcher her out of the house.
It's getting through here, isn't it? Or back in there, because we can't even go in there, so straight in here.
What if we go blue carrier sheet and then we can get around the corner?
The only option is to bring Sandra out on a flexible plastic sheet. But the extra movement that will involve means Sandra must prepare herself for more pain.
Sandra, listen to me, sweetheart. We're going to slide you into your hallway, and then we're going to open the door, and then we're going to have to manoeuvre you a little bit out of the front door, OK?
It's fine.
Yeah.
Come towards me. Now, Pecky.
Hang on, sit up, guys. Hang on, that's it. There we go. All right. Is that OK? Do you think you'd be able to put your hands on the floor and then shuffle your bottom to the right-hand side? Do you think you'd be able to do that? Well done. Take your time. Is that OK?
That's it, well done.
Lie yourself back down now. OK.
Oh.
We're just going to put some more pain relief in your hand, all right?
Sandra's played her part brilliantly. Now it's up to the ambulance team to complete the extraction as quickly and painlessly as possible.
All right? You OK?
Yeah.
Any new pains or anything like that?
No.
OK.
OK.
Happy, Tom?
Yeah, on 3, 1, 2, 3.
You're just going to try now, all right? Bear with us. Everyone happy?
Yeah.
On slide. Ready, set, slide. OK. Well done, Sandra.
OK, we're clear.
You OK? Keep your head up, sweetheart.
That's it, well done.
OK.
Yeah.
Right, should we lower down there, everyone? Yeah. And we'll just pop her on the stretcher. On lift, everyone. Ready, set, lift. OK, walk forward. Keep coming, keep coming, keep coming. And lower there. Well done, Sandra.
It took 10 milligrams of morphine, some gas and air, and a lot of courage on her part, but Sandra is now safely on the ambulance.
Nice to meet you, Sandra.
Yeah.
I'm getting off now. This gentleman's going to look after you. Nice to meet you, chap. Catch you later.
Knowing their patient is in a stable condition, Tom and Ryan are happy to leave her in the care of the crew for the 14-mile journey to hospital.
The ambulance crew will take Sandra to the QE. They'll hand her over to the emergency department there, and the emergency doctors will then speak to the orthopaedic team about admitting her to hospital for further treatment and probably need surgery on that ankle.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
One male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Gosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
ETA 4 minutes.
a man is crushed beneath a quarter-ton engine.
Fire will be there to get the engine off his legs, over.
On the top floor in the top corner here.
A cardiac arrest on a squash court.
Onto your back, John. Sorry, mate.
A DIY disaster.
Isolated abdominal injury with partly eviscerated bowel. Hold on to my hand.
And a passenger is trapped after a serious car crash.
Have you got some morphine to draw up? I think he's going to need it no matter what, isn't he?
The critical care team was formed with one aim: to save more lives. Operating 24/7 and crewed by highly qualified doctors and paramedics, their fleet of vehicles are prepped with life-saving equipment and ready to scramble at a moment's notice.
What day is it? It's Sunday. It's 7 o'clock in the morning.
32-year-old critical care paramedic Tom Waters is about to start a 12-hour shift.
We check all our kit every day, so then nothing gets missed out. I like to just make sure everything's in its special place. It all gets used on a daily basis, so make sure nothing's missing.
After working in the ambulance service for 6 years, Tom underwent 18 months specialised drugs and life-saving skills training to become a critical care paramedic.
In ambulance, traditionally, we'd only see a major trauma patient or someone who's suffered a significant car accident or whose heart has stopped beating maybe once or twice a year, where our job is to deal with cardiac arrests, major trauma patients on a daily, regular basis.
Ambulance service, is the patient breathing?
Yes, yes, but the person's on the floor.
Awake?
Yes, but the person has cut the belly.
Have they fallen? They've put themselves with a chainsaw. Are they able to see to me?
No. Oh my God,
Okay.
everything's out.
His intestines.
Yeah.
Has he lost enough blood to fill 2 mugs?
Yes, a lot. Please, just come.
We're coming on blue lights and sirens, so we're going to be there as quickly as we can.
It looks like a 43-year-old male who has sustained an abdominal injury from a chainsaw, and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, you're right. Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa, is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you
want. Right then. That doesn't look too bad.
It looks like it's adipose tissue more
Yeah.
than anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around it, it will stick to it a little bit. And then, if I can get you guys to put some tape around that, is that all right?
Just going to stick the dressing down, Raphael, okay, just to keep it clean.
Okay, so this gentleman, age, I believe you already know. He's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bowel.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling? Sam, can you get some IV access? Is that all right?
Element 03 Alpha's road to start recall 4 PRB and heading east towards...
The most serious emergencies require a doctor-led trauma response. The Midlands Air Ambulance can fly a hospital doctor and critical care paramedic to 90% of the region within 8 minutes, delivering advanced life-saving care to the roadside and fast transfer back to hospital.
Ambulance services, the patient breathing?
Yes.
Are they conscious and awake?
Yes. Me and my husband are moving some mechanical equipment around the back of our house and it fell on him and he's broken his wrist and there's like a big engine on his leg.
Okay, so he's trapped under it at the moment?
Yeah.
What's it, an engine from a car or?
A car, yeah, a Land Rover.
Okay, sweetheart, we'll be with you as quick as we can.
So 3 got ETA 4 minutes. Have you got any details on the case, please?
Dr. Matt Rowley and critical care paramedic Karen Baker are en route to a code red emergency.
Patient in the back garden who's been working on the Land Rover's engine. It's fallen onto him, trapping his by his legs. Fire will be there in order to get the engine off his legs over.
A man is lying crushed beneath 1/4 ton of cast iron. The range of potential injuries are so severe, the critical care team have been scrambled.
Our point of view would be go do an assessment, look at his airway, breathing, circulation, and see if there's any immediate interventions we need to perform that may be life-threatening to him.
Helimed is above the house within minutes.
Okay, you think I've got, fire service, just coming down the right-hand side there. So it looks like this field here is going to be about the nearest. There's horses in that, unfortunately. We're just looking if there's anything in that.
Yeah, that's fine. Yeah,
okay, cool. We'll go with that.
A paramedic working on a regular ambulance will only see a couple of major trauma incidents a year.
All good on the left there, Cass.
Yeah, all good.
Thank you very much.
But these guys deal with the most critical emergencies every day of the week.
There's a catch. 03 on the ground.
It's now been 15 minutes since the 999 call came through. Matt and Karen are concerned the longer the man is trapped under the machinery, the more damage is being done.
If they've managed to get it off quite quickly, then we'll be looking at some soft tissue damage and fractures. If it's stayed on his legs, how long it's crushed his legs for, because then you get problems with circulation.
Hello.
How are we doing? You all right?
Says you can feel it, obviously it hurts.
Yeah.
Arriving on scene, Matt and Karen are quickly briefed by the fire service and a local ambulance crew before they can take control of the rescue.
He has got a collis fracture on his left wrist as well.
Okay.
So we're just in the process of getting the engine off.
Okay. What's your name, fella? Dave. Dave. My name's Matt, one of the doctors off their ambulance. All right.
Scrapyard manager and Land Rover enthusiast Dave Evans was renovating one of his old vehicles when the heaviest part, the engine block, fell off the workbench.
Can we get you back on this gas and air?
Dave tried to stop the fall, but the huge weight was too much, breaking the bones in his wrist.
And it's just toppled over onto him from there, has it? Presumably.
The ambulance crew have splinted Dave's broken wrist and given him gas and air and intravenous morphine to help him deal with the pain.
How's he doing with the morphine?
Done 15.
Although Dave appears calm, Karen is worried about the potential injuries to his leg that they can't see.
Is it from the lower leg?
What I can only see just around the knee, I can't see below.
Has he got a distal sensation?
Karen is worried the engine could be restricting the blood supply down his leg. This could lead to Dave losing his foot. It's essential they get the weight off before it's too late. The critical care team cover an area of 5,000 square miles in the West Midlands with a population of 5.6 million people.
Ambulance service is a patient breathing.
Every day, the ambulance service receives around 4,000 emergency calls. But when the call is critical and there's every chance the patient won't make it, that's when the trauma specialists are needed.
Going to the big job now. See you later.
The number one call out is to people whose heart has stopped pumping effectively and gone into cardiac arrest.
Coming through a big cardiac arrest in the street.
Yeah, that's all received. We're showing about 7 minutes away.
Every minute the patient's in cardiac arrest, their chance of survival decrease by about 11%. So the quicker someone starts CPR, the more likely it is that the patient will survive neurologically intact.
Obviously, we're hoping when we go to a cardiac arrest that we can get an output back. We've got the Lucas device which we can use, and we've also got drugs that we can give, medication, which obviously increases their chances of survival.
Ambulance service, patient breathing.
No, it was someone who was playing on the court next to us. There's staff around him and they're doing CPR.
Right. I know that they've got access to a defib then. I presume one of the staff members got it today.
Yeah,
they have. Okay, right, we are coming as quickly as we can, okay.
A 72-year-old collapsing with a sudden cardiac arrest is an immediate code red emergency.
Good.
2 local ambulance crews have already been dispatched to the scene. But as fewer than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive, 28-year-old critical care paramedic Aidan is also en route.
The AED's been used, 1 shot's been delivered.
Excellent, thanks, bud.
A bystander has managed to restart the man's heart with a defibrillator, but it could re-arrest at any moment.
I'll go with Lucas in hand.
The Lucas chest compression system allows Aidan to continue resuscitation mechanically even while on the move. It's a vital bit of life-saving kit for the critical care team.
Looks like it's in a squashed court on the top floor.
Arriving at the sports centre, it's now 20 minutes since the call came through.
Excuse me, upstairs?
Yeah, absolutely. It's up on the top floor in the top corner here.
Thank you.
When a person has suffered a cardiac arrest, time is critical. Every minute the brain is starved of oxygen, there is a greater risk of stroke and long-term brain damage.
Hello. How are you doing, everyone? All right? How are you doing? Hello, how are you doing?
4 paramedics are already treating 72-year-old John.
Went to hit the squash ball, collapsed, fell flat on his face. The gentleman over there gave him mouth-to-mouth chest compression.
Yeah.
He started breathing again.
His condition was so serious, it took staff at the sports club 6 minutes and 3 attempts with a defibrillator to get his heart started again.
Has he got chest pain or anything at the moment?
He's got chest pain like global all over.
Okay.
Very funny.
The paramedics have put John on an oxygen mask and hooked him up to an electrocardiogram to give an accurate reading of how well his heart is functioning after the cardiac arrest.
We'll just sit him onto his bum, stand up on his feet, stretch him behind him. Onto your back, John.
Taking charge of the scene, Aidan needs to get John off the floor, onto a stretcher and into hospital.
All right, what's happening? Where's that pain?
If he has a second cardiac arrest, it's his best chance of survival.
When you guys got here, he was GCS 50, a bit agitated, but he was conscious and stuff.
No, he was very combative. He couldn't talk.
Okay, let's just shave all this off for a second where we can, and then get the pads on. It's obviously a high chance of rearresting now.
Although John is conscious, his brain was deprived of oxygen for 6 minutes. It's left him confused.
John?
Yeah.
Where's that hurting, mate?
Yeah.
In your chest?
Yeah.
OK. Does it feel like you've hurt something as you've fallen?
I don't know.
You don't know? OK.
He fell first.
John, are you listening? So, I know that's really painful. We've got to get you up off the floor in order to get you into the ambulance and off to hospital. So bear with us. Let us help you. Just wait a second.
These chest pains are a sign of restricted blood flow to the heart. It's a clear warning that he is in danger of suffering another cardiac arrest.
Match me right. First of all, John, just sit up for us. Not stand, just sit for a second. All right, just wait there. After three, then, John. 1, 2, 3, push. Just have a seat on there.
Sit down, John.
Right, relax your head down to the right. Down to the right. We'll swing your legs up. 1, 2, 3. There we go. Just square yourself up into the middle for us, John. OK.
Having got John onto the stretcher, Aidan is able to manage his airway and restart chest compressions if necessary.
So he's not had any medication or anything yet?
No.
Look, I'm just going to give you a bit of a spray in your mouth. Might make you feel a little bit lightheaded, a little bit dizzy. If it does, just let us know. OK? Your tongue up for me. Lovely. And pop this in your mouth and just chew that around for me.
Aidan gives John a nitroglycerine spray to expand his blood vessels and an aspirin pill to thin the blood to increase the flow around his heart. Now he's ready to start the journey to hospital.
Was it yourself who did the CPR?
There's a few people.
Well, you guys absolutely saved this man's life, so you should go home very happy. Well done. Thank you very much. Guys, nice and steady. Just slow it down just a bit.
Leaving his vehicle at the gym, Aidan will travel with John in the ambulance in case he has another cardiac arrest en route.
Right, it's going to be a bit bumpy, OK?
He won't leave his side until he's safely delivered to hospital.
Nice and steady there.
He's had operation, yeah?
Yes, he will need to.
In Walsall, critical care paramedic Tom is treating 43-year-old Rafa. He needs urgent hospital treatment following a DIY accident with an electric saw that's cut open his abdomen.
Right, we're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
Right, just put him forward. I just want to check his back while we're here.
Yeah.
It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on the ladder. He was doing something around this thing.
Yeah.
And, yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, I don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details for as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we'll try and obviously avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk? No. OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance.
Yeah.
Keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. OK, so up you come. So, at the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've dressed it. I'm going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, okay, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
In an average 12 hours, Tom will attend around 8 life-threatening emergencies, testing his techniques, drugs and specialised equipment to the limit in some very challenging environments.
I've obviously seen the worst in people and the best in people, but I've never really had an issue of taking it home. I've got a very small baby and a fiance, and that pretty much fills my life in the evenings, so. There are days where you have jobs which you get flashbacks. You know, at worst, it's always children, isn't it? But fortunately, I seem to manage quite well with that. I feel like I'm relatively thick-skinned.
For Tom, there's no such thing as a quiet shift, and there's never long to wait after the end of one job until he's needed again. An ambulance has been dispatched to an address in Dudley for a code red emergency involving a seriously ill child, and they've requested critical care backup.
5 minutes away, and we don't know too much information, but we think it's a 10-year-old who's not very well.
Sick children can go downhill very fast. A sudden onset of disease can easily overwhelm their body's vital systems, so early diagnosis is paramount.
Assessments of children are generally really hard, and there's always things that can get missed.
He arrives on scene 14 minutes later.
I went in through the side.
The paramedics have already moved the child into the ambulance.
Hey, buddy, you're going to be sick. Can we have your arm? All right.
It's every paramedic's worst nightmare.
Paramedics.
The boy is presenting advanced symptoms of one of the most deadly childhood diseases.
I think that kid's got meningitis.
Let's come off the oxygen just for a minute, guys. We'll just come off the oxygen.
In Wolverhampton, critical care paramedic Aidan is battling to keep 72-year-old John alive and breathing after he had a cardiac arrest while playing a game of squash.
Sorry, mate. Relax. If someone's got some morphine on this truck, if someone can draw some morphine up, if that's okay. And then we'll work on just getting a posterior ECG, see whether we can get him straight to PCI.
John was without oxygen for 6 minutes before gym staff restarted his heart, which left him confused. But 27 minutes later, he is starting to become more lucid.
John, so I think something's happened to your heart. Okay, so we're going to be taking you to hospital shortly. Okay, you've had a collapse whilst playing squash. Yeah. We'll take good care of you. All right. Okay. Have you ever had a heart attack or anything like that before?
I had a murmur once.
A murmur. Okay, you never had surgery on your heart?
No.
No, okay.
It's now 33 minutes since John collapsed.
Right, John.
Yeah.
We're just taking a little scan of your heart.
Okay.
We need you to stay really still for a second. Okay, nice and still for us.
Aidan needs to run a second ECG to try and find the cause of John's cardiac arrest.
Just 2 seconds.
No, that's all.
Is that a good trace? It's all right?
Yeah.
Yeah. So, guys, we'll head off in just a second. If it's OK, just have someone can drive my vehicle. I can do with somebody else in the back, though, just in case he has another arrest. Yeah, just nice and steady, bud. That'd be great. And there's just going to be a little scratch on your hand, OK?
En route to hospital, John is given 2.5 milligrams of morphine a fast-acting painkiller to help make his journey more bearable.
So, John, we're going to New Cross Hospital at the moment. Obviously, we think there might be something a little bit wrong with your heart at the moment, okay, which has caused you to have this collapse. Okay, so when we get to the hospital, there's going to be quite a few people there who are going to want to speak to you and ask you some questions. Okay, we'll take good care of you. Okay. You say you're winning the game of squash. Are you sure? Do you normally win against this chap? It looked like an elderly gentleman.
So he ain't playing with you again?
No, I'm not playing with you.
40 years?
Yeah.
Crikey. You should be all right by now, then.
I'm struggling to remember what that is.
You've had a period where you've lost consciousness. Yeah. So that would be expected.
Right.
Yeah.
6 minutes later, they arrive at New Cross Hospital, where Aidan delivers his patient safely into the care of the waiting cardiac specialists. For John, it's been a lucky escape.
Obviously had a cardiac arrest, a really serious situation. We're probably in the best situation that we could be now, considering he's had this cardiac arrest. So he's now relatively stable, his heart's beating okay, he's breathing. So they're going to do a few more tests to see exactly what it is which has gone wrong with his heart and treat him appropriately from there. So really happy, really good outcome, and just emphasising the importance of bystander CPR and community access defibrillators, which undoubtedly saved this gentleman's life. So yeah, really good.
Right. 12 miles away in Stourbridge, Dr. Matt Rowley and critical care paramedic Karen Baker are on scene with 40-year-old Dave, whose leg has been trapped under a 1/4 of a ton of Land Rover engine for the past 35 minutes. Every second counts, because without proper circulation, there's a real risk that the leg won't recover and it will have to be amputated.
The leg can just go ischemic. You cut off the oxygen supply, and then that builds up toxins. And then, of course, when it's released, those toxins can then go into the main circulation.
The fire brigade are trying to free Dave using hydraulic lifting equipment, but without a clear view of his trapped leg, it's hard to get the machinery into the correct position without risking even more traumatic injuries.
Right, that's it. Really slow, deep breaths now.
He's had 15 milligrams of morphine and continues to take gas and air to deal with the intense pain.
Right, let me hold it. Good man, that's it. And again. Deep breaths.
With the lift now in position, the firefighters and medics work together.
Just tapping me, folks. My leg's loose now. Just refresh.
Good. Deep breaths, Chris. What's supposed to do this, mate? Go on.
Right, sorry.
Deep breaths, I say, well done.
Oh! Hang on.
Hold down, Chris. Just hold it down.
You're going to help yourself, sir, would you, right? Go on, full mate. Okay. Go on, full mate. Refuse. Go on,
Smash it.
Go on. Go on.
Well done.
There we go.
With Dave's leg finally free, Matt and Karen can assess how badly it's been damaged.
Good man, let's have a little look at it.
How's your pain now that you've come out?
Just a bit, because my foot's been pushed, but I don't feel like it's broke. My wrist is definitely broke.
Yeah. Are you tolerating the pain at the moment?
Yeah.
That's a lot better.
My leg
for you.
feels
All right.
fine.
Good.
Very good.
Toes a bit blue then.
Give your toes a wiggle. Good man, well done.
Miraculously, despite being trapped under a 1/4 of a ton of cast iron, Dave appears to have escaped with just some painful bruising.
Shall we get your chair, do you think? Yeah. We'll pop him in a chair and go over the back.
She gets to shout at you now you're all right.
You'll just have to do it in the house next time, won't you, where it's dry? Be all right. He's been very lucky. It's just sort of pinned his leg to the floor. He's got no serious injuries. People can come off much worse if it had fallen on his femur, his pelvis, his abdomen, his chest. You know, his injuries could have been far more significant.
Dave is being taken to hospital by the ambulance crew, leaving Matt and Karen clear to respond to the next emergency. Over in Dudley, critical care paramedic Tom has just arrived on scene, where a young boy is critically ill.
You gonna be sick? Can we have you around? All right.
He is displaying symptoms of meningitis septicemia, a rare bacterial infection that kills 10% of children who catch it.
Oh, bless him. And sorry, he's 10 years old, isn't he?
Yeah, 10.
Okay.
10-year-old Harry was sent home from school yesterday with what seemed like a vomiting bug. Now a rash has started to spread across his body.
See you in a bit, Harry. Your mum's coming forward with you, okay?
A dangerous sign the disease is advancing fast.
I am 1.2 grams, dissolved in 4 mils, 1.2 grams, 4 mils.
Tom knows if his diagnosis is correct, he doesn't have long to get the infection under control before it enters Harry's bloodstream, where he won't be able to halt it.
Well done, Harry. Well done. Very brave.
We're going to give him an injection to his arm as well. He's going to have 2 injections, if that's all right.
Tom will need to administer the potentially life-saving antibiotic there and then before they get to hospital.
Well done, buddy.
With a son's life hanging in the balance, Harry's mother Laura can only stand by and watch.
Okay, bud. That's the first one. Go ahead.
Hi, Tom Choice Bobby. Just wondered if you had any clinical update whether you required it.
Yes, it's got quite a significant rash along his body. Reduced ECS. Given this Ben pen now.
What actual copy was speech of it?
So that's
600.
That's 600.
Yeah, so he's having 1.2.
Right, then we'll get ready to go. Are you ready, mate?
Tom knows it's critical they get Harry to hospital as quickly as possible, where he has the best chance of recovery.
Do you want me? How about if I do the pre-alert for you, and then you could get going then, couldn't you?
Fine, yeah.
There you go. And I'll say 7 minutes to Russell's Hall.
Immediately, the second dose of antibiotics is in, the crew prepares to leave, while Tom calls ahead to pre-alert the hospital staff.
Hello there, it's Tom, one of the critical care paramedics. Can I pass you an alert, please? A 10-year-old boy. He's had a 2-day history of being generally unwell, nausea, vomiting, not his normal self, very pale, and got a clear blotched rash along his body. They're going to be 7 minutes to yourselves. Obviously, we've got a very high suspicion that he's got meningitis.
For all ambulance crew, dealing with a critically ill child is the most stressful situation they have to face. Thanks to Tom's training and experience, Harry has the best chance of recovery.
What that child needs is a good hospital quickly. The fact that he's got a very typical septicemic rash over his body with the history of him being unwell and deteriorating throughout the day and looking very poorly. Those factors mean he needs antibiotics and he needs a hospital very quickly, and that's all we really did. It's a very rare circumstance you go to a child presenting with those symptoms. What I was very conscious of was not delaying on scene, so that's why I passed the details and let the crew, deliver that care ongoing. They're doing a great job. So, I just might pop and see how they go on.
The critical care team in the West Midlands operates 24/7, 365 days a year. Dr. Katie White and critical care paramedic Ian Locke are on standby, waiting for the next emergency as the all-night trauma response unit.
I think you get used to it.
You do get used to it. I think it gets harder as you get a bit older, I think.
Lockie would know better than me.
In the early hours of the morning, a call comes through to ambulance control. A car has been involved in a high-speed collision. A man is trapped inside with life-threatening injuries. Critical care backup is required.
We've been called to a road traffic collision. We've been asked to attend by a crew in attendance. to a patient who has crushed their car into a concrete wall.
From spinal paralysis to life-threatening internal bleeding, the impact of high-speed collisions on the human body can be devastating.
They are just pulling down the Paramedic road towards the scene now.
Dr. Katie and Ian know they're going to have to get there fast if they're going to save a life.
5098, all will receive.
Eyewitnesses report the car was seen travelling at a high speed down the dual carriageway when it hit the roundabout.
We haven't got many reports of exactly what the injuries are yet, but if the crew are requesting us, then it's likely that they found something that they've got concerns about.
21 minutes after receiving the call, they are at the scene. The police have had to close the road, and firefighters are hard at work trying to free the injured passenger. Dr. Katie is a consultant anaesthetist. She spends half her time in a hospital and half on the road, responding to life-threatening emergencies.
This vehicle has been seen driving at really high speed down here and has basically just gone head first straight into this entire concrete structure.
To get her up to speed on what's happened, Katie is briefed by the paramedic operations manager who is managing the scene.
The driver is out walking around absolutely fine. The front seat passenger, when the crew rocked up, had quite a substantial laceration and head injury. Okay. Still trying to assess for other injuries, just trying to get the pain under control. Okay. It's so distracting for him at the minute. They're just going for a roof removal and to bring him out that way.
Fantastic.
With the injured man still trapped inside the badly wrecked car, a member of the fire brigade is using the jaws of life, a hydraulic saw, to cut the roof away, while another protects him with a blanket as the blade passes inches from his head.
Head injury. Drowned now.
The man is conscious, but he was thrown around the car when it smashed into the concrete wall and may well have sustained serious internal injuries.
So I believe this gentleman has come from down this road, which is quite a fast dual carriageway, hit this concrete bollard. He's actually moved the concrete bollard, shunted it backwards, and interestingly, what we've just seen is that he's actually managed to bend the metal railing behind, and there's a significant drop the other side, so I think it's quite lucky that that concrete bollard's there.
Having examined the crash site for further clues as to how sick her patient might be, Katie wants to assess the driver who managed to walk free of the crash.
I've obviously seen the crash he's been involved in. He's all right, they're just going to get him out. Shall we get you somewhere where I can have a look at you?
Yeah, if you don't mind.
Yeah, I think I agree with that. Come on, let's go down towards the ambulance and I'll just find somewhere to see you.
Satisfied the driver is fine, Katie heads back to the crash site, where with the roof now off the car, Ian is finally able to examine the passenger. 22-year-old restaurant manager Sahil has been fitted with a cervical collar to protect him from aggravating any possible spinal injury. He's also complaining of severe pain in his left arm.
Do you want to take one side and I'll take the other? Get undressed.
Sahil's legs are unharmed, so it will be less painful on his other injuries if he can stand on his own feet and be helped out of the wreckage.
So what we're going to get you to do is to stand up, all right? Turn very gently, we'll support you as you're doing it, and put your bottom kind of in the middle of the stretcher, okay? And then what we'll do is we'll get you to lie down, okay? So you keep your neck nice and still. Where's it hurting? On your arm? Okay, so not touch that arm. Okay, you support that arm and then come up towards me, okay? It's just too sore. Okay, all right. Do you think if somebody was behind you helping you just get up and out of the seat, that might help? Okay, all right. If it's too much, we'll get some more pain relief for you, okay? Okay, do you want me to support your arm? You can't.
If it's a no-go, don't worry, mate. No? Okay.
Shall we
go back to plan B then? We'll go around the back.
Yeah.
Okay, Rich, longboarding down the back.
Sahil's arm is too painful for him to be helped to stand, so Katie and Ian will have to resort to plan B.
Have you got some morphine to draw up? Has he had any? Or has your crewmate drawn any? I think so. I think he's going to need it no matter what, isn't he?
With Ian in charge, the fire brigade start to slide a spinal board behind Sahil before carefully levering him out. Once he's flat, he can be lifted onto the stretcher.
We're just going to take him in the warm. Thank you. Lovely. There you go. No worries. How are you doing? All right? How old are you? 22. 22 as well, okay. My name's Katie, I'm one of the doctors. All right. What's hurting at the moment? Sorry?
Just his arm.
So I think it's that arm.
Yeah.
So the options are, do you want to hold on to that?
Yeah.
I'm just going to cut your clothes, lovely. So we'll get some pain relief in.
Yeah.
Shall we splint it?
Free from the wreckage, Katie urgently needs to examine Sahil. Being thrown around the car, he could have broken a rib and punctured a lung or shattered a bone in his pelvis.
Take a couple of nice deep breaths.
From us, it was nice and steady.
And that feels all right. Okay, lovely. Injuries top to toe. He's got a head injury, no obvious chest, abdo or pelvis injuries. He's got an obviously fractured left humerus with no neurovascular compromise.
Sahil is lucky. Despite the seriousness of the crash, he's escaped with a broken arm and a cut to the head.
He's had some IV morphine, an IV paracetamol and a splint to his left arm. Crew ETA to Sandwell will be 10:10 minutes. Received?
Roger, Katie, yeah, that's all copied. Thanks ever so much. I'll get that past you now.
Thank you.
Katie and Ian leave Sahil with the paramedic crew, who'll transport him to hospital while they prepare for the next Trauma Code Red.
Moves that concrete barrier, you'd think lucky. That patient needs to go to a hospital department where he's going to get a CT scan to have a look to just make sure that there aren't any other injuries that we can't see. We didn't feel he needed to go to the major trauma centre or that he needed us to go with him because I didn't think as a critical care team we were going to add anything more to his care en route. He has had some pain relief. We've splintered his arm and now he just needs to go and have that thorough check over and then he's clearly going to need surgery on that arm.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road, and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a teenager is bleeding to death from a stab wound.
Okay, put a direct on there then.
Don't fight, don't fight.
I know it's scary.
An accident with an angle grinder,
Is it pretty bad? Okay.
He hasn't seen it.
Okay. All right, bud. All right, bud.
an elderly man with a serious head trauma,
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
and a woman has a life-threatening seizure.
MMA, we're going to look after you, okay?
Ambulance service, patient breathing.
He's come off his push bike, he's unconscious, he's breathing, all his teeth are gone and everything. He's in a bad way, his face is hit the road.
And does he seem to be taking regular breaths?
He's breathing very, very fast.
Is the patient in the road?
He's in the road, yes.
How old do you think he is?
I'd say he's in his 60s. Not tall as teeth, certainly.
We've got an ambulance en route, okay, so just keep your eye out for the ambulance.
I will do, yeah.
A local ambulance has already been dispatched to the scene of the accident, but there's a high chance the man has suffered paralysis or brain damage, and his life may be at risk, so critical care backup is needed.
It's coming through with
We'll get back on.
the male in his 60s that's come off a motorbike.
60, that's what we see. Thanks very much. I think it'll be about 8 minutes of it.
Critical care paramedics Will Meadows and Colin Apps deal with life-threatening emergencies on a daily basis. Their advanced trauma training gives the most gravely ill the best chance of survival.
Yeah, the information's come through that he's unconscious. That would suggest that he may well have serious injuries, including injuries to his head.
10 minutes after receiving the emergency call, they are on scene. The local paramedics have taken the injured man into their ambulance.
Sorry, guys. My name's Will, one of the critical care paramedics.
I'm Joe.
Paramedic Joe quickly briefs Will on the details of the accident so he can begin his assessment.
Been travelling on his motorbike, no helmet. Push bike, sorry. Yeah, apparently the front wheel has locked up.
Yeah.
He's gone over the handlebars and full impact on the front of his face.
Okay.
73-year-old Fred, a retired crane driver, was riding back home after visiting his 99-year-old mother when the accident happened.
Bystanders state that he didn't move to start with, so we're querying a period of unconsciousness with him. On our arrival, he's sat up, he's talking, he's fully orientated, he knew where he was, but he couldn't recall the incident of what had happened.
Okay.
Fred's injuries are so extensive, he needs urgent hospital treatment and a brain scan.
We've got a good 2-inch laceration above his right eyebrow. Initially, they said that he wasn't moving.
At the very least, he has concussion, but the memory loss and blackout could be the sign of a much more serious brain injury. It's Friday night, and Dr. Adam Lowe, a consultant anaesthetist at Birmingham's Queen Elizabeth Hospital, is getting ready to start his shift for the critical care team. Tonight, he's paired with full-time critical care paramedic Rob Davies.
It's very hard to predict on any day of the week, but Friday night, people are out and about. Social nights, there'll be more people in the city centre. We may well be busy in and around Birmingham. So yeah, we just get our checklists done, make sure we've got all our kit ready. Hopefully a nice, gentle evening.
12 minutes later, an emergency call comes through to the base.
Hi there, thank you. Good evening. Take you on the job, please. It's going to be a 21-year-old male with a stab wound. The stab wound is 2 inches long on his upper back, query with a knife. It also says on the notes, query offender is outside. There's nothing to suggest police on seeing that.
Last year in the West Midlands, there were nearly 5,000 violent knife crimes. Reducing the number of deaths is one of the critical care team's main objectives.
Whiskey 55, thank you. I'm sure the sector told you as well. Crew is en route. We believe these offenders are outside the property and the patient is inside the property. Details are being passed to police at the moment. All right, thank you. Just to confirm, these police are not yet in attendance, so we believe the offenders to be outside.
Hi Nate, that's received. We're about 2 minutes out, so is there an RVB point over?
With the attackers believed to be nearby, the trauma desk instructs Adam and Rob not to go directly to the house, but wait for police protection.
The 2 people are outside who they think have done it, so they're advising us not to go directly to the house. It's that balance, really, isn't it? Because if it's still an aggressive scene or not secure, we don't want either ourselves or other members of the ambulance service getting injured.
5-5, thank you. Police have just pulled up our location. Just stand by you and on day.
It's 7:38 p.m. Police and ambulance crew arrive at the address, so Adam and Rob get the go-ahead to enter the property, while our camera operator is told to wait outside.
Right.
Oh, all right.
Are you guys on your own?
Yeah.
You are going to need to go to hospital. Let me just see your front, make sure you haven't got any injuries here.
The man is in shock and distressed with a stab wound to his back. It's unclear to Adam and Rob whether or not he knew his attacker.
OK, well, lie down onto your side then. Lie down onto your side.
This on his left side of his back. We're just going to lift and go around the corner then, yeah? Happy?
But he's lucky. After assessment by the critical care team, it's decided whilst it's a nasty cut, it's not life-threatening.
They're not nice incidents to go to, but we go to stabbings fairly regularly, so it's not a surprise that we're being tasked to a stabbing. Unfortunately, it's one of those things, and living and working in the urban environment, stabbings are fairly common and are quite a significant workload for major trauma centres as well.
In the West Midlands, critical care paramedics deal with around 30 stabbing incidents a week.
All right, mate.
And they don't have long to wait for the next one.
We through to the ambulance. Is the patient conscious and breathing?
Somebody stabbed him on the neck.
Okay. Do you know if he's breathing?
He's breathing at the moment, yes. He needs the ambulance quick as possible. A lot of blood coming out.
Is the blood spurting out?
Yeah.
It is, my love, okay.
Oh, my God.
Just keep pressing on his neck, my love. We're coming as quick as we can.
Oh, God. I've never seen anything like this. It's getting worse.
Just keep the pressure on that bleed, love. You're doing all you can.
We're on the way to someone who's been stabbed in the neck, and it's spurting, and there aren't any crews there yet, but they're going to let us know when someone gets there.
The second stabbing of the shift sounds very serious. Spurting blood may mean a major artery has been cut. Adam and Rob need to get there fast, as there's a danger the victim could bleed out and die.
You're clear on my side. They are stopping. Yeah, still stopped.
Police and the nearest ambulance have also been dispatched to the scene. Adam and Rob are just 5 minutes away, but with a serious stab wound, every second counts.
Thank you. Just to keep you aware, we're going to keep having extra calls on this. I think people are panicking a lot on the scene. The doctor's going on and saying he's still bleeding through towels that are being pressure being applied. There's a lot of blood on the floor, and patients are collapsed to the floor.
Yeah, that's great. We're 1 minute out.
A stab wound to the neck could have severed airways as well as arteries. As trauma specialists, it's one of the most challenging situations Adam and Rob can be faced with.
Hi, guys.
Hi, guys. I'm Adam. I'm the doctor on Meadows behind you. You okay? Okay, don't fight. Don't fight.
Adam immediately takes control of the scene, locating and assessing the size and severity of the neck wound.
Can you hear us? Okay.
Right. So quite a lot.
What's wrong with your breathing?
We get the trolley.
Okay, guys.
He's bleeding heavily and struggling to breathe.
Okay. Big. Adam, can you see down there?
The victim is just 16 years old.
Ambulance services, the patient breathing.
In 2012, the West Midlands Critical Care Team and Midlands Air Ambulance joined together to create a specialist trauma response unit.
We've got more experience in dealing with patients who are critically ill or injured.
Let's do a few little checks on you, okay? See how you're doing.
38 doctors and 34 critical care paramedics bring hospital-level care to those most in need.
What we provide is to bring an advanced care team to the patient at the roadside.
I'm just going to have a little look at your foot, okay?
Nice deep breath.
Well done.
By focusing on only the most serious emergencies, their enhanced skills and training often make the difference between life and death.
I think they've proved that with a good trauma network nationally, that you're 60% more likely to survive a trauma.
It's very intense at times and demanding, but thoroughly rewarding. I love my job.
Ambulance services, the patient breathing.
Yeah, he's had his hand in a steel saw.
A steel saw?
Yeah, it's gone straight through. Yeah, I don't want to describe it too much.
How far through his hand has the saw gone?
Dan, you need to move your hand, please, because I need to describe it too. I need to put your hand over your face. Hold on. Oh, very, 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 very bad.
We're getting someone to him as soon as we can. Just keep the pressure on the wound, directly on the wound.
An accident with a power tool can inflict life-altering injuries. An ambulance has been called, but they've requested specialist trauma backup, and critical care paramedic Tom Waters is now en route.
Looks like I'm going to be first on scene, and it's someone, they just said, who's cut through his hand with an angle grinder. DIY gone wrong. The benefit that I think my team and myself can go to is we can hopefully make that assessment to really identify what hospital is best for that patient.
10 minutes later, Tom is on scene. The local ambulance crew are already there.
Hello? Hi, you're right. So what's happened?
He was cutting the door frame there and went straight through his hand.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you?
No, I can go grab it.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else? No. No, so it's just your hand? Yeah. Okay. Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case.
Daniel's in excruciating pain and can't bear to look at the damage he's done.
Let's have a look. All right. Are you all right to come round here and cut his sleeve off? Yeah. I've got some scissors on me, if you want, yeah. Let's have a quick look. Okay. I know, sorry, buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay, all right, bud, all right, bud.
Did he get himself off the floor and self-mobilise into the back here?
Well, no, we took the stretcher out to him, we cleared his C-spine, managed to stand him up and he stood onto the stretcher.
In Walsall, critical care paramedics Will Meadows and Colin Apps have been called to the scene of a serious head trauma.
He's got a full laceration to the top of his lip, complete laceration on his tongue as well, so it's kind of lizard tongue at the front.
Righto.
3 teeth have come out and also laceration to the bottom lip where it's hanging.
Okay.
73-year-old Fred was travelling at speed on his bicycle when he was thrown headfirst onto the road, landing on his face. He blacked out and is now dazed but conscious.
Have we found the teeth, or are they...?
Yeah, we've got 3 of them there,
Okay, so there's 3 missing and you found them all?
Yeah,
okay.
The ones at the back look quite broken as well. There's nothing there I can see that's gone through the palate at the top.
Do you mind just opening your mouth there, sir?
Stick your tongue out again, Fred, for me.
Will checks Fred's mouth to be sure there is no obstruction to his airway or damage to the roof of his mouth.
How are you breathing? Is it okay?
Yes.
Yeah?
Yeah.
Okay. Are you in much pain at all?
No, fine. Just a little bruise there.
Yeah, try not to touch your face there, sir, okay? Because we don't want to contaminate that, but...
Yeah.
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
Yeah.
Yeah. Okay.
Will is most worried about Fred's unseen injuries. His head took the full force of the impact. Head traumas are very unpredictable, and there is a risk he may have damaged blood vessels that could turn into a more serious bleed on the brain.
I don't know what happened, actually.
No, I don't think you're going to have the answers either, Fred. Accidents happen really quick, don't they?
Are you on any blood thinners at all?
No.
No?
No medication, no medical history.
No medication.
Okay. Is it still bleeding inside your mouth?
Yeah, try not to touch it though, Fred.
Yeah? Dr. You know that bit between the top lip and your nose? That's split vertically.
Will calls into the trauma desk to alert them that Fred is likely to need reconstructive surgery on his face.
He's got split lips. He's had 3 teeth knocked out. They're all accounted for. And his tongue's been split as well, sort of in the middle, and quite aptly described as lizard tongue. Got a pulse rate of 98, sats of 96%, T15, and a rest rate of 80. C-spine is clear.
Part of Will and Colin's expertise is to ensure Fred is sent to the appropriate trauma centre that can treat all of his injuries.
Okay, well, I think he's probably going to be needing some max fax specialist.
Fred, what we're trying to figure out is where we're going to take you, where's best to get your face repaired, all right? We're just going to figure that out at the minute, OK?
The Queen Elizabeth Major Trauma Centre in Birmingham has specialist maxillofacial surgeons who can assess and treat Fred's head wounds.
Not surprised.
That lip damage, that filtering damage, that's all from the front teeth, isn't it? Where he's pretty much kissed the floor, hasn't he? So.
You're a tough bloke, Fred.
Oh, he sure was.
Fred, I'm going to ask you again, sweetheart, do you want any pain relief?
Yeah, just a bit of painful here.
Do you want pain relief for you?
No.
No?
No, it's all right.
Fair enough.
Try not to keep dabbing it, baby.
Amazingly, Fred seems to be untroubled by his injuries. He wasn't wearing a helmet. If he had been, it may have deflected some of the force of the blow and given him more protection from serious long-term brain injury.
If you're getting blood into your mouth, just let it dribble into there. Try not to force the spit, just let it dribble out.
As it stands, he will need a brain scan to rule out any potentially fatal clots or bruising.
How fast do you normally cycle there, Fred?
Oh, no.
It's not got a battery in it, has it, your bike?
No. Just an ordinary racer.
A racer?
Yeah.
Yeah, obviously.
Yeah. 40 mile an hour then. Head down.
Patrol desk is going to give them a heads up, so you can be seen sooner rather than later. And if they can't manage Fred, then they'll get him transferred to the QE where you can go. All right.
Lovely.
We'll get out of the way.
I don't know.
Okay.
Take care. Have a nice day.
All right, Fred. You mind how you go, okay? Next time, wear a helmet.
Yeah, I don't know what happened.
All right, guys. Thanks very much. Cheers.
It's a 6-minute journey to hospital. Happy that Fred is stable, Colin and Will leave him in the care of the paramedics, freeing them up for their next emergency call.
Yeah, they seem to be...
Stoic.
Yeah. Very good pain threshold. I would have been crying.
Ambulance service, is the patient breathing?
She's having a fit.
Has she been diagnosed with epilepsy?
I don't know, I'm not sure, sorry.
Okay.
She's fitting really badly.
6-2, we're shown about 5 minutes away. It's reports of a 39-year-old female who's having a seizure in the Merry Hill shopping centre. She's been having headaches, and now today she's gone on to have a fit.
A woman is in the throes of a potentially life-threatening seizure. The critical care team are urgently needed, and critical care paramedics Mike Andrews and Pete Edwards are en route.
That's all received, many thanks.
Seizures are caused by surges of electricity in the brain and are an indication of epilepsy, a neurological disorder that kills 1,000 Britons every year.
Oh, there you go, visual. I'll get the red bag. Do you mind grabbing the drugs?
In the shopping centre, a building society clerk has suddenly collapsed at work and started fitting uncontrollably. Her shocked colleagues called 999. An ambulance crew is already on scene.
Hello, how are you doing? All right. How's it going? I'm Pete. I'm one of the paramedics. This is Mike.
39-year-old Emily is lying unconscious. The ambulance paramedic who has been looking after her updates Pete on her condition.
She was fitting for about 15 minutes before we got here.
Yeah, okay.
She's fitted for 2 minutes 54 while we've been here.
Yeah.
We don't know anything else.
Okay. No history of head injury today or anything like that. So we just got migraines recently, had a seizure today.
Migraine today.
Just today. Okay, all right.
Can you squeeze my hand, sweet? Can you squeeze my hand for me?
As part of his assessment, Pete needs to know if Emily's ever been symptomatic before.
So she is an epileptic, is that what we're saying?
When she was little, she did used to have it, but not recently.
Right, okay, so she hasn't had a seizure for a while, but she has had them in the past.
Probably about this time last year was the last one.
Okay.
People's jaws often clamp shut during seizures, which restricts the airways. If starved of oxygen, Emily could go into cardiac arrest. So Pete needs to administer diazepam, a muscle relaxant, to stop her convulsing.
Should put a bandage on so we don't lose the IV access. Are you able to, is that all right? I'm just thinking that if she starts fitting again, we might get pulled out, mightn't it?
Worried that Emily may start thrashing around when she fits, Pete needs to be sure the IV line is securely attached.
I think now we've got IV access. If she starts fitting again, we'll go to diazepam. Yeah, is that all right? Is that what you're thinking? Yeah. And BM and everything's all right. I think the best thing, we'll get a stretcher.
Yeah.
Get her onto the vehicle. Yeah, okay.
Pete wants to get Emily to hospital, but she takes a turn for the worse.
Is that wound or is that dressing? What's that there?
In Birmingham, trauma doctor Adam and critical care paramedic Rob are trying to save the life of a boy who's been stabbed in the street.
Can you see? Here. Okay, so we've got one behind the ear. Yeah.
Is there anything at the front of the neck?
The 16-year-old has a deep wound to his neck and it's spurting blood.
OK, put a direct on there then.
He's already lost about a litre of blood. The human body contains 5. Adam knows he can't afford to lose much more before he passes out and goes into cardiac arrest.
Right, let's have a look.
What's gonna happen now? Listen, what's gonna happen? Don't worry about them. Look at me. What's gonna happen? I'm gonna get you onto an ambulance, okay? Let me just see if there's any blood in your mouth. Open your mouth wide. Good lad. Okay.
Pressure from his wound is causing the boy to panic and restricting his breathing.
Just calm your breathing. You're doing absolutely fine. I know it might feel hard where you've been injured. Okay, it's away from your voice box. I know it's scary, okay, but you're doing fine. I'm pushing on the side of your neck.
They need to get him to hospital for emergency surgery to repair the blood vessels in his neck, but moving him risks tearing the wound and sudden catastrophic blood loss.
Not time. Okay. Right. Listen, have you got phlegm at the back? Just spit it out, mate.
Just spit it on the floor, go on.
Adam needs to keep the boy calm while maintaining a constant life-saving pressure on his neck to stop the bleeding.
Do you feel able to stand, mate?
Yeah.
Okay, right.
Good lad. Yeah, go on.
I'm not going to let go because I need to put that pressure on, okay? Hold on, guys, hold on. I need to keep the pressure on.
Can you get around, mate? Are you in? So, bump there, that's it. Lay down on the bed.
Okay.
Once on the stretcher, it's now a race against time to get him to hospital.
Fine, mate, you okay? Can we have our bag on the back? Yeah. My hands are going to be a bit tied up just to keep that pressure on. So let's get some straps on. How are you doing? All right, well done. Okay. I need to keep to the QE. Yeah, I need to keep my hands on to stop the bleeding, okay? Because you have bled a reasonable amount. Any medical history I need to know about? Asthmatic? Sickle cell? No? Are you allergic to anything? Right. Okay. Leave a little bit of room for me. That's it. Well done. Good, so a bit brighter in here.
On the ambulance, Adam and Rob can now fully assess the damage the knife has done.
Hi, mate. You're right.
He's bled a fair bit of volume and he's still bleeding past my hand, so I need to get a grip on where that's coming from. Tacky 130, active from the back. It's not anywhere major vascular, but it is actively bleeding. Can I have that Celox? Because I can see where that's coming from now.
Well done, Adam.
Using a gauze coated with a blood-clotting agent, Adam manages to stabilise the wound as much as possible to prepare for the journey.
Nice and steady.
All right, buddy. We're going to sort you out. We're going to take you to the QE. Good work.
You're doing great, mate. You're doing great. Have you got pain anywhere else? No. Okay.
12 minutes after they arrived on scene, Adam and Rob are en route to hospital.
Okay. Rob, do you want to carry on looking at access for me?
Yeah. Give us that arm.
The boy is in such a critical condition, they both need to travel with him, continuing emergency care throughout the 6-mile journey.
I'm going to do the TXA. Yeah. You can do a set of obs.
Arriving at hospital 11 minutes later, Adam delivers his still critically ill patient to the waiting emergency staff.
That's one of the things we are there for. We will just bring some advanced decision-making in terms of which hospital we're going to. We won't go to the nearest hospital. We will travel a little bit further with an unstable patient to get them to the right major trauma centre.
Let's get the stretcher, let's get something to get her out and get that sorted, all right?
In Dudley, critical care paramedic Pete Edwards is fighting to control the seizures threatening 39-year-old Building Society clerk Emily's life.
Emily, we're going to look after you, OK? Let's get a BM done, make sure her blood sugars aren't low. We've got her on oxygen, OK? If she starts really fitting again and it's prolonged, we'll give her some diazomols, and obviously we'll just have to then do a bit of airway maintenance in case she goes. And we'll just pop the SATS probe back on, just keep her eye on her SAT.
Whether or not we have the condition, 1 in 20 of us will suffer a one-off epileptic seizure at some point, and they can be fatal.
Just have a look at that, Mike. Make sure I've drawn up the right thing. It's diazomals and it's in date. Okay. Yeah, 10 milligrams in 2 mil. All right.
9 minutes after the last one with a sedative anti-seizure medication on board, Emily's condition seems to be improving.
Pop her onto a side just for, like, into the recovery position. Yeah.
She is more alert, and her convulsions appear to have subsided.
Yeah, super. Yeah, no, that's fine, that's fine.
But Pete's critical care training makes him ever watchful.
And even in the most severe cases, despite us giving anti-seizure medication, the patient continues to fit, and this can become time-critical emergency.
With the sedation, there's a risk her body could struggle to breathe.
If we don't manage the airway and the brain is starved of oxygen, there is brain damage, brain death, and ultimately cardiac arrest.
The priority now, get Emily to hospital.
Emily, my love, can you hear me okay? Listen, we're going to get you up the hospital and get the doctor to look at you. We've just got to get you onto the stretcher now. I'm just going to pop the oxygen off for now. I'm going to sit you up, nice and steady, just bend in the middle. OK. Right, Emily, lean back against me and just have a moment, because you've been lying down, all right? All right? Do you know where you are? No? It's a bit strange. We're going to help you. All we've got to do is get you onto him and get you nice and comfy. OK, so we'll go on through. We'll have a little rock. So, 1, 2, and 3. Up we go onto our feet. Lovely. Super. Emily, swing your legs up. Let's get you comfy. That's it.
The ambulance will take Emily to the nearest emergency department.
Thankfully, on this occasion, she appears to have made a quite rapid recovery. Some patients will just have one seizure, make a recovery, and they're absolutely fine. But we do go to these patients who recover, and then sometimes it might be minutes later or even seconds later, they'll have further seizures, and this can be quite complicated. And those sort of patients, we get them to hospital where they can be assessed further sometimes, just to make sure there isn't anything more untoward going on somewhere.
How bad's the pain out of 10?
Okay.
10.
In Stourbridge, critical care paramedic Tom Waters is trying to assess the damage to Daniel's hand after he sliced into it with an angle grinder.
Okay, all right, bud. All right, bud. Turn your arm round. All right. You feel me touching you here? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
Wiggle that thumb for me.
Calm.
Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. Don't make you obviously know where it is.
Lucky for Daniel, the blade stops short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands.
Yeah.
And it's, yeah, so I think it's just more soft tissue.
Yeah.
We're going to cover it.
Yep.
And then I think we'll...
If we just take a picture? So
yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Yeah, nice and still.
All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
We're going to bandage that up. It's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. It won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed,
Yeah.
and it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
It's all right, mate. There you go. Just take your time, nice and slow. With no rush. Feel all right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an X-ray, and then it will be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer, we obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully he'll have a really quick recovery.
One of the trauma team's key areas of expertise is paediatric emergency care. Being called to a critically ill child is every paramedic's worst nightmare, so they need to be able to rely on a high level of skills and training.
Ambulance service, is the patient breathing?
Yes, he is.
Are they conscious?
Yeah, yes, he is.
And what's wrong with the patient?
He's just gone completely down the stairs.
He fell down the stairs?
Yes, he's 2.
Top to bottom, was it?
Literally, yes. I think his wrist might be a bit broken.
Oh. And did he bang his head, or has he landed on his
I'm
feet?
not... I don't know how. He landed kind of upside down at the bottom.
Six two. I've got you that it's a 2-year-old that's fallen down the stairs. Is that correct, Emma?
That's correct, mate. Yeah, top to bottom of the stairs, there's fallen 3 metres or more. The child's had a head injury. They are conscious, but they've clearly got a fractured wrist as well.
Roger, that's all received. Thanks, Mike.
In Albury, critical care paramedic Faye Pollock is en route to a code red emergency. A 2-year-old child has fallen 3 metres downstairs, landing on his head.
Just confirming that he has fallen top to bottom of the stairs. He's got a head injury and a wrist injury.
An ambulance has been called, but with the potential for life-threatening injuries, the trauma team's enhanced skills are also required.
Obviously, because it's a child and they have their whole lives ahead of them. The last thing they want to do is be fighting for their life or be disabled in any way because of an accident.
3 minutes later, Faye is on scene, ready to be briefed by the ambulance crew.
This is young Josh, 2 years of age. Mum said he's got this big habit at the moment of doing Superman down the stairs. But she's in here and she's heard thump, 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 thump.
Yeah.
I haven't touched him, I haven't done anything. We literally just got here, found out the history, that's it.
OK, I'll have a chat to Mum. Is he acting as normal now? He seems quiet.
Yeah, he's very hyper, Josh is. He's constantly on the go.
Mum Rachel confirms there has been a worrying change in Josh's behaviour. The worst-case scenario is that Josh has fractured his skull in the fall and has a potentially fatal bleed on his brain.
This is almost as if he's either covering his eyes or his arm's hurting. I'm not sure, but this is unusual for him to put his arm across.
No, we can do that with strangers.
So that might be a comfort thing, the fact that we're right. OK.
Critically ill or injured children can appear to be OK, but then suddenly go downhill.
So the little things like that, only mums know, but it says a lot to us in that.
Yes, definitely.
He's not photophobic.
Josh, can we put something onto your thumb?
No.
Josh needs to go to hospital to be scanned. First, though, Faye needs to take his blood pressure and heart rate, but Josh is too distressed.
He hasn't been sick, has he? He's
No,
not...
no sickness.
No.
If he's gone down the stairs the way he has, you're not going to come down without the mark, are you? No, God bless you, it's just because I've not really been able to get too close to be able to really get my hands on, and the only thing I'm doing when I'm getting near him is distressing.
Makes him more upset.
At the moment,
He has also been guarding his left arm in a way that suggests he might have broken it in the fall.
I tell you what, let's see if we can try a little trick. Can I have Mickey a second? Is that Mickey? Let me just have Mickey for a second. Let's see. Let's put
Oh, don't you want to give me a
That's a good sign that his arms are all right. Yeah. You fell for the trick.
Encouraged by Josh's reaction, Faye tries again to attach the monitoring equipment.
Do you want to pick which finger? Which finger? Should we do it on this one? Do you want to try? Should we try it on your foot? Yeah, come on.
But he's not falling for it.
Mommy, do it. Mommy, do it.
He's certainly a good colour in his lips, good colouring in his face. The fact that he's able to understand and say no are all the signs that I think he's probably just shocked himself. Yeah, distressed himself.
To help soothe Josh, Faye wants to administer some paracetamol.
It'll make you feel better, sweetheart. Good boy. Come on, Josh. Okay. Oh, that's it. Good boy. Well done, Mum. You've done that before.
Paramedic Nikki has a trick up her sleeve to try and take Josh's mind off his troubles.
You're going to catch him.
Distracted by the bubbles, the paramedics manage to attach the oxygen saturation and heart rate monitor to his toes.
Yay, well done, Josh.
Should we see if we can get him over there? You can catch him. Can you reach over that way? Oh, well done.
That has worked a treat. Well done, you. I like footballs. Yes, it's about amusement. Doesn't matter about the patients. Apparently the wounds on his legs are from previous Superman impressions, yeah?
It must hurt, but it doesn't stop him.
It's excitement though, Dad. It's the excitement of going head first down the stairs.
Josh looks to be making good progress, but Faye still wants him to go to hospital to be checked over by the emergency doctors.
Mum, is there anything that you need
No.
immediately?
I've already done it.
Oh, yeah. Oh, God. Wow. That is one prepared, Mother. Bye-bye.
Thank you.
You take care, Mum. Well done for keeping you cool.
She leaves him in the care of the ambulance crew for the 6-mile journey to Birmingham City Hospital.
So you're never quite sure what injuries they may have. And as you saw, he's so scared and he's so anxious, the fact that he's got 3 strange people in the room. He immediately curled up into a ball on Grandma's lap. So there was no way that we were going to be able to assess him for his injuries properly there until the paramedic got an absolute beauty with those bubbles.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road, and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
Oh no, mate. Oh no, we're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
Ready, steady, roll.
Tonight, in a rush hour collision, a motorcyclist is thrown headfirst from his bike.
Mate, can you hear us? He hasn't got a radial pulse. Is he breathing?
A builder's leg is sliced open.
That piece of metal has gone through your skin. You can see muscle and fracture tissue.
A man in cardiac arrest.
Anything on that ECG?
And medics' lives are in danger as they treat a patient with suspected coronavirus.
Hi, guys. We're not going to come in just yet. We're just going to have a chat to you, if that's all right.
Clear guard, breathing filter.
It's Monday morning and the start of shift for Pete Edwards.
I don't know whether I'm a morning person. The first hour or so, I take a little bit to warm up.
He's been working in the ambulance service for 15 years, the last 2 as a highly trained critical care paramedic.
It's just the initial getting up, isn't it? Get a cup of coffee, and that's it. It's all good then. Get the vehicle checked, and then it'll be on to crew welfare, as we call it.
But today, there is no time for any morning cuppa.
Ambulance services, patient breathing.
Let me just go over. Is he breathing? He is breathing.
Are they conscious?
No, he's unconscious. He's bleeding quite badly. His helmet's come off. Got a severe gash wound at the top of his head.
Was it a car versus a motorbike?
Yeah, car versus motorbike.
We're heading towards a patient that has been reportedly hit by a car. The initial call said the patient was in cardiac arrest, so it obviously sounds quite serious.
An ambulance has already been dispatched, but the biker is thought to be so badly injured that Pete and another critical care team are being sent to give life-saving treatment.
Because of the nature of the job, they've also responded Helimed 03 with a medic on board, and that'll be coming from Cosford.
Helimed 03, a Midlands air ambulance, is also scrambled. On board is another critical care paramedic and a trauma doctor, qualified to carry out roadside surgery.
6-2 at scene.
Once on scene, Pete is briefed by the ambulance crew.
Hi, guys.
Hi.
How are we doing?
The helmet came off in the crash.
Has he been speaking to us?
Not at all. We've been like this since we got it.
OK.
21-year-old Curtis has been thrown from his motorbike after colliding with a car. In the impact, his helmet came off before his head hit the road.
OK. He's a bit agitated, isn't he?
Curtis has a severe head wound.
It's quite common when we get this sort of patient. Big head injuries start getting agitated. It's not intentional, he doesn't know what he's doing. He's got a really reduced level of consciousness. He says, you got a radial pulse?
Yeah.
OK, let's see if he'll tolerate an oxygen mask, all right? Let's pull his stuff out. Yeah, that's it. We'll see if we can get him onto the scoop as best we can. His GCS, his eyes are open.
To try and evaluate him, Pete uses the GCS, or Glasgow Coma scale.
Mate, can you hear us?
Usual hazard zone,
OK.
A scoring system that helps describe the level of consciousness. A normal score for speech is 5.
Verbally, he's probably a 2, isn't he?
Further indication that Curtis may have a traumatic brain injury.
We want to protect his brain, and by taking over his ventilation and us doing it instead of him, we can protect his brain and stop it swelling, hopefully. That means putting him into an induced coma.
Breathing automatically with a ventilator will allow Curtis's brain time to rest, calming the swelling. But an induced coma is a risky procedure, usually only carried out in hospital.
Are we treating it as life-threatening this time?
I would say it's got the potential for that, yeah.
The critical care team carry drugs and anaesthesia, normally only used in hospital operating theatres and intensive care units.
We start the interventions that they start in hospital, we start them early and get people to hospital in the best shape that we can.
I'm just going to get some midazolam, and then at that point we'll put them onto my ventilator because it's just a bit better for them, if that's OK.
In cardiac arrest cases, these roadside treatments can make the difference between life and death.
Ambulance services, a patient breathing?
He's passed out. I can hardly feel him breathing.
So he's not breathing very often at all?
No.
You at home?
Yeah, I'm the wife. He's sitting in the car. The next door neighbour's...
OK, brilliant. Put your neighbour on the phone for me.
Hello?
Are we able to get him out of the car and onto the floor?
We can do, yes.
Could you do that straight away for me? We need to start doing some basic life support.
Oh my God, I've never done this before.
I can talk you through it, sweetheart. What I need you to do is start pushing down hard and fast, OK? You need to go 2 times a second.
One,
yeah,
two,
that's
one,
it. Keep going at that
two,
speed. Fantastic job.
1, 2.
No, don't worry about pushing too hard, OK? Keep your arms straight and just keep going for me.
1, 2. The ambulance on its way?
Yes, it's already on its way, darling. I've got them coming to you as quickly as I can get them there. They are coming on blue lights, OK?
8080, male connect west in field zone.
An 80-year-old man is in cardiac arrest. As well as dispatching an ambulance, the code red emergency is passed to critical care paramedic Rob Davies.
Go ahead.
Yeah, thanks for the quick update for you. The patient will take an occasional breath test.
In cardiac arrest, the brain stops sending signals to the heart. It stops beating and oxygen ceases to pump around the body. Only 1 in 10 of hospital cardiac arrest patients survive.
What was the call connect time, please?
Yeah, call connect was at 15:52.
Yeah, 15:52, call time. Yeah, roger.
Without CPR, the brain can be irreparably damaged in just 6 minutes.
The call connect time that I asked for is the time that the call comes into the ambulance service, so that'll hopefully give me a fairly accurate time of when the cardiac arrest was identified. So we're about 10 or 12 minutes into that.
Rob arrives 14 minutes after the call, by which time the ambulance crew are already on scene.
How are we doing, guys? You all right? Yeah, good. How are we doing? Still breathing for himself? Brilliant.
Feeling unwell, 8-year-old Keith asked his wife Monica to drive them home. As they arrived, he collapsed.
Has he prescribed anything?
Yes, but he stopped taking those.
Right.
He doesn't take any medication.
It's all in a quick time frame. He was making some gurgling noises.
Fine.
She's pulled up, gone inside, called for us, neighbour stopped to help.
OK.
So it's all in a quick time frame.
A neighbour gave Keith CPR and got his heart beating again.
He was making some mild respiratory effort during the CPR. 1 shock, return of circulation.
Beautiful. Good work. I'll just go and draw some drugs up, right? So the gentleman's had some bystander basic life support, some chest compressions. On the arrival of the paramedic, he's found his heart to be in a rhythm that he can shock. He's given him a shock through the defibrillator, and now he's got a pulse back. I'm just going to drop a little bit of sedation, just so that we can help with his breathing. Let's have him up and out then.
Although Keith's heart is now beating, there's a danger it could stop again.
And then we'll just place him on there.
Up to 79% of hearts rearrest before reaching hospital.
We got him up and away.
Critical care paramedics like Rob are specially trained to fight those odds.
Just hold his arm there, chap. I can't reach it. There we go. Right. So, plan is then, if somebody can stay in the back with me, what I'd like to do, we can have a little look and just see if we can give him a little bit of sedation and then perhaps just get him onto an eye gel.
To ensure sufficient oxygen reaches his lungs, Rob must insert an eye gel tube down Keith's throat, so the paramedic can control his breathing.
Yeah, if you can chuck a bit of lube on it. Okay, so just go with him on that. Can you do the ECG?
An ECG, or electrocardiogram, records the electrical activity of the heart.
Just give him a little bit of sedation just so that we can ventilate him a bit better. We might look at a bit more of that. Okay, let's have the rest of these clothes off. Anything on that ECG? All right, chap. Georgie, how long to the QE?
About 15 minutes.
15. Lovely. Smooth, but rapid, lovely.
Keith is seriously ill, but Rob's goal is to get him to the nearest cardiac centre alive.
OK. Still going against that a little bit, is he? We can go.
Dr. Matt Rowley and critical care paramedic Tom Waters are starting their shift just as paramedic Kerry Penn-Ashman is finishing hers.
Remember your PPE, remember to wipe over the cloth.
These medics are used to facing danger, but at the outbreak of the coronavirus pandemic, the level has significantly increased.
Following the corona outbreak, how we approach people and how safe we've got to be has just completely changed.
Coronavirus has huge implications for us as healthcare professionals, and it means that we're having to be more careful about how we protect ourselves. We're having to carry quite a bit of PPE, which is personal protective equipment, stuff that protects us against this particular virus.
Without PPE, patients might unknowingly infect the medics with COVID-19, and the medics might infect their patients with a deadly virus.
Because there's a potential that we're going down to the patient's face, that we're going to do things that might mean that the patient is going to get droplets of sputum, any sort of bodily fluid, into our space. So you have a hood that fits onto your face, that goes over the top of your head, and then you have a little portion there that fits onto these sorts of respirators, and you put that on your face, and that gives you quite a few hours, potentially about 6 hours, of good, clean air.
For most of the critical care team, the need for PPE in the eye of a pandemic is a new experience, but not for paramedic Tom.
Did Tom tell you he was out when the Ebola outbreak happened as well? Went out to volunteer, didn't you? Bit of a hero, aren't you, really?
Ambulance services, the patient breathing? Not very well. Are they awake?
No, he's unconscious.
How old?
He's 60.
Is it regular breathing?
No, he's not regular breathing.
Not, okay.
He was just standing at the end of the bar. He just dropped to the floor. He bashed his head on the edge of the bar and he went unconscious.
We're coming as quickly as we can. Don't be alarmed if they come in wearing face masks, okay?
Oh, right, okay.
Please don't be worried about that.
Not a problem at all.
A collapsed man with a suspected head trauma can be a Category 1 emergency.
Yeah, okay, that should have come through now.
A local ambulance is almost at scene, and 30 miles away, Tom and Dr. Matt are en route, but want to know if the patient could be a risk to them.
Have we got any symptoms that are suspicious of COVID for this chap before we go anywhere near?
I believe that was affirmative. He's high risk for COVID. He come through with coughing, Difficulty breathing.
As the patient has suspected coronavirus symptoms, the medics need to wear their PPE, but it takes several minutes to put on. Precious time that could be used treating him.
With the nature of what's going on at the moment, we need to make sure that we protect ourselves with our personal protective equipment, and we'll make a decision from there.
Tom and Dr. Matt might need to save their patient's life while knowingly risking their own.
If we need to do advanced procedures and interventions, we will do them, but we have to balance that against the personal risk and also the risk of not delaying that patient getting to hospital. I think definitely when we get back, we need to get the hoods and stuff out now.
In Albury, critical care paramedic Pete is treating 21-year-old Curtis, who has been thrown headfirst from his motorbike after colliding with a car.
Let's just try and keep him as still as we can, all right?
The impact dislodged his helmet, and he now has a suspected brain injury.
Pop his legs onto there. We'll get him on the stretcher. I think he's a bit hypertensive because I can't feel a radial pulse.
Curtis's condition is so serious that he needs a trauma doctor to put him into a coma to protect his brain. But the air ambulance carrying one is still 8 minutes away.
I think the priority, right, if we can get him on the back of the vehicle and we can do a proper assessment on him, we'll get some access.
Curtis is losing blood from his head, but his weak pulse indicates internal bleeding too.
We'll get full monitoring on him. We'll see what his BP is. I suspect his BP might be low, so it may be that he needs some TXA, all right. Well, if we could get some head blocks on just to keep his head still, all right.
So you've got IV access, that's
Nice one, all right. Is that the TXA, is it? Yeah.
Pete needs to give Curtis tranexamic acid, or TXA, which helps prevent excessive blood loss.
Let's get full monitoring on him if we can, and let's see what his observations are. Let's cut his trousers off and get that skin to skin. All right.
The doctor on board the air ambulance is now just moments away, but Curtis is deteriorating by the second.
Is he breathing?
Yeah.
His respiratory is very shallow. It's obviously quite poorly. Let's get an airway in him if we can. What we might need is a BVM as well once we've got that. So let's get that eye gel in first.
29 minutes after the 999 call, the Midlands air ambulance arrives with critical care paramedic Ryan James and trauma doctor Ben Taylor.
He's collided with that car, or the car's collided with him. It's thrown him off, his helmet's come off in the impact. He's got a big head injury. He's been spontaneously breathing, although he's very shallow. I'm setting up for RSI.
I'll have you set up, carry
yeah.
I'll assist.
All right, yes, please, yeah. Is that all right?
Sort of drugs up.
Yeah. He's had some TXA due to mechanism. Yeah, I've drawn some ketamine off. There's 160 left there, Ben, because he's had 40 out my 200.
The critical care team use a range of powerful anaesthetics, like ketamine, not carried by ambulance crews. They can also perform procedures normally only done in hospital.
We're going to give an anaesthetic just to protect his brain and give him the best possible chance of recovering from his injuries.
Putting Curtis into an induced coma might give his brain precious time to recuperate and encourage any dangerous swelling inside his skull to subside.
So plan to the RSI within the next 5 minutes.
To place Curtis into a coma, he first requires RSI, rapid sequence induction, an advanced critical care respiration procedure that Pete decides is safest to do outside the ambulance.
Because the process is quite risky, we need to have 360-degree access. So if the patient starts to deteriorate for any reason, or we're having difficulty with the airway, we've got good access and we're not sort of fighting over each other.
Dr. Ben then prepares to put Curtis into a coma with 2 injections, a sedative and a paralysing agent.
BVM.
Yeah, on.
End-time.
End-time's on, reading at 3.0.
BP systolic.
The last systolic was 127.
And cycle set.
Cycle set every 3 minutes automatic.
Saturations. Okay, drugs going in now. Okay, fentanyl's in. Ketamine is in.
Okay, everybody ready? Okay, so oxygen mask is coming off. Okay, there's no loose teeth that we've seen. So, got the blade, and I'm going to open his mouth as wide as I can.
We're going to go for the video scope we've got first. Video scope first, with a size 4 blade. Okay, we've got a backup of a Mach 4.
Yeah.
Batteries checked, charging.
Okay.
A laryngoscope, a camera with a screen, allows Pete to look into Curtis's airway for obstructions.
I'm going down the right-hand side of his mouth, sweeping the tongue to the left, and I'm going to walk down as I go and looking for landmarks. I've got the epiglottis, but... OK, a bit of suction, please.
Suction.
There's quite a lot of phlegm at the back of his throat.
What should we like?
OK, I've got a grade 1 view there, I can see the cords.
With a clear path, the breathing tube can be inserted into the trachea.
OK, I think through the cords and the black line, we are 22 at the teeth, Ben. OK, we've got misting of the tube. OK, I'm coming out with the blade. Cheers, thanks.
Curtis is now in an induced coma and breathing with the aid of a ventilator. Dr. Ben and the ambulance crew have done all they can.
It's nice and steady, buddy. Okay.
The importance of our services, we're bringing some of the emergency department to the patient rather than the patient having to wait to get to the emergency department. He's been anaesthetised a lot faster by us getting a doctor quickly to scene, so we've saved him some time and hopefully improved his outcome that way.
Critical care paramedic Alistair McNeil has just come on shift, and romance is in the air.
It is Valentine's Day today, so whether we'll get any squabbles between couples, you never know.
Paramedics are much more likely to deal with violent crime than lovers' tiffs. Last year, there were over 90,000 in the West Midlands alone, many ending with on-street life-saving trauma treatment.
Ambulance service, hi please.
Father has beaten son with a pole, potentially. The son has a hole in his head and he's bleeding. The son's 37 and the father is age 63.
Is there a lot of blood there, can we ask?
The blood is dripping. Brain matter cannot be seen. However, there is a big hole.
A violent assault likely to result in catastrophic brain injury is an immediate Category 1 emergency.
So we're often addressing Dudley, which is coming through as a serious assault. I believe somebody battered with a pole.
With over 14,000 physical assaults a year on emergency workers, critical care paramedics like Alistair are in real and present danger.
There's potentially some suggestion whoever's got this pole and has been battering somebody is still on scene or near to scene. I believe control are liaising with police for finding a standby point for us. 6 over.
When you go to the junction where the Tesco is, probably just pull in there.
Yeah, mate, that's all received. I can picture where you mean, Spitchy, mate. It sounds like there is somebody who's carried out potentially a serious assault.
His patient may have potentially fatal brain injuries, requiring urgent trauma care. But for his own safety, before Alistair can approach the scene, the police must declare it safe.
The annoyance is that we could be delaying care here. The police know far more about this than we do.
That went to an ex-police arrest, Rosk. They were still trying to ascertain a BP.
Critical care paramedic Tom Waters and trauma doctor Matt Rowley are on their way to a collapsed patient displaying symptoms of coronavirus. And they've just heard that the man's condition has become critical.
So there's an ambulance crew on scene with a patient who has had a cardiac arrest. They've resuscitated him and managed to get his heart restarted again. Because his heart has been stopped for a period of time, there's been a lack of oxygen going to his brain, so now that his heart has restarted, he's quite agitated and combative, and they're struggling to manage him at the moment. So we're going to try and intercept them on the way to the hospital and see if we can offer anything, potentially giving this man an anaesthetic to stabilise his condition and transfer him onto the hospital.
They've decided to meet the ambulance en route, as it will save time and ensure the patient gets vital treatment as quickly as possible.
We're going to make a rendezvous point for, we're thinking M42 junction 9 at crew only just leaving scene, so that looks like it's going to be the best place.
The issue that we've got with this patient is they're quite a long way away, so the plan ideally is going to be for them to load the patient on the ambulance if it's safe and then travel towards us and us meet them on the way to hospital just to try and save delaying any time there.
If we're looking to either side, it's going to be aerosol generating procedure. So this triggers for high risk PPE, so that's full high risk PPE. Is it?
Yeah, all right, we are at the RVP anyway. We'll wait for the crew to get to us.
If the patient's heart stops again, Matt and Tom may have to perform life-saving interventions in the closed confines of an ambulance on a patient suffering a killer virus. If so, they'll need their PPE, but it takes 10 minutes to put on.
So what we might do is just open the door, just chat to them, and then make a decision from there. Hi guys, you all right? We're not going to come in just yet, we're just going to have a chat to you if that's all right. From our understanding, it's a cardiac arrest. You've then shocked him, or...?
No shock. No shock. CPR, 2 lots of adrenaline.
Okay.
And we got a Ross back.
Yeah.
Went off again. CPR, about 2 minutes. Come back, Ross. And maintain his own airway since.
I honestly think that by the time we've donned, it's going to take us 20 minutes. So I think if you're happy, we just drive, we'll follow behind you. It's not a point of us not wanting to do it, but I think by the time we've done it, we'll be there. Okay.
Perfect, yeah, I'm over that.
This patient has an airway, is a GCS of 15, is bradycardic. So we are 10 minutes...
Tom and Matt decide the best course of action is to follow the ambulance and not delay its journey further.
So the plan currently is to follow the crew into hospital. Should they need any assistance, then we're here, we'll have to pull over and have to get our PPE on. But ultimately the best thing for this champion is to get him to hospital as quick as possible. Pete, just planning ahead, have you spoke to Heartlands? Because obviously if we put this in as a high-risk COVID, it's going to put the hospital into probably a bit of a state of emergency. Have you had a discussion with Heartlands already regarding this?
I haven't, no, but I certainly can do.
Emergency departments will have a protocol that they now follow for patients that will attend with suspected COVID-19. Again, that is probably going to tie up a significant amount of staff. So yeah, it's probably going to need an RSI on arrival. So again, if you do the high-risk COVID thing, that'll be great, and we'll be there in just under 10.
It's cumbersome and time-consuming to put on, but over the next few weeks and months, the NHS will come to rely on supplies of PPE like never before.
Quite rightly, the ambulance crew that had treated him had put their high-risk personal protective equipment on, which involves a suit, boot covers and a respirator, so that they're not breathing any infected air or any infected air droplets around them. For us to do that would probably take around 10 minutes for myself and Tom to both put our PPE on. So that's 10 minutes wasted where the patient needs to be at hospital and at definitive care. So because the patient was relatively stable at this point, we made the decision not to delay things further, but to escort the crew to hospital with us being available should he need any interventions.
The patient is transferred into a COVID-19 ready cardiac unit.
Numbers at the moment: pulse 115, 14191, End tidal 4.2, stats are 86%, but he's cold.
In Hales Owen, critical care paramedic Rob Davies is en route to hospital with 80-year-old Keith, who is critically ill following a cardiac arrest.
Go 50 to start off with. Does that sound reasonable?
His condition is so serious, Rob phones ahead to discuss his plans for treating Keith.
My plan is to give him some rocuronium just so that I can just better ventilate him.
Rocuronium bromide, or ROC, relaxes the muscles and allows the team to completely control Keith's breathing and optimise the oxygen getting into his body, which is vital after a cardiac arrest.
He's probably 80 kilos, something like that. So 50 seems about reasonable, doesn't it? We got a good end tidal trace.
A correct dosage is crucial.
Essentially, what we're trying to do is buy some time to keep the major organs oxygenated, primarily, you know, the brain, heart and lungs. I'm going to have that out, so some vomit there.
But Keith's condition worsens when he begins to vomit.
Okay.
To prevent him from choking, Rob uses a suction probe to clear Keith's mouth and throat.
Let's just have the... You've got it there, I'll just go down the side. So the end tidal, I think, is blocked now, so you can hear it, yeah.
Vomit blocking his ventilation tube could starve Keith's brain and other vital organs of oxygen.
Just going to get a new end tidal. That's what we're going to do, just going to swap that out. And swap that straight onto there. Okay, so if you vent on that, that one can go on the floor. We've got end tidal back.
Airway cleared, Keith stabilises and now has a chance of survival.
Early bystander CPR and early defibrillation make a massive difference into this patient group. By doing that CPR, we then have a viable heart, which to shock. If nothing was done for that gentleman, I think it would, well, no, it would be a very, very different outcome. What I'd like to do is just strip all this off him. Doesn't need these.
52 minutes after the 999 call, the ambulance arrives at hospital, where Keith is handed over to the team in A&E.
OK, let's go. So he's got pulse back. We tried to sort his airway out. It's quite difficult. He's on a ventilator, and it'll be 24, 48 hours, I think, before they perhaps try and wake him up and see how he is neurologically.
Critical care paramedics undergo 2 years of specialist training for code red emergencies.
Right, we're going to cut this off.
Whether it's resuscitating a person in cardiac arrest or saving someone after a horrific accident.
You're doing a great job. Sit, well done. Nice deep breaths. Nice deep breaths. Keep going.
7062, go ahead.
And a call's just come through that's about to test the trauma skills of critical care paramedic Steve Mason.
Roger. Thanks a lot for that.
Ambulance service, is the patient breathing?
Yes.
What's happened?
Had a cut leg, quite a bit of blood loss.
What's the address?
In a basement construction site. Just cut his leg on something down there.
How much blood did he say he's lost?
Fine.
Don't move in. We'll be there as soon as we can.
Accidents on building sites can be extremely challenging for the critical care teams. Dealing with life-threatening injuries in hazardous environments calls for calm under pressure. An ambulance crew is already on scene, but because of the potential severity of the accident, critical care paramedic Steve is also en route.
62, just arriving on scene. Is there any other resource on scene?
The crew were booked in attendance 1406, over.
Soon after the hoarding, take a left.
OK, cheers, buddy. Thank you.
Arriving at the site of a large office block development, Steve is directed down to the basement level.
Roger, made contact. Let him lift up with his good leg.
Let him don't want to.
There we go. Shift it across onto here.
59-year-old Mark is being looked after by colleagues who bandage the wound with a towel to try and stop the bleeding.
Step back, constantly.
What, and that's... It's not really sharp, is it? Quite sharp?
It's not even sharp, is it? It's just...
Yeah.
Mark was carrying some pipe when he fell 2 meters onto the end of a scaffolding pole, which has sliced into his calf, leaving a wound at least 2 inches deep.
6-2, just a brief update. Got 59. Can't get any signal around here, so...
With no signal underground, Steve is unable to contact the regional trauma desk to ask them to alert the hospital that Mark may need urgent surgery. The ambulance crew carry him out to the back of the ambulance, where Steve can properly assess the wound.
So how did you do it?
Trying to take some pipe down, I just lost my footing.
So you must have fallen down, because it's not that sharp, is it? But because, I suppose, with your body weight falling down, probably caused it to go through your car. Was it spurting, do you know, or...?
Well, I didn't be spurting, but it was coming out pretty fast.
Was it?
He's already lost a pint of blood. If the wound is spurting, it means Mark might have cut a major artery.
Just get ready, just in case it starts spurting.
In Dudley, there are reports of a serious assault, a code red emergency.
Sounds like there is somebody who's carried out potentially a serious assault and could well come back to this address, so don't really want to be in somebody's living room when somebody comes back with a weapon.
Critical care paramedic Alistair McNeil is awaiting police protection before he can approach the house.
6-2 over.
Paramedic police on scene.
I'll go and have a look if they're happy.
Once given the all clear, police give Alistair a brief assessment of the scene. It's 4:25 p.m.
Hello. Are you all right? Have we got a large hole in the head or not?
2 males in here, yeah. One's got an injury to his mouth, looks like he's been smacked in the face.
Right.
And the other one's got the injury I can see is on his head here. Bit of a wound, maybe about that.
Fair enough. Let's come and have a look at him then. Okay.
Yeah, I'm very sorry.
Right, folks, what's happened to you both?
He's got it, I'll kick through the head.
Okay.
Push through the floor and into the head, yeah.
Okay. Any weapons used on you?
No.
No? And is it literally just your heads that have been hit? Were you knocked out when this happened? Can you remember? Can't remember. All right.
Harry says he and his son Alan were attacked on their way home from the pub, but no weapons were used.
How much have you had to drink? Can you remember? Or do you know, Harry? How much have you both had today? Few cans. Look at my nose.
Who'd you sport?
A drunken brawl is not usually a code red emergency, but Alistair is concerned by Alan's demeanour.
And while you've been with him, has he been drowsy like this? Because he's a bit sleepy. Was he like that beforehand because of the alcohol? Or is this...
He's concerned Alan may have concussion, a type of traumatic brain injury.
I guess we're heading towards... Are we popping him to hospital? Yay, nay? I'd say probably yay, because of the drowsy, yeah. Which comes to you, Alan. Are we popping you down the hospital? You're a little bit drowsy with a little bit of a lump on your head.
I'm all right.
Yeah, the problem, Harry, is he's a bit drowsy, isn't he? While we're talking to you and you're aware, he keeps sort of nodding off to sleep.
Yeah, I'm sound as a bar.
We really are not going to win, are we? I don't think we're quite at a point where we can force.
Because Alan is just about conscious, the law says Alistair cannot make him go to hospital.
We'd really like him to get some attention in hospital. It is what it is, I'm afraid. Just can't make them go anywhere. If you can't wake him up at some point in the next hour or two, you need to call 999. Okay? Yeah. Anything that's giving you serious concern, we need to know and come back. Yeah? Make sure you ring us if something changes. Okay.
And so it was bleeding quite a lot. Can you move your foot? Yeah. Good.
On a Birmingham building site, construction worker Mark has lost a lot of blood after falling and ripping open his right calf on a scaffold pole.
And that's the only injury that you've got at the moment,
just that one, yeah.
Colleagues bandage the wound, but now critical care paramedic Steve needs to assess the injury and see if it requires immediate surgery.
I'm going to cut your jeans up a bit, fella.
Okay, mate.
So if you get the bandage ready.
A serious arterial wound can result in death in 5 minutes.
So who did this? Your colleagues?
Yeah.
Yeah, they did really well then to stop.
Yeah, it's very good.
It's a little bit soaked. Okay, so what we'll do, I'll cut it, keep the pressure on it, and then lift, and then have a quick cursory look. You know.
The soaked-through temporary dressing is removed to reveal an 8-inch wide gaping wound.
So let's cover it up so I can see muscle and fatty tissue. You know, it needs some cleaning and hospital. Probably need to go to theatres for it just to get it washed out.
Yeah.
That piece of metal has gone through your skin and gone through the muscle sort of layers.
Yeah.
But you've got good circulation, you've got good movement. So it's just an isolated injury. So we're just going to find out the best hospital to take you.
Yeah.
Confident that Mark isn't at risk of bleeding out, Steve now wants to get him to hospital as quickly as possible.
Hi, Ben, it's Steve. Hi, mate. Yeah, it's not very good. So you got a 59-year-old male patient that he was working up on a little bit of a height, and then he's sort of fallen back. And as he's fallen back, his right calf has gone past a metal sort of sharp object and sort of torn his right calf open. But it's the whole length of his right calf. So GCS of 15, heart rate of 68, blood pressure of 167/73. It does look quite nasty. There's some skin loss, so I'll probably think it's probably best to go to the QE just because of this injury.
Mark's wound may require a skin graft, so he is sending him to the specialist doctors at Birmingham's Queen Elizabeth Hospital.
So you don't want any pain relief at all? You're happy?
With the situation under control, Steve decides to leave Mark in the care of the ambulance crew for the journey to hospital.
Happy?
Yeah, happy, thank you.
Look after yourself.
Thanks a lot, thanks a
Yeah.
lot.
No worries.
All good.
As Steve waits for his next emergency, he can reflect on how much worse things could have been for Mark.
What we need to be worried about is people suffering with catastrophic hemorrhage. So if it had nicked an artery and they hadn't have got pressure on that to stop that artery from bleeding, then things could be a lot worse. But although it does look quite bad, you know, hopefully it'll make a speedy recovery.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
Accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road, and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on you, pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
He's got a traumatic brain injury.
a head-on collision leaves a man fighting for his life.
We have to presume he's bleeding in his brain.
Multiple stabbings in a nightclub.
Hey, right, my name's with the ambulance, mate, all right?
A child has a deadly allergic reaction.
Can you do this medical alert? This swelling is getting more pronounced.
And a motorbike accident leaves a man in agony.
We'll just keep it in mind, open pelvis.
So I've checked the critical care drugs. I'm happy with those.
Lovely.
You've got all your armoury there, Mark.
That's fine, I'm happy.
It's Saturday night in Oldbury, and Dr. Mark Nash and critical care paramedic Colin Apps are about to start a 12-hour shift.
You could argue that Saturday nights people are out more likely to be out having a drink, enjoying themselves, and therefore later on in the evening we might get some fights. Road accidents increase when people have been out drinking, but yes, there are possibly certain patterns to what we might see on a Saturday, but we will go open-minded to everything like we always do and see what happens.
Ambulance service, is the patient breathing?
I'm a taxi driver. I seen a just accident on by the mosque before the roundabout.
Okay, and how many vehicles are involved?
Just only one vehicle. Is there someone in there as well?
Is the person breathing?
1 second. Hello?
Hello, is the patient breathing and conscious?
No. There's one patient. He's grunting. His hands are cold.
Is he awake?
No.
Okay.
Non-responsive.
Is somebody starting CPR?
Yeah.
Is he trapped within the car?
I think you'll need to take the roof off to get him out.
We're coming on blue lights and sirens as quick as we can, okay?
No, that's all right, thank you.
Police, fire brigade and the ambulance service are all en route to the scene. But with a man's life in danger, Mark and Colin are also needed.
Never good, never good. Road traffic accident, I think car versus wall. Good mixture of things coming through, giving us unconscious and giving us cardiac arrest.
It's unclear if the driver has suffered a cardiac arrest and crashed his car, or his injuries are so severe that he has lost consciousness. Either way, he needs urgent critical care.
Immediate, please, some fire to my location.
Sounds a bit panicked.
After we get outside, just confirm, please start on route.
As the other emergency services converge on scene, Mark and Colin must brace themselves for what they will find.
9 on scene. So there are cars in front of this thing, just be aware there's people there, yeah.
Arriving at the crash site, they discover the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring.
Guys, do you want to give some space so we can work with it, yeah?
A large group of passers-by have gathered.
Line across the car, GCS3.
Okay.
So we've ripped tonight.
Cheers.
Got a massive heading.
Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cool. Do you want to do after drugs and yeah, go.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here, can't we? I think we've got enough space here, haven't we?
Yeah, we do it here and then...
As they prepare to perform this major life-saving intervention...
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? No. Mark, they nearly got him strapped on, so we might as well just lift him up onto there.
Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
Cole, you can just stay there and just rotate round, can't you?
Ambulance service, the patient breathing.
I've got two stabbings. Yeah, two stabbings. Where's the stabbed in his back? One of my bitches is past me.
Sir, listen to me. I don't know how to breathe.
Please help me, man. My bitches are dying, man. Please. Hey guys, so yeah, we've got that stabbing, it's a double stabbing in Wolverhampton. We're running at a channel 81. If you guys are clear and start heading that way, that would be great.
Yeah, send it on us, mate. We're good to go. I'll change over channel now.
Police and ambulance have been dispatched to the nightclub where the attacks have taken place. Reducing the number of deaths from stabbings is one of the critical care team's main objectives. So paramedic Ian Locke and Dr. Ravi Chauhan are also en route.
The fight is still going on in this location, so offenders still on scene, fight going on in the background.
For Ian and Ravi, being called to a stabbing is far from unusual. In the West Midlands, there are around 60 stabbings a week.
Well, so the update from there was there's a large fight and reports of 2 people stabbed. The fight is apparently still ongoing. So.
With the attackers still believed to be on scene, Ian and Ravi wait until the police give them the all clear. West Midlands Ambulance Service deal with around 1,000 casualties from road traffic incidents every year.
I've lost count of the amount of fatal RTCs that I've been to in my ambulance service career.
Rescuing the injured in these fast-moving, dangerous environments relies on absolute teamwork from police, fire brigade, ambulance and the critical care team.
We've got 2 OMs running on this and a total of 3 DMAs and yourself over.
Working with other services, you know, that it's not just like one person, it's just like everybody doing like a little bit. And actually, when you sort of step back and you see it all sort of unfolding, it is really good. And like they're like some of the best in the country, so you can't really ask for a better bunch to work with.
Check the battery on this before we do anything else. Battery's full, that's good.
39-year-old Pete Edwards has been part of the critical care team for the past 2 years. Like all team members, his specialist training means Pete has the skills and equipment to treat critically ill patients, often making the difference between life and death.
This is something that you'd see in hospital every day, you know, this sort of equipment, as are these ventilators that we have in this blue bag. You know, it's stuff that's frequently used in hospital, and it's now coming into the pre-hospital setting as well. This can be used to take away human error sometimes, or to free up a pair of hands. You know, you don't have to focus while this is doing what it's set up to do. You can concentrate on something else. So, quite handy.
Ambulance service, is the patient breathing? Yes, he is breathing. A motorcyclist has been thrown off his motorbike, literally in the other lane. His bike at the central reservation is actually in the opposite side of the road, going the opposite way. He's not moved since he's in October. No, and he's still in the other lane, he's still in the middle of the road. He is, yeah, he is. He's in the middle of the road, lying on the floor in the oncoming traffic. He is breathing, but he's in a lot of pain. He can't feel his hip. Pain in his right shoulder, right knee, right hip, and left knee. Has he taken his helmet off? No, we haven't. It's still on. Yeah, is that good? Yes. Leave the helmet on.
A serious motorcycle versus car accident can be a code red emergency. An ambulance has been sent, but critical care backup is also needed.
Minimal protection on a motorcycle. I mean, the head's obviously protected with a helmet, but the rest of the body's exposed, and even the helmet, I mean, with a decent enough impact, it'll still cause a really significant head injury. Some of the things we always look out for with a motorcyclist is a fractured pelvis, because that can be quite rapidly life-threatening. How you doing? All right?
So we've got Ian here.
Ian. Hello, Ian. I'm Pete, one of the CCPs.
So
Okay.
at the moment we're complaining of right shoulder pain. That's
Yep.
his biggest pain area that he's got at the moment.
Yep.
Right hip, left knee.
On the busy A34, a car caused 53-year-old wire fitter Ian to hit the curb, throwing him off his bike across the grass verge, narrowly missing the oncoming traffic.
I know it's painful. I'm ever so sorry. We need to get you out of the cold. We're just going to lift you up, get you in the warm, we'll get you something for the pain, mate, all right? He's come quite a distance off his bike.
The ambulance crew members have immobilised Ian's neck and spine. If he has broken his back, moving him risks damaging his spinal cord and leaving him with permanent disabilities.
I'm just going to let control know what's going on from the scene. 7062. Number of patients is 1 motorcyclist. So far complaining of pain in his right hip and right shoulder. We're just going to get him on the vehicle. We'll do a proper assessment once on board and get you an atmos shortly. Cheers. You all right, mate? Do you know him? Is it your dad? He's all right, OK? We've just got to have assessed. He's been knocked off his bike, but he's talking to us, he's conscious.
Ian's concerned son has arrived on scene. He was called by one of the witnesses to the accident.
Don't worry, we're going to look after him, all right? And we'll get him sorted. Ian, mate. Where's the most...
The slightest movement has Ian screaming in agony. The signs are this could be a very serious injury.
At the moment, I'm concerned about his pelvis because he's complaining some pain in the hip on the right side. If anybody's in a position to start while they're stripping off, get some obs. Charlie, OK. We'll just keep it in mind, open pelvis.
An open book fracture of the pelvis is one of the deadliest injuries because the pelvis contains major blood vessels, which, if damaged, can lead to significant blood loss and cause the patient to go into shock and die.
Yeah.
Your vehicle, can you come to see to the location, please?
Lots of flags.
Critical care paramedic Ian Locke and Dr. Ravi Chauhan are en route to a multiple stabbing. A fight has broken out at a crowded nightclub, leaving 2 victims in its wake.
Right, back away, or we're not going nowhere, yeah?
The scene is too dangerous and volatile for our crew to continue filming, but Ravi's body cam keeps recording the unfolding drama.
Cheers, mate. All right, thanks, mate.
Despite the danger to themselves, Ravi and Ian know if they don't treat their patients quickly, they could die.
He's got 2 stab wounds to his lower back.
OK, yeah.
There's one with a single stab wound to the upper thorax at the back.
OK.
There.
Buddy, hey, right, my name's Pat with the ambulance, mate, all right? Just have a little seat for me, just so we can have a look, mate, all right?
A single knife wound can sever a major artery, causing death within 5 minutes.
I'm blessed, man. I am blessed. You're not blessed, man. You're not blessed. I'm talking here. I'm blessed here. I can walk. I can walk. I'm blessed. I can go home. I'm blessed. I can go home. I'm blessed.
2, there and there.
I know.
OK.
Just sit here for a second. Just sit here. All right. Just lean forward.
Put a little dressing on your back, all right, mate?
I'm all right, man.
Yeah, but...
No, you're not. You just...
Ian needs to check the first victim to determine whether his wounds are life-threatening.
All right, just relax for us, mate. OK.
But it's a tense and aggressive situation.
You don't stab me though, my fucking mum got you off.
Right, not now, you won't. Not now, buddy. Not now. Just relax. All right?
Just look, just listen to us. Just sit down. All right, let us just do what we need to do. All right.
The man has 2 stab wounds and needs hospital attention, but Ian's assessed his life isn't in immediate danger.
You need to go to hospital, mate. You need to go to hospital. All right. You do, mate. You do. Yeah, we're just going to go and look at him, mate.
They move on to find and assess the other stab victim.
You all right, mate?
Okay, fair enough.
Yeah. What's happened? So he's got stabbed right now. Okay, fine. Just take this off for a second, mate.
Whoa, wait there, one.
Huh?
Just 1 second, please.
Yeah, just take the whole thing off.
Yo, who's that?
First, the ambulance.
You can't be touching me like that.
Calm down, man. Just relax.
Boss, you can't be touching me like that.
Okay, all right. Calm down.
The wound is close to both heart and left lung. At the very least, there's likely to be internal bleeding.
Just sit back for a second.
I can't.
Yeah, I need to just have a look.
Buddy, let him do his job. He needs to. He's an ambulance, man.
He's checking that you've got no other injuries.
All right. Are you finding it difficult to breathe?
I can't breathe.
Okay. All right.
I'm sorry.
That's all right. Sorry, I need you to sit back for a second.
Whoa, wait there. No. Boss, it hurts.
Okay, it hurts on this side, yeah?
Hurts.
Okay, take a big breath in.
I ain't from baby.
Okay.
The wound may only be an inch wide, but Ravi knows it could have caused significant damage.
Keep that on for a second. You all right walking out?
I don't know.
All right, I'll get you a chair. If you get a chair, mate. He's got a left side. Okay. He's got worsening, like surgical emphysema, starting to swell around his back.
Okay. Ravi suspects the knife has punctured his patient's lung, a potentially fatal condition that could cause respiratory failure.
Listen, what I need you to do, I need you to get into this chair. Right, we need to get into the ambulance quickly. All right. All right. Sit back.
2 stab wounds, here and here. 1 stab wound right arm. Issues, he's been GCS15 throughout. Last blood pressure was that. He's had a gram of TXA, he's got IV access there. He needs to go on the back, he needs to go up to QE. I'll get some fluids and keep an eye on him.
Outside, Ian hands over 1 victim with multiple stab wounds to the ambulance crew.
Should we go with our one?
Both he and Ravi will travel in the other ambulance with the more seriously injured victim. They take him to the Queen Elizabeth Major Trauma Centre in Birmingham. He is one of 5 stabbing victims that are treated here every week.
I'm feeling a little bit precious this morning.
Starting his first shift back from holiday is critical care paramedic Ryan James.
So I'm hoping for a nice little relaxed shift, ease myself back into the working week. But you know, I would think with my luck, we're probably going to be pretty busy. Because it's always the case, isn't it? If you want a nice ease back into your working week, then it's never going to be. 7062.
Just checking you there, you're checking all of that business over.
Yep, I'm here, matey. Good to go. Look after me today. It's my first day back off my holiday. For safety.
Hello, you speak to the ambulance service. Is the patient breathing?
Yeah, he just walked out and fell right over. He thinks he's broke his ankle.
All
He
right.
slipped on the ground, it's wet.
And it's his ankle that he thinks is broken?
Yeah.
Has he got an obvious deformity?
Have you got an obvious deformity on it? The bone pops out. It's deformed.
Did he say it's going the other
He
way?
says it's deformed.
We will be there to him very shortly.
Okay then.
According to the update I've just received, this gentleman has got a angulated, complicated fracture. Basically, his foot is facing a different way to where it should be facing. And we have got some alternative analgesia that the crews don't carry in the form of intravenous ketamine.
With complex fractures, there is a risk that the deformed broken bones are interfering with blood supply to his foot.
The crew's still not answering, so no updates for you, but I'll keep you running over.
6-2, Roger, all received.
Ryan may have to perform an emergency intervention to realign the foot, an agonising procedure that requires skilled use of high-strength sedatives.
What I shall do is we're just pulling up in about 30 seconds. We'll go and have a chat, see if we can assist.
It looks like he's not going to get the post-holiday easy ride he was hoping for.
Here we go.
The critical care team and Midlands Air Ambulance serves a population of over 6 million people.
Coverage of 13-year-old male, jumped query fallen from an upstairs window.
It was set up following a study on trauma survival rates that found providing hospital-level care and decision-making at the roadside could save more lives.
Bringing the hospital to the patient, that has a really high impact on patients, such that you can get them to hospital in a much stronger and more stable position than they would otherwise have been.
In Wednesbury, 8 miles northwest of Birmingham.
Right, guys, so current plan, you're doing a grand job. What we're going to do in a minute is we're going to go up onto the trolley there.
Dr. Mark Nash and critical care paramedic Colin Apps are trying to save the life of a 38-year-old driver who is unconscious with a serious head trauma and may be suffering from a potentially fatal bleed on the brain.
Colin's going to be on the right-hand side with all the airway kit. What we're trying to do is we'll just move the monitor down to be alongside. Is that okay? Does it make sense? Yeah? Cool, so I'm going to do ketamine, sucks, and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be literally going straight up there, and then we're going to put a tube down him and go from there.
The patient could die at any moment. So Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Cole, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just a bit strange in the end. There's the KY.
Suxamethonium and rocuronium are two fast-acting muscle relaxants that will temporarily paralyse the man's muscles. A mechanical ventilator will then breathe for him.
Just pop them on his chest for now, we don't need them taped in. Are you ready to lift and come onto here? So just come round and spin round. Yeah, head there.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, just take. Left foot. You happy at the top end? Yeah. Cool.
Put a blanket over his chest if we can. Have we got access yet? We need 2 lots of IV access then.
Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes 1, verbal 1, and then it's just motor is varying. I'd say if anything he's doing abnormal flexion, isn't he? Right, monitor eyes, just want to look at the monitor. So just run back on, so we've got ECG on. I'm about to try and do blood pressure again, because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment. Is he fighting on that arm, or is it just...
Yeah.
Trying to take the mask off, I think.
No, just think about the blood pressure, why it's going...
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. OK? Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to. Yep, quarter to. Yeah, I think everything's very cold. It's a heart. Right, this is going to be a token 50. OK, and Sux is going through now.
The dose of Sux will take a minute to take effect.
It's
quite swollen now.
Let me know when you're ready, sir.
Yeah, that's the drug kicking in. Quite slow circulation, right, actually.
As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralysed, unable to even breathe for himself.
Okay, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
It's epiglottis, grade 1. Yeah, ready?
Yeah, he's got just a large epiglottis.
Okay, boogie's through.
Yeah,
ready for the tube?
The effect of the paralysing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
Okay, got the tube. Yep, tube. Bougie out. Okay, right. There you go. Yeah, got good movement. Okay, I'm coming off the cricoid. I'm going to give him some rock because I can feel him moving already.
So you'll have the top tube hold on.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
The rock's in. Okay, happy?
Yeah.
If we can start wrapping him up. So have your fluids at the top there, aren't you? Yeah. So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
Right, happy there, Cole?
Yeah.
Thank you.
Yeah, thank you.
Guys, anyone seen anything we've missed? So we're happy, airway secure, we're breathing nicely.
We are.
Okay, Sats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
All right, we'll get him on the ventilator as soon as he's in the back of the ambulance then. You ready?
Well, how far is it to QE from here?
20 minutes.
Mark and Colin will travel with the patient to provide critical care throughout the journey.
So, male, unclear of the mechanism. There seems to be cars involved.
Mark updates controls so they can alert the hospital.
He has, looks like an open brain injury. As far as we can see, there's an injury to his back of his head, which definitely was a flap of skin, and so he's got a traumatic brain injury. So we have to presume he's bleeding in his brain. So he's now been RSI'd. ETA, I think we're going for 15 minutes. We'll say 15 minutes.
15 minutes out, Mark administers another dose of the muscle relaxant combined with a sedative.
At this moment in time, we don't want him to be straining against any of what we're doing. We just want to keep it nice and steady and flat. The numbers we've got on the screen are perfect for us at the moment, and so if we can keep him just the way he is until we get to hospital, then that's better for us, better for the patient. They can then reassess. Once they've got the scan, they can make a decision what they're going to do after that.
Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
That patient there, the longer he went without his airway being protected and us controlling the oxygen and the carbon dioxide levels, the more damage that potentially could happen to his brain. And what we hope is that by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference. And that is our bread and butter, to go to the sick patients, work with the crews on infrequent events for them, but frequent for us.
12 miles away in Cosley,
hello,
critical care paramedic Ryan has just arrived at the home of a man who has badly broken his ankle. The bones are protruding through the skin.
What's happening? Hi, Adrian.
He slipped outside and he thinks his ankle displaced. He's not sure whether it's gone outwards or inwards.
Sure.
47-year-old Adrian lives with his parents. After he fell, he managed to drag himself back inside and his father called 999.
Not the Sunday morning you were hoping for, then?
No, not really.
No.
Tattoos ready.
I know, I've just noticed you've got your Sunday roast all prepared, ready to go.
Knew we were coming, didn't we?
A complex open fracture must be quickly realigned to prevent serious infections and re-establish blood flow to the foot. It's a procedure Ryan has done many times.
He's clicked it 3 times back into alignment.
Have you actually? What, before these ladies got here?
But today, his skills won't be needed.
Wow, mate, I can't believe you've put that back into alignment. You know. What made you do that, do you think? Was it just hurting too much, or?
Yeah, well, I thought I was trying to get up.
Yeah.
And I thought, I ain't going to get up without it the way it was. So
Yeah. How far angulated was it? How far?
It just stayed like 3 times over.
Really? Blimey. Back old school treatment. I don't even know why you needed us to arrive, really.
Adrian's dexterity has served him well. Incredibly, he managed to manipulate the bones back into alignment himself. A delicate and agonizing procedure that usually requires high-strength painkillers and sedatives.
You're a brave chap. I'm surprised you haven't just called a taxi and hobbled on in there. There you go. Right, hold that on your mouth and nose. Make a tight seal. That's it. And then just breathe that through. I think we'll get you to a state of mind where you're not worried about what we're doing, and then we can pop your foot on that splint and get you splinted. Do you want to do leg or splint?
Happy his pain-tolerant patient doesn't need any advanced pain relief, Ryan continues to give Adrian gas and air to take the edge off any discomfort he may feel.
Happy? I'll go above and below. You slide it up. Okay, I'm just going to lift your leg up now, okay? Nice deep breaths. Nice colour, nice circulation. Keep going, keep going. You've got the old... that's it, on that side. Right, what this is just going to do is just going to tighten up around your leg and go firm, okay?
To stop the bones coming out of alignment on the journey, the ankle is encased in a vacuum splint.
Ready, set, lift. That's it. Keep your arms in, mate. Happy? Ready, set, lever.
Once he's on the ambulance...
All right, ladies, take care. Nice to meet you. All the best, mate.
Ryan is happy to leave Adrian in the care of the crew while he gets ready for his next emergency.
He's clicked it 3 times back into normal alignment before the ambulance crew and myself got there. So pretty impressive, really. Strength of determination of Adrian to be able to have done that to himself, you know, is commendable. You don't see that very often.
Ambulance service, did the patient breathe in?
Yes, it's my 2-year-old daughter.
And what's the reason for the call today?
She cannot open eyes, full swelling on her face.
And it's her whole face that's swollen?
Whole face, especially eyes. Now she wants to sleep.
Okay, if you pick her up, does she go limp or floppy like a rag doll?
Oh, yes, everything.
Yeah. Everything's floppy?
Yeah.
Okay. Has she had a very severe allergic reaction before?
Never, ever.
We have got that help coming as quickly as we can.
15 days later, patient has bilateral wheezes and evidence of facial swelling.
Have we got any history on this address, what they're allergic to, ever?
Can't see anything in the video, mate. No.
No worries.
An ambulance has been dispatched to the address, but a 22-month-old child suffering severe allergic reaction is a code red emergency, so critical care paramedic Steve Mason has also been scrambled.
If they've got facial swelling, you need to be concerned about, you know, the airway being closed and then that compromising the patient, because obviously they haven't got an airway, they can't breathe, and there's some abnormal soundings on this patient's lungs. So a wheeze can indicate that, you know, the airways are quite tight and constricted. So, well, it can be life-threatening.
The child's worried mother has reported her breathing is laboured. Steve knows in these emergencies every second counts.
Ian, have you got any medical problems? No. And have you got any allergies? No. Can you lift your right leg up a little bit? Yeah? Nice, okay.
In Birmingham, Ian, a 53-year-old motorcyclist, has been thrown off his bike, and critical care paramedic Pete has not yet ruled out a fractured pelvis, which could be life-threatening.
Sorry, and your right leg? Is that any pain?
Yes.
Where?
Here.
Okay. I suspect it's more hip at the moment. He's moving all his limbs, he's lifting his legs, which is because we were concerned about his pelvis, but he can lift his legs, which I think that's a positive sign in terms of hopefully it's more hip than it is a true pelvis injury. But where's that pain, Ian, in your hip?
Yeah, you think of that there.
And again for me.
Yeah.
Ian, can you turn this foot, can you turn it to the side? He's able to rotate it. Yeah. And this one, and can you try and lift it again a bit?
That hurts.
Where about? Okay, relax. He's holding his leg up. Okay. So like anatomically, he looks in line, his lung bones are intact. So if anything, since the time we've been with him, his heart rate has actually gone down. So I think if that was pelvis and he was bleeding, his heart rate would go up potentially. He'd look pale and sweaty. He's not. He can lift both legs, and I think the pain is more on the side. So I think that's more hip than it is a open pelvis.
Pete doesn't think this is a life-threatening open book pelvic fracture, but without the benefit of an X-ray, he can't rule out any other fractures.
That's it. Okay, there's probably there's another one out.
Yeah.
Which one, right?
Ian's right arm and shoulder are giving Pete cause for concern.
Bear with us, Ian. Is it the shoulder, Ian, that's the worst? Ian?
Yeah.
It's the shoulder, yeah?
You have to excuse my language, but I ain't gonna be quiet with it.
All right. Ian, bear with us. We're going to get you some pain relief as soon as we can get to one of your arms, mate, all right?
I mean, just in his position,
yeah,
it looks lower than the left
shoulder
at the minute.
He's got severe pain in his right shoulder, so I suspect he's got a fracture dislocation somewhere there.
No.
Details of how the crash happened will help Pete understand his chest and shoulder injuries.
Rough idea, Ian. Do you know how fast you were going when you collided with a car?
No.
And did you go through the air or did you slide across the floor?
No, I hit the cone. As soon as I hit the cone, I lost it. Hit the cone, hit the curb, and then I just fell off the bike.
So you've just fallen off, you didn't go like flying through the air, you don't?
Yeah, hit the curb or I just slid.
And it sent you up in the air, did it?
Yeah, you can see I don't know whether it went over the handlebars or I just couldn't save it.
Okay, no worries.
You can see the scrape marks as I say on the road.
Take a big deep breath in for me. And out.
Ian's breathing is normal, but he has a suspected dislocated shoulder and a hip injury.
Can I just confirm that with you? IV paracetamol 07-2021.
Yeah.
All right. Okay. And we found no other injuries, have we?
No.
Pete contacts control, who will alert the hospital of Ian's arrival.
So yeah, what I'll probably do then, we'll send him to Sandwell, and I think I don't need to travel. Bye-bye. Okay, I'll leave you to it. All right, nice. Thanks a lot. All the best, Ian. Take care. See you now. He did have a lot of protective gear on, which is a good thing, but we still have to be really cautious about injuries and, have a high suspicion. We're a bit concerned about his pelvis, but what we class as a true life-threatening open pelvis fracture, I think that's unlikely in his case. If he's got a shoulder dislocation or a fracture, we're going to get him to the nearest hospital, which is a trauma unit, so they'll be able to deal with him.
Hi, you all right?
Yeah. In Smethwick, Steve has just arrived at the house of 22-month-old Anit,
Every day.
who has a wheezing chest and an increasingly puffy face.
It's got a lot worse in the 10 minutes.
What has she sort of been allergic to, do you know?
All indications of a serious allergic reaction that needs emergency treatment.
The only thing that she's had is Weetabix.
Weetabix, okay.
We don't know anything else to, obviously, what it could be, but she had Weetabix last week and was fine, wasn't she?
Every day she had
Every day, yeah.
Rivina she had every day, so both things normal, never.
Has this happened before at all, or?
No, my other daughter had this reaction before, because she had a reaction from nuts, but not she, never had.
Okay.
After her usual breakfast, Anit's face started swelling and she became worryingly subdued, so her mum rang 999.
So we're happy with her sats at the moment.
Yeah.
So I think what we'll do, because unsure what's going on, if we just head to the children's now, yeah.
Although Anit seems very calm, allergic reactions in children can quickly escalate from mild itch to life-endangering anaphylactic shock.
We'll just take her in.
I just said it is quite a bad reaction, though.
Okay, jump on. So there's nothing to worry about, Mum, okay? We're just going to take him to the right hospital, just for be assessed, okay? Okay. Yeah, whenever you're ready, yeah.
Can you sit there, please, Mum? Is that okay?
If her condition worsens, the best place for Anit to be is in hospital. So Steve decides to get her there as quickly as possible with minimum fuss and intervention.
Oh, dear me. Can you do this medical alert, please?
He will make the 3-mile journey to the nearest children's unit with Anit, calling control to prep the hospital for her arrival.
A 22-month-old. She's developed a sort of swelling to her eyes and to her sort of face area. This swelling is getting more pronounced, so we're just going to alert back into Sandwell, please. And we'll be at Sandwell in how long? In about 5 minutes. And this is unlike her to be nice and calm like this. Yeah, so her eyes have developed since I've been here a little bit, yeah.
It's developed quite a bit.
Yeah. She just looks a bit uncomfortable with all the itching. If that swelling gets really bad, affects the tongue, closes off the airway, then you've got potential airway issue. You've got no oxygen going into that patient. If the airway completely occludes, then, you know, what we need to do is try and act on that quickly to sort of stop that. So you said your other child suffers with this?
Yeah.
What has she been diagnosed with anything at all, or?
She had allergy from birth sometimes.
Nuts.
This kind of allergy I seen on her.
Okay, and does she carry an EpiPen around with her? And no.
She's normally fit and fine, so the thing that just once she had allergy from that.
Okay, no worries.
In the last 5 years, the number of children hospitalised with life-threatening allergic reactions rose by 72%.
I'm concerned that she's got some swelling going on, so she's got a reaction to something. So whatever's going on, you know, it is looking at. She's a bit uncomfortable because she's scratching. You like camera,
Arriving in hospital, Anit is carried through to the waiting paediatric doctors.
Really, with that patient, I think the more we would have done to her, the more stressed she would have become. So, hands-off approach, let her watch something on the phone, and she was nice and calm all the way in. Then we just got her in, which was great.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight,
Were you thrown at all?
Yes.
Yeah?
a man is in agony after a motorbike crash,
Mate, this is the worst thing I've ever done.
a cardiac arrest in a supermarket,
If she has another arrest, you're going to do 3 stack shocks if needs be, OK?
a race against time to save a man's foot,
What we could do is to pull it to a better alignment.
90 degrees isn't good.
and a car crashed into a lamppost, trapping a child inside.
I know it's going to be a bit painful. Just bear with it, be strong, OK?
The critical care team in the West Midlands was set up in 2012.
Police are now on scene saying it is a significant wound.
Thank you, speak soon.
70% of the doctors on the team are consultant anaesthetists, who also work in hospitals all over the region.
We're basically a specialist team, effectively. West Midlands Ambulance Service will respond to between 3,000 and 4,000 calls a day, and the trauma service is commissioned really only 10 patients a day.
There are 34 full-time critical care paramedics who have each undergone a rigorous selection process before a further 18 months training.
So this is our mechanical CPR device, which can take over chest compressions, which is especially handy if we're transporting a patient on an ambulance.
Right. Ready for another thrilling instalment? See what the world has got in store for us today?
40-year-old critical care paramedic Stephen Mitchell, known as Mitch, has been with the team from the beginning.
When you've just enhanced the team or become a team on a job, you know, it does make you proud to be part of the system, and it's a good feeling, I suppose.
Ambulance service, is the patient breathing? Well, I think she's fine. She's suffering to blue. Is she awake? No, she's not conscious. Is her breathing noisy? Yes. I need you to look at her chest for me to see if it's rising and falling regularly. She's breathing, but she's grunting, breathing in the face. Please. We are coming as quickly as we can, okay? Ambulance and siren.
An ambulance has been called to a local supermarket where the woman works, and Mitch has also been scrambled.
Chris has just given us an update about a job that's in Albury. Somebody who's collapsed in a supermarket. I believe it's cardiac arrest. Crew's 5 minutes away, or we're 5 minutes away. They should be there by now. But really, these patients need quick management.
Without a heartbeat, the human body can store between 3 to 5 minutes worth of oxygen. But after that, the brain and major organs begin to shut down.
Night, night. Do you know an approximate age?
With no information to go on, Mitch and the ambulance crew must act fast if the patient's life is going to be saved.
Londis here. You're right.
5 minutes after he received the call, Mitch arrives at the scene.
Okay. You all right, guys? How you doing? Keep her on the side.
Yeah. She's had 3 shots.
Oh, yeah.
No drugs given. GCS on Thursday now.
You've got just a normal O2 mask. That's it. We'll just get a free flow.
45-year-old employee Jo was at work stacking shelves when she collapsed. Luckily for her, the ambulance crew arrived within 2 minutes and managed to restart her heart.
Well done, guys. Okay. She's got a candle in.
Yes, she's got
So, keep her on the side there.
Family behind.
Yeah, gotcha.
And then work colleagues.
The paramedics have hooked Jo up to an electrocardiogram, which shows a very agitated heart rhythm.
That 12 metre, did you see anything on it?
Came back as stemming.
Mitch knows there's a real chance she may rearrest again at any moment.
You okay? Daughter-in-law, are you a daughter-in-law?
Yeah.
Come here. Okay. What's the name?
Jade.
Jade. She's obviously had a cardiac event where they've had to defibrillate her, okay? So she's quite poorly, but we're looking after her. It's good that she's away.
Yeah.
Jo's brain was deprived of oxygen for several minutes, which has left her confused. Mitch needs to calm her down to minimise the stress on her heart.
I need you to sort of be around and talk to her. So if you go behind my colleague there, you just talk to her. Just.
Jo, we've got Jade here for you.
Jade's there.
The team now need to get Jo to hospital as quickly as possible. It's her best chance of survival if she does have another cardiac arrest.
It's the ambulance, okay? Just. Sorry.
Nottingham connecting a multiple request for ambulance and fire brigade.
Yes. Operator, hello, caller. Is the patient breathing?
I'm not sure it's a car crash, but they're stuck in the car.
How many vehicles involved?
Just one.
And what have they actually gone into?
Come off the road and gone into the curb and hit a lamppost. One person stuck inside. He's in a lot of pain.
Is that him screaming?
Yeah.
A major road traffic collision requires all the emergency services working together to save lives.
On it.
The critical care team on duty tonight are Dr. Ben Taylor and critical care paramedic Aidan Brown.
Patient still trapped to the left knee down. He's an 11-year-old male in the back of a
The passenger trapped in the back of the smashed vehicle is a young boy. A child's life is in danger, and Dr. Ben knows there's a lot that can go wrong.
Well, obviously it's a very cold night tonight, it's 4 degrees Celsius. Physiologically, children are different from adults. They get colder quicker. They tend to compensate very well physiologically in terms of blood pressure and so on until they don't. So they've got the potential to become sicker very suddenly.
The police have arrived on scene, along with the fire brigade and ambulance crew. It's a big impact smash, and the boy's condition is deteriorating fast.
It's all received, many thanks. We're just approaching scene now.
The critical care team in the West Midlands was set up to improve the chances of survival to hospital for seriously ill and injured patients.
Monitor on there, oxygen down there.
Yeah, perfect.
Together with the Midlands Air Ambulance, the highly qualified doctors and paramedics fly around 6 missions a day.
03, we are lifted from Cosford.
Covering an almost 6,000 square mile region.
ETA 10 minutes.
On the ground, they rely on a fleet of high-powered vehicles to get to each emergency in the fastest time possible.
Turn right here.
Will Meadows has recently completed his 18 months advanced training to become a critical care paramedic. As this is one of his first shifts, he's being accompanied by Colin Apps.
I've been working for West Mids for about 19 years, but Midlands Air Ambulance for about, I think, nearly 11 years now. Today I'm just doing a support shift for Will, so...
You're my mentor, my role model and mentor.
I'm not getting involved. I'm happy to sort of stay quiet in the background.
Be calm, mate.
Ambulance service, is the patient breathing?
Fuck, yes, this is a serious cut to his right wrist.
Okay, is he conscious?
Yes.
I'll be able to speak to him?
No, he's in.
Can you ask him how he's done this?
Have you looked, mate? Cancel. No, mate.
They're coming as quickly as possible. Is the gone grey in the face? Is he a deathly colour?
Oh, Jesus. Yes. Relax. Yo.
Keep supplying that pressure until we get there. They're coming on a blue light.
An ambulance has been called, but the man's condition is so serious, critical care backup is needed, so Will and Colin are also en route.
So it's a 26-year-old male who's sliced his arm with a tool of some sort, bleeding quite heavily, and apparently he's now unconscious.
If the man's unconscious because he's losing too much blood, he could be about to go into cardiac arrest.
He's had to be put on the floor, legs raised. There's a crew only a couple of minutes away, so we should get an early update.
They're definitely gone. There's 6-2 go ahead.
6-2, I've just spoken to the crew. They say the patient was in the street. They've got him onto the back of the ambulance. He's GCS 15, but looks very grey.
13 minutes after they were called, Will and Colin arrive on scene to be briefed by the ambulance crew.
All right, thanks. My name's Will.
Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm.
Okay.
We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well. Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got the first set of obs done now. Just got him inside, so it's so cold really.
Lovely, lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Joe, we're just going to slide you back, my darling, all right?
In Oldbury, Mitch is working with the ambulance crew to get 45-year-old supermarket worker Joe to hospital.
If you're happy, mate, what we'll do is we'll just pick her up and then someone feed the stretcher straight in so we're not all like... Right. Well done, guys.
She has suffered a cardiac arrest and is fighting for her life.
You okay, Joe?
Her daughter-in-law Jade is also on scene.
Can you just carry on talking to her, Jade? That's it.
She went to the doctor yesterday because she had pain in her arm.
Pain in her arm.
But she couldn't get an appointment. Yeah. You okay, Joe?
So everybody on the side, pull apart slightly as well. So, and then just watch everybody's toes. Okay.
1, 2, 3.
Okay. Advance. Mind your toes.
Go on,
okay, lovely. Okay, so guys, can we go a little bit further over that way, and then put her on her side? Okay, because if she vomits,
It's 26 minutes since Joe had a cardiac arrest, but Mitch knows the window for her rearresting is still wide open.
Have we got a little cushion for her for underneath? You know, can I just insist that we keep her on the defib? Sorry, we need to know what's happening, don't we?
The cardiac monitor contains a defibrillator, which can be used to deliver an electrical shock if her heart rearrests.
You ready for a quick update?
9-8, yep, go ahead. I've got Rocket 11-3, see if that's correct.
Yeah, female, appears to be in her 50s. I can confirm some details, but looking to go to PCI centre. Would you mind just seeing which is the closest? We're thinking city.
6 minutes after he arrived on scene, Mitch has his patient packaged and ready to leave. He radios control to report on her condition.
Yeah, currently GCS 14, heart rate 120, BP 118, 86.
You are in Oldbury, aren't you? So yes, I'd agree that
Probably City is your closest.
Nice one. Cheers, Mucker. Yeah, we'll alert direct and appreciate it for that.
There is a real chance of Joe re-arresting, so Mitch will travel with her to continue giving emergency care throughout the 4-mile journey.
So, guys, what we're going to do is, if she has another arrest, we're going to do 3 stack shocks if needs be, OK? Happy with that?
Yeah, so much.
OK.
We'll be with sorry, Joe. Joe, how are you feeling? Okay.
Liam, just nice and smooth, mate. What we're going to do is we're going to do a cannulation in a bit, but I'll tell you when it is and we'll just pull over slightly, OK? OK, we're just going to put a little needle in your arm, OK, lovely.
The cannula will allow Mitch to administer painkillers directly into her bloodstream, as well as prepping her for immediate treatment at hospital.
Yeah, that's probably from the compressions on your chest. Going to get you sorted, lovely. You're doing really well, OK.
Just 4 minutes later, they arrive at hospital,
Good skills, top marks.
where Mitch delivers his still critically ill but now stable patient to the waiting emergency doctors.
From when we got there, we were met by the crew and they'd reported that they'd just got a ROSC on her, so that sort of really changes the game plan for us. The crew were like literally 2 minutes away, delivered the shock straight away. Her heart was in such a rhythm that it gives the potential to go back into cardiac arrest, and there is like a window of where the heart is like sort of agitated and actually it's quite likely they may go into arrest again. But on the same note, it was like a really good outcome.
Ambulance services, the patient breathing.
Yeah.
Are they awake? Are they conscious?
Yeah.
What's happened, sorry?
We're on a roof. That's what. It's a dislocated.
It's a dislocated ankle.
With a possible break, yeah.
Is he able to talk to me, or?
Yeah, you are to talk.
So what happened? Did someone just tackle you, or did you...
Someone
Does your foot look cold, pale, or blue?
It's covered in a sock and a boot.
Would you say you're in severe pain?
Yeah.
If the man's ankle is fractured, the broken bones could cut off the blood supply to his foot. A time-critical injury that must be treated on scene. So critical care paramedic Pete Edwards is en route.
So we're going to a male in his 40s who apparently has a fractured dislocation of his ankle. There is a crew in attendance who are requesting us, so I suspect it's for advanced analgesia.
The critical care team is trained in the use of high-strength drugs and painkillers, normally only used by doctors so they can carry out procedures in the field.
The ambulance crews carry gas and air or Entonox. They carry IV paracetamol and IV morphine. And then we carry ketamine, which is a much stronger pain relief that gives sort of sedation as well. This is it.
9 minutes after he was called, Pete arrives at the rugby ground.
Hello. Hello, all right.
The ambulance paramedic updates him on the man's condition.
So far, Entonox on the field, onto the stretcher. It's giving me a score about 5 or 6 at the moment, but that's because it's not moving.
Okay.
You can feel sensation all around it. It says it just feels like pressure.
Hello, sir. I can see the problem.
40-year-old Dave was playing a friendly match when a nasty tackle floored him. He was carried from the field by the paramedics and given gas and air for the pain.
Yeah. And we've got a little bit like what looks like some critical skin there, haven't we?
The fracture is so bad that the skin around the ankle bone is dying because of the lack of circulation. If it continues, he could cause lasting nerve damage and he could lose his foot.
Dave, you've obviously got a fractured or a dislocated ankle. Looks like there's a little bit of compromise to the skin because of the bone. What we don't want it to do is the skin over the joint to sort of die or become necrosed, really. What we could do with it really is to pull it to a better alignment.
90 degrees isn't good.
No, I've seen better. I'm going to just uncover you a little bit, all right, so we can get to you. We've got a couple of options, haven't we? We run with it like that on blue lights into the manor, or we could give him a little bit of ketamine and just pull it, you know, to get rid of that critical skin, because obviously that's time critical, isn't it, really?
Administered correctly, ketamine will allow Pete to perform this procedure, putting the broken bones back into position and restoring the vital blood supply to Dave's foot.
Big deep breaths, that's it, all right?
I've got an 11-year-old male in the back of here. He can't get out he's mechanically trapped from the left leg down. We haven't been able to see anything below there.
In West Bromwich, Dr. Ben Taylor and critical care paramedic Aidan Brown are at the scene of a serious car accident.
I'm going to have a quick assessment, Ben.
A child is trapped in the wreckage with potentially critical injuries. With the temperature near freezing, they need to get him out as quickly as possible.
My initial plan at the moment is once that's all released and clear, look at sort of how he's actually mechanically trapped. If worse comes to worse, it goes a bit downhill a bit quickly, what we'll do, we'll get the telescopic ramp down through the middle, rapid.
That's your plan B, smashing. No worries.
I'm just going to have a go round and have a quick look at that leg, all right?
The police, ambulance service and fire brigade are working together to free him.
Hey, bud. How you doing? My name's Aidan. Right, I'm just going to have a quick look at your leg, OK?
When the car smashed into the lamppost, the front passenger seat was forced backwards and is now pinning the boy's leg to the floor.
Mate, can you just cut that your scissors, mate?
Before they move him, Aidan investigates his trapped leg.
Yeah, mate, it might be broken, OK? So bear with me, OK? I'm going to have to move it. I know it's going to be a bit painful. Just bear with it, be strong, because as soon as we get you out, we're going to give you some strong painkillers.
Getting him out without making his existing injuries worse is going to be a delicate operation.
I think we've got enough room to manoeuvre your leg now. Right, what we're going to have to do, mate, I'm going to lift your leg, OK? We're going to have to get you to shuffle to the back there, OK? So if you want to start shuffling your bum across, I'm going to support your foot.
We'll look after you. It'll hurt a wee bit, but
all
we'll
right,
get you
mate, I've got it. I've got it.
Well done. You're doing very well there.
Well done.
I can't move because it's
Clue.
Frightened and in pain, the boy isn't able to move.
Let's just relax it there a second. Just relax it there.
But Aidan can't wait any longer. This is time critical. The boy has now been trapped for over 42 minutes in the freezing cold and is in extreme danger of becoming hypothermic.
We just get the longboard, like...
Can we get your longboard out your truck, please?
Yeah.
Thank you.
Ben?
Yeah.
And a back splint.
And the back splint. Stand by.
Come home, mate. I'm going to have you out in the warm in just a second.
Aidan oversees the fire brigade as they prepare to get him out.
Yeah, don't worry, we'll help you with that. I want you to lie your head down there for me. I've got your foot. Lie your head down. Well done, mate.
Longboard in position, the crew can now manoeuvre the boy out of the wreckage.
You guys happy there?
Once the feet are clear, you can pendulum them in.
OK, and we want him off the longboard, so we'll need to basically hold it at the side and slide him across if we're happy.
Here we go, mate.
Ready, steady, slide. Well done. Second, OK, get you nice and warmed up, all right?
Finally out of the car, the crew lay the boy on top of the stretcher.
Any pain up here? No? OK, any pain down there?
Yeah. Aidan assesses him and confirms his left ankle and foot are badly damaged, with potential multiple fracture and dislocation.
We'll get him in the warm first and we'll do it from there if you're happy.
The blood and nerve supply could also be compromised.
Let's go in there. I bet you're cold now, aren't you? You've been brave lad, haven't you? Very brave. We're just going to go into the ambulance now. You see your fam. All right? Good man.
With a temporary splint on the injured ankle and wrapped in a foil blanket to try and warm him up as quickly as possible, the boy can now be moved into the back of the ambulance.
Any pain in your chest? No?
Aidan carries out a thorough examination of his chest and vital organs to be sure he hasn't suffered any undetected internal injuries.
Ben, I'm happy that it's isolated,
Okay, like
Jib's fib.
Ben, happy for us to clear crew can transport it out, I thought.
The boy is now in a stable enough condition for Aidan and Dr. Ben to leave him in the sole care of the ambulance crew for the 8-mile journey to Birmingham Children's Hospital.
Took a little bit of time to get him extricated from the vehicle. He's got quite severe lower leg fractures, which will need treatment at a specialist trauma centre.
It's difficult when you go to a child at the same age as one that you have at home, and it brings home a little bit closer and breaks through the veil a little bit. It's bad enough for an adult to be in that position where they're trapped inside a crashed car, probably very scared, probably getting cold, probably in a lot of pain. But as a child, it must be significantly worse and significantly harder.
Yeah, it's
quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But it looks like it.
In Birmingham, critical care paramedics Will Meadows and Colin Apps have been called to an accident on a building site.
How old are you, sir, mate?
26.
So it's a tool that sort of dropped onto his arm.
Yeah, plunge saw.
Like a table saw.
Rich was operating a mechanical saw which got caught in his clothing. The wound is so serious, he's in danger of losing some of the use of his arm.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
Last year, there were 54,000 injuries on building sites.
Do you feel sick at all?
Yeah, a little bit. A little bit.
This is a 26-year-old chap who is working on a construction site with what he calls a plunge saw.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm, and he sustained an isolated open laceration. It's quite deep. There's lots of adipose tissue, and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There was no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
What we might do then is pop a little cannula in your arm, give you some paracetamol that way.
How much pain are you in?
Well, it's getting worse as it's going, because I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain.
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
You get that arm sorted, right?
Yes, guys, thank you for your help.
Well, there you go. Take care. Get well soon.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew.
Is it okay to pop on just a little bit of oxygen? Is that all right?
8 miles away in Walsall, following a bad tackle on the rugby pitch, critical care paramedic Pete Edwards is about to try and realign the broken bones in Dave's ankle.
Have you ever had ketamine before?
I've had morphine before.
Yeah?
It's been over 40 minutes since the accident. Deprived of blood and oxygen, healthy tissue can suffer irreparable damage, so Pete needs to act fast to restore blood supply to his foot.
He's got dislocated or fractured ankle or both, but what we've got is what we call critical skin over the joint, and that means that the skin is that tight, it's restricting the circulation to it, and it is quite important that we restore circulation. So it's going to get a little bit of sedation, try and pull it straight and get into the hospital as quick as we can. Have you given it some Danzatron or...?
Before Pete injects the ketamine, it's vital he gives Dave a dose of anti-sickness medication to help him tolerate it.
All right, to give him a bit of that, just... Is that all right? His observations are all right, aren't they? So that's ketamine, 10 milligrams per mil, so in here is 200 milligrams, all right. Have you seen it given before, Stu?
Ketamine?
Yeah, OK, all right, so it's just have to be no sudden noises. All right, I'm just going to go some very small amounts to start with, all right? It's Paul, isn't it? I might just feel a bit woozy, that's all right?
All nervous?
Yeah, don't worry, all right, OK. We're going in very small increments here, just to gauge a response, all right? Giving a really small dosage.
The skilled and effective use of drugs like ketamine is a vital part of the critical care team's training. In the wrong setting, it can cause unpleasant psychoactive disturbances, so keeping a calm, controlled environment is very important.
I'll just give that a minute or so just to work in.
As the drugs start to take effect, Pete closely monitors Dave's reactions.
You hear me, Dave? You hear me?
Yeah, okay.
Yeah? Lift your arm.
Pardon?
Lift your arm.
Lift it.
Yeah. OK, all right.
It's a difficult judgment. Not enough, and Dave won't be able to tolerate the pain of manipulating his ankle.
Just give him a little bit more.
Too much, and it could suffer the adverse side effects.
All right, Dave.
With the ketamine now in Dave's system, he is hopefully oblivious to what's going to happen.
OK. I'm going to give it a little go at that, all right? You might shout.
Pete needs to proceed very carefully. There are 3 main bones in the ankle. They could all be broken. And they all need to be correctly aligned if he's going to reverse the damage done by the lack of circulation.
All right, Dave?
Oh, good.
OK, that's a bit better. OK. That looks a bit better alignment. Skin colour's going back as it... Let's just check for a pedal pulse. So just check. Yeah, the critical skin has gone. I've got a good pedal pulse. Cap refill on his foot, although it is cold. OK. Should we just pop a vacuum splint on that then? And I think that's all good.
It's worked. With the bones now realigned, blood is circulating properly to the foot.
Dave, all done.
Yeah, it's looking better.
So he probably doesn't. He's answering us, but I don't think he knows.
Is that normal for the critical?
Yeah, that's a good indicator that it's kicked in. Yeah. You can pop that oxygen mask back on him just for a sec. I mean, he's satisfying, but.
Pete encases the ankle in a splint to create a rigid support for the journey to hospital.
Now he's relaxed. Look, it's come back. There we go. OK, yeah. I'll put a bit of traction on, and you put that vacuum splint on. Yep. If we just keep our eye on it. Super. So I can see it. Skin's good. OK, that's lovely. So Walsall Manor, innit? I think we're quite happy now. We've got rid of that critical skin, so we could just have a nice steady ride in.
Pete will travel in the back of the ambulance with Dave to keep him under close observation while he's still under the effects of the ketamine.
Are you warm enough?
I think so, yeah.
Yeah? Do you know where you are now? No? It's good stuff, isn't it, that?
Kind of feel floating is the
Yeah,
easiest way
yeah.
to describe the way it feels.
It can take several hours for ketamine to wear off, but Dave shouldn't have any memory of his ankle realignment.
Do you feel like you need anything else for pain, or is it OK?
No, it's okay. It's nice to be able to see that my toe is now actually...
Pointing the right way?
Yeah, upright other than pointing...
Yeah, it didn't look very good, did it?
No.
We're here now, Dave. You'll be glad to know, all right? Bit of fresh air might just make you feel a bit better as well.
Maybe light-headed.
He had a little bit of a moment where he was as high as a kite, for want of a better description. He seemed a bit bewildered, you know, what's just happened and where am I? But after a bit, slowly, he was back to as he was as normally, so it was a good result.
We joined together, didn't we?
On this team, yeah, we did. It's just short of 2 years, isn't it?
Yeah.
In the critical care car, paramedics Sarah Foley and Becky Chappell are on their day shift.
It's nice to have the option to do something slightly more, isn't it?
Yeah, definitely.
I think once you've had a few years as a paramedic dealing with general treble 9 calls, it's nice to specialise your skills and increase your knowledge in one specific area and be able to target it. Variety is the spice of life.
Ambulance services to patient breathing.
Just had an accident. He passed through his foot.
Okay. Are they breathing at the moment?
He's breathing at the moment when he's in the middle of the road.
So what's happened?
My driver has pulled out and he's just been flying. And he's ripped the whole skin of his foot.
Was he on a motorbike or a push bike?
Motorbike.
Is he bleeding very heavily?
Yeah.
Puddle of blood around?
Got up around it. Ankle's literally gone. It's cut open and, you know, struggling to move.
Is there any complete or partial amputation?
I'm not quite sure, sir. I can't see it. Is the ambulance on the way, yeah?
Yeah.
Right, Delta 98.
No, you're not too far from this. Think about 4 minutes. It's RCC, roadside moving car.
That's lovely, thanks Steve, we'll go and have a look.
When a car hits a motorbike, injuries can be complex and life-changing. An ambulance has been dispatched, and Becky and Sarah's enhanced clinical skills are also needed.
All we know at the moment is that there's a leg injury. Somebody's come off a motorcycle, only 2 minutes away.
At the scene, they are briefed by the ambulance crew.
Hi there, you all right?
He was on his bike,
Yeah.
and a car turned right in front of him, and he started to come off the bike, and I think he might have fractured his ankle.
No KOs?
No.
No, and no.
20-year-old Jake, a restaurant assistant, was riding home from the motorbike test centre when he crashed into a car. The impact dislodged his boot, throwing him off his bike onto the road in a hard landing that caused several gashes to his foot and injured his ankle.
You felt down all his back and neck and he's got no pain? Yeah, no, as long as you're happy. Can I just have a quick look at it? Would that be all right? You've got no pain anywhere else? No, okay. Were you thrown at all?
Yes.
Yeah? You got no pain higher up in your legs? It is just
that's my
here?
most concern.
Yeah, all right. We'll be able to wash that once you're on the ambulance. Yeah,
Motorbike versus car, no loss of consciousness, appears to be an isolated ankle fracture. No further resources required. Going to grab him on the back of the ambulance and fully assess him.
You're right.
Ruling out further serious injury, Sarah needs to get Jake onto the ambulance to carefully assess the damage to his ankle and lacerated foot.
I'm going to just let go of that for a moment. All right.
Out of 10, mate. How bad is this hurting you?
Oh, fucking 11.
10 is the worst pain you've had in your life. 10's me cutting your arm off.
Mate, this is...
It's right up there, yeah?
This is the worst thing I've ever done.
Can I cut these before the cannula goes in? Is that all right? It just makes life much easier.
I'm terrible with needles.
All right.
We need to get some pain relief into you, don't we?
There we go.
That's the only way we're going to manage there at the minute.
Okie-dokie. Right.
Before Sarah and Becky treat his injuries, Jake needs a cannula inserted into the back of his hand for intravenous pain relief.
Oh, make me miss it, please.
But Jake has a fear of needles.
Shit with needles, like absolutely terrifying.
Just talk to me about what happened.
I've just come back from Sutton Coldfield because my theory test is tomorrow from my motorbike.
Oh. Okay. How fast were you going?
I was going about 30.
About 30. Okay. Just look down towards me. So you were going about 30. Were you wearing a helmet? Yeah. And your jacket, is that the only jacket you had on, or?
That jacket, I'm on motorbike jacket.
Yeah.
He's just come straight in front of me and I've gone in.
You've gone into the side of him then? Because he's gone in front of you?
I think, yeah, morphine and paracetamol. You're OK with paracetamol? You haven't had any in the last 4 hours? OK, this is just normal paracetamol, but we give it IV and it's actually far more effective giving it IV as a painkiller. OK, so that's 2021 paracetamol running through. OK.
The intravenous drugs have been administered, but are going to take a short while to kick in.
My lovely, I'm going to just lift this up from here, OK?
In West Bromwich, critical care paramedics Becky Chappell and Sarah Foley are at the scene of a motorcycle RTC.
She was trying to work out what he's grazed and took the skin layers off.
As well as an ankle injury, 20-year-old Jake has a badly lacerated foot. The critical care paramedics are concerned the cuts are so deep they may have exposed bone that could become infected.
OK, just that one really.
A bone infection can be difficult to treat and in extreme cases life-threatening.
That's the one, that's a little bit deeper down here. That...
She was trying to work out what he's grazed and took the skin layers off and what could potentially be bone.
Got good circulation, so he's got good pulses. The capillaries. Yeah, let's just put a bit more on. Hurting. Yeah.
12th of July night.
Are you all right to hold that back? Yeah.
Both IV paracetamol and.
Oh, I'll leave that up to you, please.
Yeah.
Oh.
Satisfied that his wounds haven't revealed the bone, Sarah decides Jake needs an X-ray to check for any breaks.
I think, because we've covered the wounds, he's got such a large haematoma here. Yeah. Well, we can try it and we'll leave it open over the haematoma then. Okay. And if it eases the pain, great.
A haematoma is a pooling of blood that has leaked from a damaged blood vessel into the surrounding tissue. To ensure the injury is stabilised and the bone supported, Sarah puts the ankle into a vacuum splint for the journey to hospital.
You ever had one of these before? I've never broken a bone in my knee or anything like this. We're going to do this, we're going to suck the air out of it, so it's going to go real hard around your ankles and it can't move, okay?
Confident Jake's injuries are not life-threatening, Becky and Sarah are happy to leave him in the care of the ambulance crew.
Jake, all the best. OK, we'll leave you with these guys. Obviously, just tell them if you need anything further for the paying. All right.
Thank you.
OK. No, thank you. Yeah, and you guys. He's very lucky, really. He's come off a motorcycle and at the moment it looks like he's just he's got an injury to his foot. So it could have been far worse.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on you, pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a desperate 999 call leads to multiple casualties in a major car crash.
There's people trapped in the car. Covered in blood. And she's screaming.
Where's your worst pain? In your chest?
A woman with asthma suffers a cardiac arrest.
Let's get some adrenaline. We've got 40 seconds until the next rhythm check.
A scooter accident inflicts devastating injuries.
I'll be quite a lot of pain down.
Yeah, we're on it, we're on it.
Get your pain sorted out, mate.
And police, fire brigade and ambulance race to the scene of a stabbing.
Any details as to whether conscious breathing or not? Over.
Heavy blood loss.
Right, that's done. Yeah. So I've got all the amps and kits in here.
At the Queen Elizabeth Hospital in Birmingham, critical care paramedic Ian Locke and Dr. Richard Brown have just dropped off a patient and are restocking their fast response vehicle with drugs and equipment for the rest of the shift.
We're going to try and get all the kit together in good order. So if we are required that we know where the essential kit is ready to go. So organised chaos is how I'd like to describe it.
Hello? I've had a car crash, please, something else. Okay, are you injured? Yeah, really bad, yeah. Okay, all right, listen, what's the address? Where are you? I don't know. Ask somebody to help you. I can't, I'm in the middle of the road. Okay, are you out of the car? Yeah, the car's in the tree. The car's in the tree? Yeah, but my pressure's trapped. How many people are in the car? 3. We found you, my love. Okay, stay on the line. I think I broke my back. Ow! 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 Ow!
4 ambulances, multiple police units and 2 fire engines have been called to the site of the crash.
Mike Delta 98 on channel, leaving QE now.
Critical care backup is also urgently required, so Richard and Ian need to get there fast.
Got one male, 2 females, still trapped in the vehicle. One's possibly got an impalement injury on a tree pivot.
Hi, Delta 98, that was all copied. Our ETA is approximately 3 to 4 minutes, over.
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives.
My Delta 98 at scene, over.
Roger, thank you, all see.
Right, Tim. How you doing? You all right?
On arrival, they are briefed by West Midlands Ambulance Tactical Incident Commander Tim, who is coordinating the whole emergency effort.
So we've got 1 patient that's been ejected on this ambulance here. We've got 3 more in there. 1 has just been dragged out, a male patient. Got some concerns over his airway. Okay. We've got 2 more patients in the back. They're lying on top of each at the moment, so we're just trying to get a plan to get them out.
Okay.
The four friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. One female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have a quick look, because they're pretty much packaged and they can get going.
Okay,
right.
have a quick eye on this one? Yeah.
If we could also look at the chap that they dragged out that's potentially got airway.
Yeah. Hello guys, you all right?
How you doing? You okay?
Hello. What have we got? Very quickly.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an atlas for Worcester, okay?
With her spine immobilised, Ian and Richard decide that she is stable enough to be taken to hospital.
Right, that's patient 1.
An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
That one's going to Worcester. You want to just have a look at the one that's been dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
Is this person with a green shirt on the floor here?
Have a look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about. Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all.
Okay.
Started to put back roll to his side. Quite a lot of blood coming back of his airway.
Okay, so I'll just get around that way. We'll just scoop him on his side if that's where he'll be. Can you open your eyes, my friend?
Oh.
Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
It's going one way, isn't it?
Ambulance services, a patient breathing.
The critical care team and Midlands Air Ambulance cover an area of around 6,000 square miles.
203 lifted with an ETA of 4 minutes.
The largest operating area of any specialist trauma unit in the country.
Just coming into the overhead now.
In a 12-hour shift, they will respond to around 8 life-threatening emergencies. The most frequent call-outs are to serious traumas from road traffic collisions and cardiac arrests.
That is our Lucas chest compression device. It's on the specialist platforms such as the critical care car. I think it's going to be rolled out eventually onto the air ambulances as well.
At the start of his shift, critical care paramedic Pete Edwards is testing a mechanical resuscitation device not carried on ambulances, but included as standard on the critical care team's cars.
It does continuous chest compressions, and it's a machine, it's automated, so you don't get operator fatigue. It frees up a pair of hands on scene if you're short of resources. And also, if we're going to transport the patient to hospital in cardiac arrest, it makes the journey a lot safer because you don't have to have somebody standing up in a moving vehicle doing CPR. It's all in there.
Ambulance services, the patient breathing?
No.
No breathing at all?
No.
Patient male or female?
Female.
How old is she?
How old is she, ma'am? 40, 50?
Do you have access to an automatic defibrillator?
No.
No, okay. I'm going to tell you how to do CPR. Get her flat on the back on the floor.
She's not breathing and her face is going different colours.
Okay, well, the quicker we start CPR, the more chance she's got then, darling. Keep pushing hard and fast until anything changes. So the rate we go in is 1, 2, 3. 1, 2, 3. 1, 2, 3. Keep going.
6-2. That's all received, thank you.
Today, Pete is paired with fellow critical care paramedic Mike Andrews. As well as the critical care team, ambulance crews and a specialist resuscitation unit have all been called to the scene.
It's a patient who's in their 50s, who's in cardiac arrest. That's not been confirmed yet because we don't have any resources on scene, although they should be, just according to dispatch.
With cardiac arrests, time is everything. Every minute that goes by without someone attempting a resuscitation, the chances of survival drop by 10%.
Hello, my name's Mike. I'm one of the paramedics. Okay. Hello, guys. You all right there? How do you...
On arrival, ambulance crew members are working hard to save support worker Vanessa.
Okay, was she asystolic when you got here?
Yeah.
Okay, so first crew, she was asystolic.
Basically, flew out. We've done a few rounds of compression. We're trying to get access because we need to give adrenaline.
She has been asystolic without a heartbeat since they got there.
Are you family? Yeah, is it your mum? Your auntie. What's happened? Is she an asthmatic? Okay. Have you found her in cardiac arrest?
Earlier, Vanessa, who was alone at the time, called a relative to tell them she was having an asthma attack. When she failed to answer her phone after they called back, her nephew went round and found the 50-year-old collapsed. No one knows how long ago her heart stopped beating.
We've got an IGL in airway and tidal's a little bit low, so we just need to go slow on the ventilations.
Okay.
And we're just getting the reversible courses now.
I'll tell you what, I'll come round the top end. Do you want to run it and I'll go to the top end?
All right.
Mike and Pete will now take over advanced life support. Because Vanessa doesn't have a heartbeat, it can't be shocked back into a workable rhythm with a defibrillator. So they will use chest compressions and drugs to try to get it started again.
OK, should we pause for a quick rhythm check so we can all reset and we get our timings right? So, OK, let's check for pulse in 2 places, please.
Nothing here, mate.
OK, so that looks like asystole to me. Back on the chest then for 2 minutes, and let's see where we're going.
After each cycle of chest compressions, Pete checks to see if there is the slightest spark of life.
Hello, how you doing? Hello there, all right, how's it going?
Anything you want us to be doing?
We've got this lady, known asthmatic. She's found a relative.
3 members of the West Midlands care team, specialists in accidents and resuscitation, arrive on scene.
So, just done a pulse check. We're 1 minute 20 to the next pulse check, but she's in asystole, so we're going to start trying to redress some reversible causes. OK, all right, so have we got any access? OK, let's get some adrenaline and the glucose set up if we can. You got in glucose, yeah? You're doing the adrenaline. OK.
Adrenaline and glucose are stimulants that could trigger activity in Vanessa's heart.
Everybody, just a second. 15 seconds from next pulse check. We're going to take a little break in CPR and get the Lucas device on. So 8 seconds, if everybody just stands back while the care team get the Lucas device deployed. So 3, 2, 1, OK. Quick pulse check, rhythm check. It's still asystole.
After 18 minutes of manual CPR, the Lucas machine will now take over chest compressions.
So we've got continuous CPR going now.
The entire team are doing everything they can, but with Vanessa still showing no signs of life, Pete knows they don't have much time left to save her.
Can we just do a pulse check? What have we got there?
Write it all down.
OK, there's no pulse.
OK.
Are you happy on your side or lying on your back?
In Redditch, Ian and Richard are at the scene of a serious road traffic accident.
Can you lift this leg for me?
The driver is on the ground, semi-conscious. The full extent of his injuries is still unknown.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go. Just roll onto your back, my friend. Go onto your back. There you go.
With the help of the fire brigade, the man is rolled over.
Guys, are you OK just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
on the... You stay there, bro. We're going to get you on the ambulance, OK? Well done.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car.
How you doing? Okay.
Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we've just had a quick once over the ambulance. She's empty trauma tool negative, so we said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers.
Scoot, please.
One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast.
If you get to the point we want to intervene further, we'll just give a shout, pull over, jump on in the back, and then we'll go from there. Is that all right? Okay. Happy? Yeah. Yeah.
Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, he looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Arriving at hospital, Ian and Richard deliver their critically ill patient to the waiting emergency doctors.
So it's quite a different job, that from what you're probably used to dealing with. So significant ITC with quite a few patients.
After a complex multi-service job, everyone can take stock and learn valuable lessons for the future.
It's very important, so particularly that job where there's lots of people there working and lots of things going on. It's quite useful to, at the end, go through what happened at the job, what we did, what could have been done better, and it's quite useful for the crews, for their learning, because most of the regular ambulance crews don't go to jobs like that very often at all, probably once a year, if that.
It's Wednesday night, and Dr. Scott Beattie and critical care paramedic Will Meadows are at the beginning of a 12-hour night shift.
Just ahead, turn left.
Dr. Scott is a consultant in emergency medicine at Salford Royal Emergency Department in Greater Manchester and does a shift a week for the critical care team.
I can't think of a more textbook definition of a team that, in terms that everyone comes from a different background, but we're much better as a unit because we bring all our different skills and it all just comes together. It's a very dynamic team.
Will has recently completed his advanced critical care training, and this is his first night as part of the all-night trauma response unit.
This is my first shift. First sort of solo shift with the doc. So Scott's got his hands full tonight. Au contraire.
Ambulance service, please.
Hello, can you have assistance to kitchen line for a stabbing?
A stabbing, okay. And what's the address to come to?
Near the top of kitchen line, bleeding heavily to the chest. Man is barely talking. He's just found him.
Stab to the chest, was that?
Yeah, stab to the chest.
Attacker on scene?
Not known. He's a passerby that's come across him.
The police have requested an ambulance to attend the scene of a reported stabbing. With a man's life in danger, critical care backup is urgently needed.
No.
Got stabbing in the chest.
Yeah, any details as to whether conscious breathing or not, over?
Nope, there's not even a vehicle assigned to it. I don't think they've even got the location quite right yet, but heavy blood loss.
82, over.
Last year, there were almost 4,000 knife crimes in the West Midlands. It's an ever-increasing part of the critical care team's workload.
So reports of a stabbing of a male stabbed in the chest with heavy blood loss, but we're not sure of any other details at this stage. But certainly heavy blood loss suggests that something fairly significant has been damaged. Even the smallest of little wounds could go in a very long way and hit some fairly vital organs. So quite complex, quite worrying.
If the blade has cut an artery or punctured a major organ, the man could bleed out and die in minutes. Scotland will know that the sooner they get there, the better chance they have of saving his life.
Airway is good, so
Airway's good with the eyes, mate.
We're doing hypoxia. Yeah. Hypovolemia, we've got fluids.
That's glucose running.
Okay, so we're doing the BM as a metabolic disorder.
In Edgbaston, critical care paramedics Mike Andrews and Pete Edwards are leading the team fighting to save 50-year-old asthmatic Vanessa, who was found collapsed with no heartbeat.
We've got 40 seconds until the next rhythm check.
But after 20 minutes of fighting to get her heart started, there is still no sign of life. Several of her family members are in the next room.
Will this move under her legs? Let's raise her legs, see if that helps anything. Okay, so if you push something under there, or that little table, whatever's easiest.
By raising Vanessa's legs, Pete hopes gravity will send blood closer to her heart and may prompt it to restart.
That's it, love. Okay, that'll do. And let's just keep her legs there. I know it's created a bit less room, but we've raised her legs a little bit. All right.
No one is sure how long before Vanessa was found her heart stopped beating, and time is running out for them to save her.
Can I just stop us there? We're just due next pulse check. Okay, that's pulse check there. No adrenaline on this cycle. Be the next one.
So there's no pulse at the carotid.
And end tidal is 1.3 despite 20 minutes of good ALS. But can somebody have to have a chat with family regarding that, or is that all right? And I'll continue with timings. Is that all right? Okay. Yeah, let's continue.
Because they attend only the most serious cases, critical care paramedics see death day in, day out.
Is anybody in a position to find out the time of the call?
Their hardest decision is always when to stop trying to save a life.
So, what we're just thinking is, we've got an unknown downtime. We have had some CPR on crew arrival, but we don't know when she's actually arrested, and blue on arrival apparently. So the things that are going against us, she's not been in a shockable rhythm at any point. We've done 20 minutes of ALS.
20 minutes on the monitor.
Okay. Do we need to reconsult family, or are you happy with that, Lorry? Has anybody got any objections to stopping? Okay, is everybody happy to stopping? Recognition of life extinct. By my time, that's 16:13.
A crew member informs Vanessa's relatives that despite their best efforts, she has died.
Shut the door. Yeah, definitely. So, on lift, ready, step, lift. You took it? Yeah, put it up there right now. It can be emotionally draining, I think, but at the same time, you have to sort of detach yourself from the emotional side of it if you can. There will always be jobs where you can't detach yourself. There'll always be those jobs that always stick in our minds that we all keep locked away somewhere, the jobs that, you know, you can't really forget. But I think you've got to be quite thick-skinned.
There are more than 30,000 out-of-hospital cardiac arrests in the UK every year. The overall survival rate is just 1 in 10. In Wolverhampton, Dr. Scott Beattie and critical care paramedic Will Meadows are en route to a stabbing. A passerby called police after he found a man with a serious chest wound lying by the side of the road.
4665, thank you. Verbal details of hospital.
Is there an RVP, or they haven't told us one, have they?
With violent incidents like stabbings where multiple units are scrambled, police usually arrive first and secure the scene, while ambulance and critical care crews head to a meeting point nearby.
Just to confirm with you, you will be the first ambulance resource in attendance. We've had nothing come back from police.
Mike Delta 98, sorry, just to clarify, are we heading to an RVP or can we go straight to scene over?
Not able to get an update from police. I'll take us straight to scene. Police are in the vicinity.
98, yeah, perfect. We have approximately 4 minutes left to run over.
For the critical care team, reducing the number of deaths from stabbings is a top priority.
Nothing Seaton, not clear.
Their skills and experience with treating major bleeding and shock are vital when it comes to saving lives.
Okay, that's received, thank you. Our police first, are you female contact with her? No, we're going to say either. They are just in the area, so if you could just see if you can locate and call back on her. No problem.
The ambulance crew has just arrived on scene, but with no sign of the incident or police, they radio back to control for further instructions. It's now been 14 minutes since the emergency call was made.
Whiskey 55, liaise with police. It looks like it may be a malicious call. They're calling the caller back and trying to make contact with them.
At the moment, the impression from the police and the first crews on scene is that, yeah, it's a malicious call. Unfortunately, it's not uncommon. We get a fair few. And it's just obviously a significant waste of resources.
You have reached your destination.
Right, I'm going to send you down. I think if there's anything, we'd have found it by now.
Yeah, 98, understood. Oh. Yard.
With no sign of any stabbing victim, the police have decided that it's been a hoax call and a wasted journey for everyone.
Always need to make contact with medics. Going to stand the crew and myself now. Police standing down.
Last year, West Midlands Ambulance Service received over 1,000 malicious calls. In the time they've been dealing with this prank, Ambulance Control have taken 50 real emergency calls.
I guess you don't feel quite so bad. It's when you launch the helicopters, you're up in the sky and everything, and that's just a huge amount of money wasted for someone's entertainment.
Ambulance service, is the patient breathing?
There's been an accident on the Litchfield Road by the traffic light. A BMW has just knocked a man off his bike.
Is the patient breathing and conscious?
He's got pains in his chest.
Right, is he awake?
Yes, he's awake. Don't move him. Don't move him. He's got chest pain and I think all down the left-hand side. All down the left-hand side really hurt.
A push bike or a motorbike?
He was on a small motorbike. He's going slightly blue. Sweetheart, his legs are going blue.
Would you say that he's struggling desperately for breath?
Desperately for breath, yes.
Okay, got a crew on the way to you.
When a car hits a motorbike, even at low speed, the injuries inflicted can be life-changing. An ambulance has been called, and critical care paramedic Steve Mitchell, known as Mitch, has also been scrambled.
We're just off to Aston. It's about 10 minutes away to a car versus motorcyclist. Believe the patient's conscious, got a chest injury, and that's as far as we know, really. There's a crew on the way, and they'll be there before us.
If the man is struggling to breathe, he may have an obstructed airway. Mitch carries advanced airway equipment, including ventilators, so he can start treatment straight away and get him to hospital safely.
Hey up, you're all right, mate. How's it going?
10 minutes later, Mitch arrives at the scene and is met by fire brigade and ambulance crew.
No worries. I'm here. What's your name, sir?
Ian Allen.
Ian. What we'll do is we'll get you in the warm, dust you off a bit.
Yeah, okay.
All right.
47-year-old railway worker Ian was on his way back from work on his scooter when a car collided with him at a crossroads, catapulting him onto the road.
And is it your left shoulder, right shoulder?
All the left.
All the left, okay.
He is breathing on his own, but in a lot of pain.
It looks like he's probably dislocated or broken by the sounds of things. It's all right, just so don't pull anything.
There's a high chance Ian has injured his spine in the collision, so the ambulance crew have immobilised his head and neck to try and protect him from further damage.
On your count, Chief.
After 3, 1, 2, 3, lift.
Okay, stay as you are, and then slide the trolley in. Mind your toes, gently.
3.
Okay, keep going. I'll get the winch off.
Worried that the slightest jolt could leave him with permanent spinal damage, Mitch needs to use the winch to pull the stretcher up the ramp.
Okay, stop there. Okay, 1 foot, 2, half 6 inches, that's it, go. Hold on. Okay, slack taken up there, okay. Just makes it a bit smoother for you.
Once on the ambulance, Mitch needs to do a full examination to try and find the extent of Ian's injuries.
Yeah, I'm in a bit of pain.
Okay.
Can you get some gas in there, mate? I could do some water.
Courtney, you're right to get some morphine drawn up and some paracetamol. He's in a lot of pain.
Well, yeah, I'm in pain, yeah.
Okay, here's a little bit of water. Just wet the whistle. Out of 10, how bad would you say the pain is in your arm?
Pretty bad.
10 being the worst ever.
It just feels like there's something wrong there.
Yeah, it will be.
It's my chest.
Your chest?
Shoulder.
Yeah.
All round there. It's really pain. It feels it.
Chest up here as well?
Further down here.
There. Okay, right, okay.
Ian is in so much pain, it's clear that he has sustained some broken bones and potentially damaged internal organs.
Keep your arm low for me, Ian, okay, so we can pop a little needle in there.
Mitch's first priority is to reduce his pain so he can get him to hospital fast.
Get your pain sorted out, mate.
Ambulance service, patient breathing.
He is, but it's not very good.
She conscious, the patient?
No.
Not responding?
No.
How old's the patient?
Not really sure, he's 1934.
So he's 85 years old and he's not responding to at the moment, to confirm,
no? He's very, very pale in colour, very pale.
Is he taking regular breaths at the moment? Is his chest rising and falling evenly?
No.
Right, I hope it's all been arranged for him, okay? We are trying to get there as quick as we can on blue lights and sirens, okay?
The call is from a local care home. It is classed as a cardiac arrest, a code red emergency. An ambulance is en route, but critical care paramedics Alistair McNeil and Mike Andrews have also been scrambled.
What looks like a nursing home or sheltered accommodation for a cardiac arrest. Charlie 1 call. We're responding as we are one of the closest resources to the case. We have another crew that are en route as well, but no one on scene yet, as far as we know.
In the UK, around 7.5 million people are living with heart disease. As we get older, the heart and blood vessels stiffen, meaning the elderly are at greater risk of sudden cardiac arrest.
This is the time of the morning when people are getting up and they're moving around, and carers are making their first sort of visits of the day. So this sort of case is not uncommon at this time of day. A lot of the time they're hypoglycemic patients, so they're diabetics or even non-diabetics whose blood sugar has gone low and they've been found in an unconscious state.
Still a couple of minutes away from the care home, Alistair and Mike know they need to get there fast if they are going to intervene and save the man's life.
What we're going to do is we're going to get a needle in you, give you some pain relief through there, and that'll help the breathing, all right? Clench your fist a few times. That's it.
In Aston, Mitch is treating 47-year-old Ian, who was knocked off his scooter and has suffered serious chest injuries.
So he sat for 95 on air, just sort of coming up quite quickly there as well.
4 litres, yeah?
I'd go up a bit. Yeah, he's having a bit of difficulty breathing, I think, and like what's happened. Sharp scratch then. Okay.
Ian needs an urgent scan of his chest and lungs and is in so much pain it's affecting his breathing.
Oh, that hurts there.
Yeah, sorry, Chief. Well,
I'm in a lot more pain than I was out there.
yeah, it kicks in once your own painkillers wear out your system. If you want to chuck us that morphine, I think.
Any allergies at all, Ian?
Not really, no.
So this will make you feel a bit fuzzy, OK? Out of 10, how bad would you say the pain is there?
I'd say it's pretty bad. I'd say it's about 8.
About 8 out of 10, and you look like a burly chap that can take a bit of pain.
Ian's blood is showing low oxygen levels. He may have damaged his ribs and lungs, but until he can get on top of his pain, Mitch can't be sure of the extent of his injuries.
Can we just pop your head forward slightly? Not too much, not too much. Rest your head back. Rest your head back. OK. How's that? Can you feel that starting to kick in a little bit there?
Yeah, I'm a big bloke and might take
Yeah.
a while to get round.
Yeah. Nice slow breaths if you can. How's the pain doing there, Ian?
It's subsiding, but it's still there.
Yeah, OK, we'll get you. Yeah.
Have you put the morphine?
Yeah, that's gone through.
Yeah, it's gone through.
It's working now.
Yeah.
14, 20, it started running through.
Finally, the combination of paracetamol and morphine start to take effect.
Stuttering his respiration now. I'll probably give him a little keep going until you've done the 20, I think.
With Ian still struggling with his breathing, Mitch decides to keep him on oxygen for the journey to hospital.
I will probably end up going QE, I think, because he's got a chest injury.
Yeah.
How old are you, sorry, Ian?
47.
47, OK. Maybe just put a 250 bag of fluid on there, just run the rest of it through, just give him like a bit of a keep open or something like that.
If his blood pressure drops, the intravenous fluids will help to keep him stable.
Are we clearing fracture? Left?
Ribs and shoulder injury. Left, yeah.
Police arrive to get details of the accident, and Mitch calls the trauma desk to update them.
Has it impacted you?
Well, I've gone into the side room, so
So where did you impact the car?
6-2, go ahead.
front wing.
Crew are going to convey to the QE. You ready for details?
In the right hand
Well,
lane.
at first, I moved
Yes, fire ahead, thank you.
So male on a small motorcycle moped. He's got a left shoulder lateral clavicle pain with left sort of lower rib injury, query fractured ribs, equal air entry, but it is affecting his respiration. And in light of his rib injury, I feel that it's suitable for the QE. They'll probably be about 15 minutes from now.
With Ian now in a stable condition, Mitch is happy to leave him in the care of the ambulance crew for the journey to hospital.
There's the crew.
In Quinton, Alistair and Mike have been called to a care home where an 85-year-old patient has been found in an unresponsive state, bleeding from the nose.
Good morning. Hello again. Hello again. You're right.
They are met by the ambulance crew, members of the care home staff, and happily a now conscious Ken.
So which nostril does blood come out?
Both of them.
Ken and his wife Maureen have lived in their apartment in the care home for 8 years. He collapsed this morning getting out of bed.
How is he normally compared to this?
Well, we don't come into him for care.
So you don't know him too well? No.
Well, we know him, but we don't give care to him.
I know me, I'm always pulling the legs in.
Is that what you do?
Yeah.
Oh, keeps them on their toes, I would imagine. So when you sat up, you just felt a little bit dizzy?
Yeah. I stood up and when I got round here, there. It happened yesterday as well.
No.
Can I take spot of blood out your finger?
You can have it. Yeah, you can have it from under it. I'll give about 2 points while I've been in there.
Yeah.
You lost a lot from your nose, have you?
You've had no chest pain or anything, have you?
Nothing at all.
The crew take a sample to test Ken's blood to see if low blood sugar could have caused him to pass out.
Okay.
He was getting out of bed and the blood not going around my body quick enough.
Did you leap out of bed, did you?
No.
What was that? That normal?
6.9.
6'9"?
Yeah, 36.8 and 6.9.
Are you happy with his ECG and everything?
Yeah, I'll do 12.
The electrocardiogram test hasn't shown up any abnormalities in Ken's heart rhythm.
I can't manage it, Lord.
No, I know you can't.
If I hadn't given you this blood, you'd have been flat on the floor. And I couldn't lift you up.
Happened again yesterday as well.
No, of course it didn't.
But Alistair is concerned that this is the second time he has fainted in 24 hours. The nosebleed could be a sign of high blood pressure or heart disease that needs investigation in hospital.
I don't think there's any need for me to go to us.
But Ken is not convinced.
We'll do all our checks on your care and we'll take it from there, mate.
I ain't got it.
Claire's coming in.
I'm not sure that we do.
Ken has a history of fainting when he gets up in the night, but has never had a proper diagnosis.
Did he go to hospital yesterday?
You didn't go to hospital last night, did you, Ken?
No.
Yeah, it happened yesterday, you've had it happen today.
It happened yesterday morning, then he cleared up, not all right.
The carers.
What was his BP, James?
You've got to go in.
123.
You were out for the account.
Got a good run.
Just.
Mike wants the crew to run another ECG scan to see if there are any signs of deterioration or unusual activity.
That's a nice scar you've got on your chest, isn't it?
What's that from? 20 years ago. Oh, 20 years ago.
25 years, more than that.
Really? Seems indestructible then, maybe.
A veteran of open heart surgery to unblock clogged arteries, Ken is made of stern stuff. But in the end, he listens to medical advice and agrees to go with the ambulance crew to hospital.
Okay, take care. Thanks very much. Thanks a lot, guys. Nice one. We'll leave you to it. We'll see you later on. Nice to see you.
And Mike and Alistair are free for their next emergency call. In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
Accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
by road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
No, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight, a man collapses in a Wolverhampton churchyard.
Stand clear. 3, 2, 1. Back on the chest, guys.
A police pursuit ends in a major RTC.
He's been ejected from the rear in a car crash.
A pensioner falls down a flight of stairs.
Joe, is it hurting anywhere? I'm pushing here. Yes, whereabouts?
In your neck.
And a motorcycle crash
That's it, Cameron.
leaves a teenager in agony.
There's lots of things, elements to our job. Save lives, wash cars.
Critical care paramedic Faye Pollock is beginning her first 12-hour shift of the week. It's essential that the emergency car, which is charity funded by Midlands Air Ambulance, is kept in tip-top condition.
The public have paid for it, so actually it deserves to be well looked after and clean and presentable, really. We are a professional body, so therefore we have to have professional vehicles. And it takes 10 minutes to wash a car. But it's freezing, it's so cold. Oh my God, I can't feel my fingers.
Ambulance service. It's a patient breathing and conscious.
Yeah, he's been knocked out. Just a motorbike and car collision.
So it's a car v motorbike. Okay. Can you see any obvious heavy blood loss?
No, I think the motor broke his leg.
I just need to try and rule any life-threatening shock, okay? Does it look very pale or grey to you?
Yeah, we got enough gates on the corner.
All right. The help's already been arranged. When on blue lights and sirens, okay?
An ambulance has been dispatched, but critical care paramedic Faye is also urgently needed.
There's an ambulance crew in attendance with him. They say that he has got, thank you, sir, a broken leg. He's in quite a bit of pain. They've maxed out on the amount of analgesic drugs that they can give him. So they have requested me to go and give some enhanced care. But if the impact was enough to break his leg, then there might be some underlying injuries that we haven't yet identified, so.
More than 300 motorcyclists are killed and over 5,500 seriously injured every year on Britain's roads.
Ah, yes, I see blue lights.
Faye arrives 17 minutes after receiving the call.
Hello, how you doing? Oh, he's a motorcyclist versus a car, yeah. Cameron, you say? Cameron, listen, my name's Faye, I'm with the Midlands Air Ambulance, okay?
On his way to work, 18-year-old Cameron's motorbike collided with a car. He was thrown off the bike, landing 15 feet away on the grass verge.
This is where you landed?
Where I landed, I flew straight over the body.
Okay.
The ambulance crew has already reported that Cameron has a broken leg.
Okay.
Gram of IV paracetamol.
Yep.
He's on his second bottle of Entinox, but he's in absolute
agony. Okay.
You know, we can't even get the splint on him. That's why we've asked for a little bit more help.
No problem.
The pain relief given to Cameron by the ambulance crew isn't strong enough. But Faye's special training means she can administer more powerful drugs only carried by the critical care teams.
I'm just going to take your T-shirt off. I know it's absolutely freezing, mate, but you're not bothered. I am.
Before using it, Faye checks Cameron for any other serious injuries.
Any pain in your neck?
No, nothing.
No, okay. Nothing in your throat here?
No, nothing.
Okay. Any pain in your tummy?
No, nothing.
No, okay. Any pain in your shoulders up here?
No, nothing.
No. Wiggle your right hand for me. Brilliant. Wiggle your left hand for me. Well done. Can you clench your bottom cheeks together? That'll do. Okay. It's all this pain in your leg. Okay.
Yeah, just my right leg.
Cameron has broken his right thigh bone, the largest bone in the body.
Which leg am I touching, left or right? Good man.
There is also the risk Cameron could have broken his pelvis or damaged his spine, which could cause paralysis.
No pain as I'm touching down your back?
No.
No, okay. Okay, wiggle your toes. Good man.
Thankfully, Cameron's spine doesn't appear to have been damaged. Faye can now turn her attention to his broken leg.
All right, Cameron, I'm sorry. It's not helping the fact that it's so bloody cold. Could you plug that into your
my God, my leg's really gone out.
please?
Hang on, stop pulling.
We're gonna help you now, Cameron. Sorry, my friend.
Faye wants to get Cameron to hospital, but he's in too much pain to be moved.
At the moment, the reason why it's so uncomfortable is because you have broken your leg. Is the two bones are scratching against each other. Okay. As soon as it's in line, you will create your own pain relief because it's back where it should be. All right. It's all set up, isn't it? So if we give him a little shot of ketamine in there.
Straightening his leg is an excruciating procedure, so Faye prepares to give Cameron a powerful painkiller called ketamine.
So, Cameron, I'm just going to give you this drug, OK? It will make you feel a little bit sleepy, but it's just so that we can pull. I'm going to give you a touch so we can pull that leg. The moment we pull it, it'll actually feel... No, trust us. Trust us. 1, 2, 5.
It's essential Faye straightens Cameron's leg as soon as possible. While it's out of alignment, it could be causing internal bleeding with the risk of life-threatening blood clots.
Soon gonna be over, man. Soon gonna be over.
Critical care paramedic Stephen Mitch Mitchell is starting the Saturday shift by making sure his kit is ready for whatever the day brings.
This doesn't look tidy enough for my liking. Everything keeps you on your toes, and you almost have to be a certain character type to do this type of job. I think the weather will keep people indoors today, but we'll have to see.
This is the patient breathing.
I think no breathing. I touched him, but no reaction.
Okay, is he breathing?
I don't think so.
We need to start CPR.
Yeah.
Okay, put one hand in the centre of his chest and lock your fingers together. You're going to keep your arm straight, push down hard and fast. Don't be afraid to push too hard, okay? You're going to go push, 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 push.
Yep, yep.
Say push out loud every time. Push, 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 push. 1, 2, 3. 1, 2, 3. Keep pushing. Don't stop until they tell you to. Can you see the ambulance anywhere?
Yeah, yeah.
The collapsed man who's not breathing is a code red emergency. Local ambulance crews are on scene, and to help with advanced life-saving treatment, Mitch is also on his way.
So it's reports of a 40-year-old male who's had a cardiac arrest, so hopefully we can help out where we can.
With cardiac arrests, time is crucial. When the heart stops beating, no blood is pumped around the body, starving vital organs of oxygen. Every minute without CPR, the chances of survival drops by 10%.
Oh, there, guys, you all right? It's Mitch.
Captain Paramedics passing by. That's why I was doing CPR, but he said it didn't look that effective, but he was doing his best he could.
The man was found 17 minutes ago, collapsed and in cardiac arrest.
A little bit faster, Chief. Keep your elbows straight. That's it.
He's had 3 shots, and he's had one of them, you know.
OK, what we'll do is we'll go on the next rhythm check at 13 minutes past.
The ambulance crew found the man's heart in VF, or ventricular fibrillation, which means it's quivering rather than beating. Despite using the defibrillator 3 times and administering adrenaline, it has not regained a normal rhythm.
Everybody else stand clear for me. On 1, stand clear. So 3, 2, 1, back on the chest, guys. OK.
The man is only in his early 30s. Mitch and the crew are battling to save his life. Across the West Midlands, the critical care teams are on call 24/7 for all life-threatening emergencies.
BVM. Yeah, on N-tridal on, reading at 3.0. BP systolic.
You don't know what you're going to. That's part of the challenge, is you're dealing with all sorts of conditions, environments, as well as all sorts of issues with the patient. And you never quite know what you're going to get until you get there. And it's probably the reason that most of us sort of end up in this role.
Just gonna have a little look at your foot, okay?
Nice deep breath.
Well done.
Ambulance services, the patient breathing?
She's breathing, but she's not responding.
Okay. Does her breathing sound noisy? Is there any gurgling or wheezing sounds?
Yeah, it's a gecko. Sue, are you okay?
Is she responding at all?
No, she's giggling.
Just try and roll her on her side, remove anything from under her head and just keep checking this breathing for me, okay?
Okay.
Is she diabetic at all?
No, she's got MS.
She's got MS, okay.
The woman who has multiple sclerosis is unresponsive and struggling to breathe.
It's a 60-year-old female MS patient. She's been found unresponsive this morning, vomiting and aspirating.
A local ambulance is already on scene and has reported the patient, in her 60s, is choking on her own vomit.
She is a little bit of a large lady, so they have requested an extra 2 ambulances to assist, and we've got stuff going as well.
Roger, thank you.
It's a potentially life-threatening incident, so critical care paramedic Kerry Hemus is also en route.
We're not sure what the cause is at the moment, and the crew are having to give her oxygen and assist to ventilations. But I do carry a little bit of different kit with regards to ventilation, so maybe I could assist with that. So I'm kind of thinking that through in my head. She's apparently a larger lady, so it's not going to be as easy as just sort of popping her on a chair or a scoop and just getting her out of there.
Kerry arrives on scene. 3 ambulance crews are already there.
Hiya. Hello there. Hi all. Hello. Hello. That's fine.
Found my carers this morning.
Yeah. Does this lady live alone?
She does, yeah.
And what level of care do you know?
Full time today, all care. She's a little bit wheezy.
62-year-old Susan has multiple sclerosis, an incurable, sometimes debilitating disease affecting the central nervous system.
What was her last blood pressure? Okay.
Susan, open your eyes for me, Flower.
The ambulance crew has cleared her airway of vomit and she has been given oxygen to assist her breathing.
Right. So what's her rest rate now?
20.
20, lovely. Bless her.
Susan, hello.
She's very warm, isn't she?
She's got fentanyl patch, which was removed.
Right.
Fluids. She's had 800.
So she's had it every 3 to 5 minute loops.
Susan was wearing a slow-release fentanyl patch for pain relief for an existing condition. Worried she may have received too much of the strong painkiller, the paramedics have removed the patch and are giving her Narcan, a drug that reverses the effects of opioid overdose.
She's got a lot more responsive than she was.
But Susan's breathing is still laboured and she appears confused. Kerry and the crews need to decide how to get her out and into the ambulance.
Right, are we thinking carry sheet? Do you want to get her on the sheet on the bed? If we roll her, pop it on, so slide under as much as we can, then roll her towards this way, pull it out, and then we can lower her to the floor, and then we can all just do a bit of sliding.
The slide sheets emergency teams use to move patients in tight spaces can carry people weighing up to 62 stone.
Sorry, Susan.
Kerry coordinates the operation to get Susan out and onto the ambulance.
So if we try and concertina it from this end.
Sorry, Susan, sweetheart. Bend your legs for us, that's it, sweetheart.
Fantastic, well done.
Well done, darling.
To prevent her falling off, Susan's legs are placed in a large pocket at the bottom of the sheet.
Right then.
Susan is on the slide sheet, but getting her out and onto the ambulance is the team's next challenge.
You need to speak. Carry on speaking to us. Tell us what do you do? Where do you work? Just up the road. Doing what? Engineering. Okay.
Over in Dudley, critical care paramedic Faye Pollock is treating teenage motorcyclist Cameron following a collision with a car.
We've got everything at hand just in case we need to start helping him out with his breathing.
Cameron needs to be in hospital, but first Faye must realign his broken leg in order to ease his pain and to prevent a dangerous internal bleed.
We are all in position to give that a good pull. We're nearly ready, we're nearly ready.
Manual realignment is agonising, so Faye has given Cameron a strong painkiller and he is also taking gas and air.
Can you feel me touching you? Yeah?
The right one. Come on.
That's it, Cameron.
What's at the pole?
That's it, that's it.
Well done, you. Well done. Well done.
That's it, Cameron. It's done, mate. It's done.
Now the leg is straight, it needs to be kept in position.
That's it. Get ready with the pole. That's it. Yeah, pull the red now. Pull the red tab. Yeah, that's it.
Faye uses a traction frame to lock it in place.
That's it, that's it, that's it. Let's see how that is. Let's see his legs. Let's see his legs.
Well done. Fabulous.
Cameron, how is that feel? Is that feeling any better now?
Yeah, it feels better, yeah.
Okay, excellent. Well done, everyone. Cameron, what we're going to do is just going to roll you onto your poorly leg for just a second to get the stretcher under you. So it's only going to be for a few seconds.
Sorry, mate.
Fuck off.
Fine, we're under. Right, ready, set, roll.
That's better.
Sorry,
That's it. That's it. It's done. It's done. It's done.
Have another suck on that, mate. Have another suck.
I know you feel absolutely rubbish at the moment, mate, but you're quite lucky that we're only dealing with your leg.
1, 2, quick.
Brilliant. We'll get you nice warmed up.
To avoid hypothermia, Cameron is wrapped in blankets and foil to keep in as much body heat as possible.
Perfect.
Looks like it's tensing up.
Now that we've straightened it up, all your muscles are all out of kilter, so it will start to spasm. 6-2, thank you.
Faye calls the trauma desk, who will inform the hospital to Cameron's arrival.
We're going to Russell's Hall, trauma tool positive stage 3, and our ETA now is probably about 5 minutes. We've alerted the hospital, so there'll be a couple of doctors waiting for us. Okay, good man. He was extremely lucky that he hasn't suffered more injuries. He could have bumped his head straight onto concrete and got himself a traumatic brain injury. I appreciate he's probably in a lot of discomfort at the moment with a broken leg. He really is perhaps the luckiest chap around today because it could have been far worse. We're here now, my sweet. All right.
Now as comfortable and stable as he can be, Faye can hand Cameron over to the waiting hospital doctors.
Just a few bumps, Cameron, okay?
Evening, I am here. I have drugs, so I'm just doing the checks, but you can use me if you need me, over.
It's Saturday night, and trauma doctor Matt Rowley and critical care paramedic Becky Chappell are beginning their shift.
We've had some really busy shifts together, but we've had some quieter shifts as well, so we'll see.
Years ago, everyone would say that Friday, Saturday nights are probably going to be your busiest nights of the week, but it can be a bit hit and miss. You can sometimes have busy weeknights, but historically, Friday, Saturday night will be busier. So I think as the night gets later on, we tend to see more things happening. Righto.
Ambulance services, the patient breathing?
Yes.
Are they conscious?
I don't think so. Well, my husband is falling down the stairs.
Okay. How old is he?
76.
We're coming with blue lights and sirens as fast as we can, okay?
A 76-year-old man unconscious after a stair fall is an immediate code red emergency, potentially requiring urgent critical care. So Becky and Dr. Matt are en route.
Worst case is if he has fallen top to bottom of the stairs, he could have a really significant brain injury, which has left him unconscious. If that's the case, we'll assess him when we get there, and potentially one of the things that we can do is to give him an anaesthetic and to put him into a medically induced coma.
In Britain, someone falls downstairs every 90 seconds, killing around 800 people a year.
Whether it's people that have slipped, whether they've had a medical event such as a heart attack or a stroke which has caused them to fall downstairs, whether they're intoxicated and fall downstairs, it definitely makes up a lot of our workload.
Becky and Dr. Matt arrived 16 minutes after their alert.
How you doing?
Oh,
You all
you're
right? What we got?
Hello.
76-year-old Joe was on his way up to bed when he fell. His wife Sybil called 999.
Joe, can you stick your tongue out for me? Good man. Give my hand a squeeze. Joe, give my hand a squeeze for me.
Joe is barely responsive and his speech is slurred, which could indicate a brain trauma.
Do you know where you are at the moment? Where are you? Say again.
Yeah.
To properly assess him, Matt and Becky need to get Joe onto the ambulance.
Right, OK.
Okay, you're just walking down it.
Joe, just relax for her. Just relax,
Okay.
darling. Have you got pain in your head?
We're going to get you in the ambulance and have a little look at you. Get you warmed up first, yeah?
Give both of your feet a wiggle for me.
It's a good sign. But Joe needs a hospital scan to fully assess if there has been any damage to his spine.
Good, well done. Let's have a little feel of your chest. You got any pain anywhere, Joe?
Joe has no obvious serious injuries, but he's confused and his breathing is laboured.
He's definitely struggling, isn't he, from a respiratory point of view?
Brain trauma remains a risk. Becky seeks clues from his wife.
Does he take any blood thinners?
I think he does.
If somebody's taking blood thinners, they're at an increased risk of bleeding. So if they have bumped their head, they've been unconscious, they've got an obvious head injury, they are at risk of having a significant bleed into their head.
All right. Are you in pain, Joe?
I'm going to swap with you, so in 5 seconds, 4, 3, 2, 1. OK, jump out of the way, George. Nice one.
In a Wolverhampton churchyard, critical care paramedic Stephen Mitchell is leading the resuscitation of a man found collapsed in cardiac arrest 22 minutes ago.
That looks like VF. Georgia, can you charge the monitor? OK. Everybody else stand clear, please. OK, everyone clear? Yeah. 5, 4, 3, 2, 1. OK. Right.
The man has now had 8 shocks from a defibrillator, but his heart has not gone back into a normal rhythm.
I'm going to get the Lucas device out. Open up the Lucas device over there for me, please.
Despite being very unstable, Mitch makes the decision to move the man to hospital.
OK, so mate, do you want to sort of go the other side and feed that under his back for me?
To keep blood pumping on the journey, he decides to use a Lucas device. Only carried by the critical care team, it performs automatic chest compressions.
We're going to place that underneath him, so I need you to lift his shoulder up for me. Sit him slightly forward. So Georgia, can you support his head? And then we'll put that underneath his armpit. Slight lift. Go on, put it through, Rich. That's it. Go for it. Yeah, push it on. OK, it's about to start, OK.
Lucas device fitted, Mitch can now move the man to the ambulance.
Right, what we'll do, guys, we're going to lift either side, watch everybody's toes, just feed the trolley in. Would you mind grabbing the foot end of the stretcher? Rich and myself, we're lifting the stretcher on 3. 1, 2, 3. Dan, push. OK, push. Sit. George, get the patient on the truck for me, please. OK, ready? OK, watch your back. OK, that's VF. Charge and shock that, yeah?
Everyone clear? Yeah. Shocking.
Before they move, Mitch gives the man another shock to try and get his heart back into a normal rhythm.
6-2.
6-2, go ahead, Mitch.
Mitch calls the critical care desk, who will update the nearest cardiac unit on the situation.
So, male, 30s to 40s. Currently, Lucas, he's had 9 shocks and he's in VF. He was found rather than witnessed. Received.
Yeah, thank you, Mitch.
Nice one, Rich. Just nice and steady.
9 minutes later, Mitch delivers the man to hospital, with the Lucas device still maintaining blood flow round his body.
Yeah, you're happy there. Oh, slowly. Yeah, it's right. OK, got it. Oh. All right, cheers. His heart was in a disorganised rhythm throughout, and it needs shocking all the time or special drugs, so we brought him here where we can sort of take that a little bit further. And unfortunately, it's quite cold today, and whether that's been a factor to what's happened, we don't know.
You grab that bit and then OK. Everyone ready? Are we going onto the floor now? Happy? Just gently does it?
In Birmingham, critical care paramedic Kerry Hemus is leading the effort to get 62-year-old Susan onto the ambulance.
Ready, steady, move. I'm sorry, Susan.
Ready.
Everyone happy?
Yeah.
Lower. If we try and lift and slide at the same time, is that all right?
Susan, who has multiple sclerosis and is also overweight, is confused and having trouble breathing. Suspected of suffering from an accidental overdose of painkillers, she has been placed onto a slide sheet and taken off her bed. Kerry now needs to oversee getting her out of the house.
Ready, steady, slide. Is everyone happy? Ready, steady, slide. Perfect.
Sorry, Susan.
That's fine, darling, that's fine. Right, we've got a little bit of a lip here. We're going to need to lift her over. So, ready, steady, slide. Right, is everyone happy? OK, we'll just go. Yeah, well, we'll go up as far as we can, yeah? Everyone happy? Mind your back.
The most strenuous part of the procedure is lifting Susan onto the stretcher.
Right, ready, steady, lift. OK, just a bit, legs on first, that's fine. And then we'll readjust. Shall we stop a second, reposition? Yeah? When you're ready, yeah? Ready, steady, move. Beautiful. Right, let's get her in the warm and then we'll reassess. How are we doing, Susan? OK.
Happy?
Yeah, happy.
Led by Kerry, but working as one, the paramedics start their transfer of Susan to hospital.
Yeah, slippery here as well. Oh, mind your foot. That's it.
taking you to hospital, Susan. I'll write to her later, yeah?
With Susan's breathing still laboured,
There's a wheeze on the chest if you want to let them know.
Kerry travels with her in case she needs critical care. At the hospital, Susan's symptoms will be investigated further.
Right, I'll take this in with me. Her conscious level has come up and she started to respond. She's what we call aspirated, and that some of that vomit has gone on to her lungs, which is why she's wheezy. And now it's over to the hospital to try and make her better and sort her out.
Trauma doctor Richard Fawcett
GI gels is what it says on the tag.
and critical care paramedic Pete Edwards are preparing for their shift.
It's payday weekend, Friday night. Could expect anything. I'd be surprised if we don't go to a stabbing tonight, maybe an RTC, potentially somebody falling down the stairs. That's the sort of typical things, but it could go manic. Expect the unexpected.
Ambulance service for patient breathing.
Yeah, but it's really emergency. It's got stabbed, a massive wound, and it's bleeding, and I can't stop it. You can see his stomach.
Get a dry dressing or a clean cloth, fold it into a pad and press onto the wound. How old is he?
40.
Can you try and talk to me on the phone? Hello, sir. Where have you been stabbed?
In my belly.
Have you lost enough blood to fill a coffee mug?
Oh, there's blood everywhere.
A knife wound to the abdomen could be a Category 1 emergency. An ambulance is en route, and just as Pete predicted on Payday Friday, so are he and Dr. Richard.
Got reports of a gentleman who's apparently been stabbed or slashed with a Stanley knife in a pub and has extricated himself home.
Now bleeding for over an hour, the volume of blood loss could become life-threatening. As Richard and Pete arrive at the house, our crew is asked to not film inside the property.
It's like a slash. No evidence of any major hemorrhage, and it looks like it's just in the fatty tissue.
The man's wound is superficial, and the local ambulance crew has stemmed the flow of blood loss.
We're going to just load him up and get him gone.
982 Whiskey Romeo over. They're going to take him to the QE. There's laceration to the torso.
The patient needs hospital treatment, but his injuries are not life-threatening. Richard and Pete leave him in the care of the ambulance crew. It's shaping up to be a typical Friday night for the critical care team as their second emergency comes through.
Ambulance service, how can I help?
Hello, it's West Midlands Police. Can I have an ambulance, please?
Yeah, what's the reason for us attending?
We've got an RTC. One person's been ejected from the vehicle, possibly in a stolen car. He's been in pursuit.
We're over there as soon as we can.
It's a road traffic collision with the potential for catastrophic, life-threatening injuries.
The details at the moment are all very sketchy and very limited. We're only about 3 minutes away, so I'm sure we'll find out soon enough.
Pete and Dr. Richard are the first medical team to arrive.
It's clipped the van, hasn't it?
Look at that. Is it this?
Fucking hell, the ricocheted all down the road.
Police had been trying to stop a suspected stolen car, but the pursuit ended after the driver lost control, smashing into numerous vehicles on a residential street. An officer briefs Pete and Richard on the casualties.
Is it just the one patient, is it?
Yeah, well, we've got one in our police car there who was a passenger, but he's ran off and been caught in a foot chase. So our main concern is this guy here. He's been ejected from the rear and he was struggling to get up to begin with. We've managed to keep him as sedate as possible. So he's got some visible cuts on his eyebrows.
Hi, mate.
Alright.
How you doing?
Fine.
All right, I'm Pete, one of the paramedics. Can I just have a quick feel of your wrist, mate? Okay. Do you know what day it is?
Yeah.
What day is it?
Friday.
Let's just whip your top up, mate. Let's have a proper look at you.
The man is alert, ruling out a brain trauma, but Pete needs to assess him for other serious injuries.
You got no pins and needles or anything on you? All right.
When the ambulance crew arrives, Pete brings them up to speed as they prepare to take the man to hospital.
He's got facial injuries. The best thing to probably do is, if we just get the stretcher, we'll do all the observations and the checks in the vehicle. You say you haven't got any medical problems like asthma or diabetes? You've got a hole in your heart. So any breathing feel all right? All right.
A hole in the heart can weaken it, and the artery supplying blood to the lungs. Pete wants to get the man onto the ambulance to check if he has any internal injuries.
Can you feel me touching that? Yeah. Give me a squeeze. And this one? Yeah, all right, okay.
So let's sit him forward and have a quick gander at his back.
We're going to sit you forward so we can just have a look at your back a little bit and your chest, okay? We'll sit you forward, okay? If you come forward with me, that's it. I'll keep a hold of you.
In Stourbridge, 76-year-old Joe has fallen down the stairs at home.
There, we've got a bit of an abrasion there. Joe, is it hurting anywhere? I'm pushing here. Yes, whereabouts? Tell me when it hurts.
In your neck?
I mean, there's no crepitus, there's no instability, deformity or anything there. I think from a brain injury point of view, he seems okay. He's able to talk to us and he's alert. I think we're more concerned that he's got an underlying medical problem that's caused him to have a fall.
Just leave that on, Joe. That's helping your breathing.
His work of breathing is quite hard. His oxygen levels were low, so there's a concern that there's possibly an infection in his chest.
Despite being on oxygen, Joe is still struggling to breathe.
Shall I just go and speak to wife and see what it's been like in day with his breathing?
Yeah, okay.
Right, my stuff's there if you want.
Any information Joe's wife has could help determine their course of action.
Has he been struggling with his breathing today? Has he been like breathing quite quickly and looking a bit out of breath?
Yeah, I noticed yesterday or the day before, he came downstairs and he couldn't get his breath, he was breathing, you know.
Right, OK, so he has been struggling today, but anyway,
yes.
OK. So he has been struggling quite a bit today with his breathing, quite out of breath coming down the stairs and such. So I think this is probably how he's been.
A lung infection, like pneumonia, could quickly become life-threatening. Joe needs urgent hospital care.
Do you want us to travel with you, all of this, or?
Yeah, if you don't mind.
Yeah, that's fine.
In case Joe's condition worsens, Becky stays on the ambulance, ready to provide life-saving treatment.
So was he initially unconscious, completely unconscious?
He was conscious throughout with us. His wife says that she's been conscious throughout with him.
Joe arrives at hospital, where any internal injuries and his difficulty breathing can be investigated further.
What we're going to do, we're going to get a stretcher here. Yeah. We're going to get you onto it, all right?
Yeah.
In Wolverhampton, critical care paramedic Pete Edwards and trauma doctor Richard Fawcett are on scene at a road traffic accident involving a suspected stolen car.
Don't move your head. Have you got any pain in your neck or anything?
A passenger who was thrown through the car's back window and onto the road hasn't moved since they arrived.
Okay. Definitely no pain in your legs, nothing? Sure, moving all right?
You can get up.
All right, okay.
Having found no evidence of serious injury, Pete decides it's safe for the man to stand up.
Okay, nice and steady. Just sit forward, right? Just nice and steady. No pains?
No, nothing.
All right then, mate. Come and sit on here then. Yeah. Pop yourself on there. Swing your legs up.
A bit further back.
It all seems to be facial injuries. You've been lucky, mate.
Incredibly, despite his ordeal, other than some cuts, the man appears unhurt.
He should have some major injuries, but actually, he's remarkably uninjured. Very lucky, extremely lucky. When you look up the street and see the damage to the cars, you'd expect some serious injuries, but yeah, nothing. Nothing major at least, anyway, which is a good thing.
It's 5 hours into Richard and Pete's Friday night shift.
On to the next.
And their third emergency call is coming through.
Ambulance service, can I help you?
Hi, can we request your attendance, please?
Yeah, are they conscious and breathing?
We've got a vehicle that's gone into a wall. I think there's a number of people in the vehicle, not just one.
What's the vehicle hit, sorry?
It's hit a wall. We're currently requesting fire as well, because it sounds like potentially they're stuck in the vehicle. They're trying to get the female out of the rear, and she's screaming in pain. The engine has come out of the vehicle, so it's going to be very high impact. I'd be surprised if there wasn't any injuries.
Sounds that there's maybe people trapped inside the car, so either they've sustained serious injuries and they can't actually get themselves out because they've got broken bones, etc., or the impact of the crash has caused the metalwork to crumple and physically trap the patient inside, or a combination of both.
It's another typical post-midnight road traffic accident, and all 3 emergency services have been called to the scene.
From both ends of High Street.
Firefighters are trying to free a trapped passenger. The operational manager briefs Richard.
Female still in the back. She's got apparently some neck pain. The driver apparently has walked off, so unknown where he is at present, and they're not being very au fait of who he is and where he is.
The car has come around a bend, veered off the road and hit a stone wall.
A heck of a whack, isn't it?
Yeah.
The high-impact crash demolished the front of the vehicle, dislodging its engine and throwing it clear. The driver has disappeared, and the woman left trapped inside has just been freed, so Richard can assess her. She's traumatized and in pain, but Richard's satisfied the woman has no life-threatening injuries. It's the second remarkably unscathed passenger involved in a major car crash that Richard and Pete have had on their Friday night shift.
Not really got any apparent obvious significant injuries.
It's just complaining of some neck and back pain over.
Fortunately for this individual, they can leave her in the care of the ambulance crew, who will take her to the nearest hospital.
It's quite a lot of damage to the front of the car, but actually the crumple zones have absorbed all the energy, and the actual part of the car where the passengers were sitting is actually undamaged. So they've got away with it really, done really well. It's got a shoulder injury, but otherwise seems uninjured with what could have been. She's got off lightly, so we're not required. Ambulance crew more than capable and happy to deal with that.
As Pete predicted, it's been a busy payday night shift for the critical care team.
We've done the stabbing, 2 RTCs, which is a pretty regular weekend night.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road, and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
Got an ETA at all to get him out?
It's going to be a minimum of 5.
emergency teams battle to free an injured driver.
I believe his legs are trapped by the pedals and twisted round.
DIY disaster after a pensioner falls off his roof.
You can't fall any further, Henry.
Medics fight to save the life of a cyclist.
Basically, he's got a thoracic brain injury. He is still breathing a bit. That is still him.
And multiple calls reporting a shooting.
There's a gunshot. You need to bring an ambulance now. Oh my God.
Yeah, but just if we get another job on the way back. These hoods both got batteries, both clean to go.
At base, Dr. Polly Haywood and critical care paramedic Sarah Foley are checking in for the night shift.
Right, we've got rocurone in there, we've got fentanyl there, and we've got ketamine there. So they're drawn up, they're not used.
Dr. Polly spends half her time in hospital as an emergency department consultant
I feel like Tyrone Curry, actually.
and half on the road, responding to life-threatening trauma.
On the fentanyl, you've got the fentanyl vial, and we've got 3. Perfect.
Sarah is a full-time critical care paramedic, working shifts day and night.
There you go. Is it coffee time?
Ambulance service, is the patient breathing?
Westminster Police, can you join us at RTC, please?
Yeah, that's absolutely fine. Is the patient male or female?
Adult male. He's still stuck in the car that he's crashed into a wall. So we're on to fire to get them to cut him out.
Right, okay.
I've got no idea on his injuries because we can't get into them.
Right, he's stuck in the car.
Yeah.
It's a major crash. Police, fire and ambulance are already at the scene. Now they've requested specialist trauma backup. Polly and Sarah are immediately dispatched.
Go ahead.
Patient is still trapped in the car with no change in his condition.
Thank you, Grant. We're going to be 3 minutes.
The driver has been trapped for over half an hour and the full extent of his injuries is still unknown.
Trauma desk, this is Mike Delta 98, on scene. Oh, there's quite a lot of debris here, careful.
Evidence of a major impact is strewn down the street.
Where is out some railings,
And
there.
we've got the car just there.
The car has spun out of control, demolished a wall before flipping sideways onto a driveway. Firefighters are still working to free the driver.
Got an ETA from the fire to get him out. It's been delayed every time. They just try one thing and it's not working.
Polly and Sarah are briefed by the ambulance crew so they can now lead the critical care.
I believe his legs are trapped by the pedals and twisted round. I can't assess his injuries at the bottom because it slipped through the wheels and over the mangled round him.
In the smash, the engine is shunted back, trapping the driver from his abdomen. But it's too dangerous for Polly or Sarah to approach him.
But all I know is that is lower back pain. Yeah. So we might have to head him because I can't do anything until them legs are free.
The Midland Air Ambulance charity covers a region of 6 counties, one of the largest operating areas in the UK.
Element 03 Alpha's road to start recall.
As well as 3 helicopters, the charity also supports the daytime critical care cars in cities and built-up areas, where it's more difficult for an aircraft to operate.
White Delta 98.
No, mate, you're not too far from this. I think about 4 minutes. RTC motorcycle v car.
That's lovely. Thanks, Steve. We'll go and have a look.
Critical care paramedic Colin Apps has been working for the service for the last 12 years.
You get to patients a bit quicker on the car in terms of the ones in the urban areas. You can make a real difference getting there quick and intervening in certain ways. It always seems to be busy when it's hot for some reason. I guess people are just more inclined to get out and about and do things and maybe do stuff they wouldn't normally do.
Experience suggests his life-saving skills will be in demand today.
Ambulance service, is the patient breathing?
I don't know. It's just fell off the roof.
Okay, how old is the patient?
81.
Are you with him at the moment?
I'm with him. It's got a smack on his face, on his tummy.
Can you check if he's conscious and awake for me?
Are you awake, love? No, he's not answering.
Okay, are you breathing in and out normally?
No, it's not.
I've got help coming to you as quick as they can, okay?
An ambulance has been dispatched, but with the possibilities of a fractured skull and internal bleeding, the advanced clinical expertise of critical care paramedic Colin is also urgently needed.
So we're going to an 81-year-old male who's fallen off a roof. I think it was reported that he was unconscious, so that's where we're heading at the minute. And it's very close, actually, so we might actually be on scene first. 6-2, go ahead.
Falling from height is the biggest cause of death for people tackling DIY. Every week, someone is killed falling off a ladder. Fortunately, the address is just minutes from base, and Colin is first on scene.
What's his name?
Henry.
Hello, Henry. All right, my name's Colin. Can you hear me all right?
Yep.
All right, do you remember falling off the roof?
I haven't fallen off the roof.
Where have you fallen, from the ladder? Do you know where you are? Just keep your head nice and still for a minute, and we'll see what's going on with you, all right? You've obviously fallen and hit your head quite hard.
Henry, a retired teacher, was checking for leaks on his roof when he fell onto the concrete drive. His wife Patsy was at home and called 999.
He put his foot on the first one and he slipped.
Okay.
A local ambulance crew has arrived to help.
So he is conscious, he's maintained his own airway, he's got a strong radial pulse.
Yeah.
I think the plan will be is that we'll mobilise him on a scoop, get him up off the floor, and then we can give him an assessment in the back of the ambulance.
As well as a significant head wound, Colin's also concerned Henry has suffered internal injuries. And any medication he's taking could make bleeding significantly worse.
Is he on any blood thinners? You know what blood thinners? He's on blood pressure tablets.
All right.
I've got his medicine. We'll get everything for you.
What's your wife's name? Patsy. Patsy, he's okay. Okay, he's fully conscious. Just relax. Go and just calm yourself down, because we're going to look after him and he'll be fine. There's no need to rush around and get yourself all worked up. He's going to go to the hospital for a checkup and some assessment, but he'll be okay.
Colin must keep Patsy calm. He needs to concentrate on Henry's trauma.
I'm just wondering, once the roof was off, how are we still lifting that engine off of his legs?
It's 3:30 in the morning, and Dr. Polly and critical care paramedic Sarah are waiting to assess a driver trapped after a serious crash.
Can I just get, canner in and stuff like that?
They won't let me do anything just yet. They've got a spreader holding the actual car apart at the moment.
Right.
So
so it's quite dangerous. The front end is really sort of
unstable.
Okay.
Miraculously, despite the high impact, the driver is alive and conscious.
Got an ETA at all to get him out? Sorry.
It's going to be a minimum of 5.
Rescuing the injured in these difficult environments relies on tight teamwork between all the emergency services.
In terms of stability and access to the patient clinically, can we work through this space at all to put a cannula in?
We won't round you if you need to.
Yeah.
Obviously, we're going to cut this now. We're going to get a lot more space. We're going to roof off.
Yeah.
Polly needs to make the operational commander aware that the driver's condition may suddenly become life-threatening.
So essentially, from a clinical point of view, 40 minutes plus, having that engine block in your legs is a bit like having a tourniquet on.
Yeah.
As you release it, you're going to just dump loads of stuff, and that's the point at which he doesn't look so good.
Using hydraulic jaws of life cutters, the firefighters begin taking the car apart.
My lovely, I'm going to give you something for the pain, all right?
An hour after the crash, and with the roof now off, Polly and Sarah can safely treat their patient.
It's paracetamol to start with, but into a vein, so it's stronger than normal. And then we're going to give you some morphine. Have you had morphine before?
Right. In a position now where we can release legs.
Hey, they're going to move the dashboard off your legs now, okay?
We've got a long board ready.
Having given the man pain relief, the team prepare to get him out.
Just going to have a little look. Is that all right, mate? No, you're right, you're right. Even if you can't move it much, can you wiggle your toes inside your shoes, okay?
There's no blood around, so I'm happy that we're not bleeding and we can go.
Yeah, okay, yeah. Okay.
Going well. Nice and steady.
Right, just wait a minute. He's got his legs very, very spread. Think about his pelvis. Sarah, has he got any pelvic pain? His legs are a real kimbo.
Before moving him, Polly wants to be sure he doesn't have a broken pelvis. This could cause a catastrophic hemorrhage.
Sweetheart, is there any pain in your middle by your hips?
No.
No, thank you. Can you come out now?
You can come out now if you're happy enough. There's no broken legs.
We need him out.
Polly stays alongside the man in case his condition suddenly deteriorates when they move him.
All right, mate, you're doing okay. All right, buddy, I know it's horrid. You're doing all right. You need to open your eyes for me, pal. That's it, good man. I know it's a horrid situation. Sweetheart, have you got any pain across your hips? In your back, in your lower back? Okay, from the middle. We're just trying to get some space to get you out, pal, okay?
Stay sitting forward as much as you can.
There's a hard board in behind you, okay? Yeah, of course we're going to be careful, pal.
You got enough people?
We'll take him to here.
Yeah.
That's it, well done, you're out, buddy. Okay, and down, and down. All right, matey.
Brilliant. Thank you, guys. That was brilliant.
All right.
It's taken a team of 21 highly trained emergency workers 72 minutes to get the driver out of the car.
Can you raise this leg for us?
Good man.
Yeah, that's fine.
Okay, now what he hasn't got is his pelvis.
No, so his pelvis is fine, intact. To be honest, Polly,
Confident the driver has no immediate life-threatening injuries, the team prepare to move him onto the ambulance.
okay, on your call at the head end, okay?
Okay, go.
And down.
Great.
Right, Delta 98, thank you. Patient is now being loaded onto the back of the ambulance.
While Sarah updates the trauma desk,
We're just going to do a top-to-toe assessment so that we can work out which hospital this is going to go to, is it?
I know your chest hurts to breathe, okay?
Polly assesses the level of the man's injuries.
We're going to bandage your leg, we're going to get you to hospital. All right, mate?
It's clear there is internal trauma. He needs an urgent scan. Polly and Sarah travel with him to the Queen Elizabeth Hospital, Birmingham, where he's handed over to the waiting doctors for emergency care.
What were you doing, Henry? What had you got up the ladder for?
In Oldbury, critical care paramedic Colin Apps is treating 81-year-old Henry, who has a serious head injury after falling off his roof.
Am I on the roof?
You're on the floor of the
you're
mountain,
definitely on the floor. You can't fall any further, Henry.
Henry suddenly seems confused. A worrying sign his brain is not working as it should.
Okay. Ready, lift.
His brain may be swelling and pushing against his skull, reducing the vital flow of oxygen-rich blood.
So she's put the ladder away, but he was up at this top of the guttering bit, and it sounds like he's just missed his footing on the ladder and fallen. The ladder stayed where it was, and he just fell down to the floor. So quite a fall for his age.
Can that follow with my car off so I know where you're going? Assess your needs.
They won't get you in the hospital when we get there.
But how will I know where it is?
So what we'll do is we'll take your details, just next to the kit, and someone will call you from the hospital, okay?
Okay, I'll come back.
COVID restrictions mean that Henry's wife Patsy can't go to hospital with him.
We just got him in the back of the ambulance. We're going to do a set of observations. He's obviously elderly, and he's had a decent fall, and he's lost consciousness, so that's a concern. We need to go to hospital with an alert so they can get him assessed and scanned, if possible, quickly, if he needs it. It depends on his condition when he gets there. Just have a feel of his chest for me. Just have a feel all round this, because you check, I know you listen, just have a feel all round, just check for any fall. Does it hurt anywhere where we press on your chest?
As well as damage to his brain, Colin is concerned the impact of the fall may also have injured Henry's lungs.
Henry, do you have any pain in your tummy?
A blow to the chest can cause fluid to build up, which has life-threatening consequences.
And with your legs, can you move your legs for me? And that one. Can you feel me touching all the way down your legs? Yes.
Any pain in your chest at all?
No. Listen.
No, that's all right. You just look a bit red in the face.
After masking up, Patsy is allowed onto the ambulance to say goodbye, while Colin updates the trauma desk.
He's impacted the ground with the right side of his head, where he's got a large swelling and laceration above his eye and around his right zygoma. He also might have a broken nose. He's got no neck or back pain. He's got no chest pain. His chest all seems fine on examination. He's not 100% sure exactly what's happened.
To let you know, we're going to stand.
Colin is happy Henry is stable enough to be left with the ambulance crew for the 10-minute journey to the nearest trauma centre.
They will assess his whole body. They'll make sure he's not got any injuries they haven't missed. They'll monitor his observations for a good while. They might even keep him in overnight. They might keep him in longer than that. He'll be in A&E initially, and then he'll probably be moved to a ward. So just try not to... As he is at the moment, he seems like he's recovering well. He should make a good recovery, how he seems at the moment, all right?
Thank you very much indeed for all your help.
All right, you take care.
Sorry about this.
No, you don't be sorry. We just hope he's all right, so all the best. His risk factor is his age, and that's why he's going to the trauma unit, where they can give him a rapid assessment to make sure that he's not going to deteriorate. You know, he's 81, he's fallen off a ladder. There's plenty of 20-year-olds that have fallen off ladders, so yeah, he's just got to be careful. But I should think he'll be able to get back to his DIY soon.
Hello, I'm the ambulance service. Is the patient breathing?
Is he breathing? Is he breathing?
Yeah, is he conscious and awake?
He's bleeding really badly. Hello? Can you have an ambulance quickly? Sorry, I'm a nurse.
The patient's not fully conscious at the moment.
He's breathing but not fully conscious.
Okay, just explain to me briefly what happened.
He was on a cycle and he's gone over at the junction and a car hit him.
It's the highest priority, so over there as soon as we can. We have a cyclist being struck by a car, one patient. The patient is fitted completely with injury. So if you could leave all resources running, please.
An ambulance has been dispatched, but there's a high chance the cyclist has a significant head injury.
Police are in attendance, shutting the road off. There's no danger to the crowd. Don't require any other resources if necessary.
Critical care paramedics Aidan Brown and Ryan Ferris have been scrambled.
The initial reports have came through that he's unconscious and having a seizure. likelihood that he could be a very unwell gentleman with quite a significant head injury.
Reports of the cyclist's condition is so serious, a trauma doctor has also been dispatched.
We've got a run time of 1 minute.
When they arrive, police and paramedics are already on scene.
Hello, good morning, good morning. Hi, I'm Ryan, one of the CCPs.
Hi, bud. We've got a cyclist. He's very irritable now. He's got a nasty wound.
Was there any sort of active seizure activity on your arrival?
Yes, he's fitted.
He's fitted, has he?
I need you to sit still, darling.
All right, sir.
Try and relax for us. We've got you.
The 22-year-old cyclist was on his way to work when he crossed a busy junction and was hit by an oncoming car. The force of the impact threw him into the windscreen and he landed on the road.
Has he got a blow-in pupil?
No.
No, that's fine.
He wasn't wearing a helmet.
Eyes 1, voice 2, motor 5, so we'll give him a GCS of 8 with a high motor score.
Ryan's initial examination indicates an extremely reduced level of consciousness and a life-threatening brain injury.
Significant right-sided head injury.
Yeah.
But he has got a high motor score. No overpowering injuries, moving all limbs independently. Just very agitated.
Although unconscious, he's fitting and at risk of making the injury worse.
If you're happy, I think what we'll do, we'll sedate him a bit, get him relaxed. Yeah. We'll get him scooped onto the stretcher and we'll potentially just prepare in case he needs an anaesthetic and we'll get him off to sleep.
Aidan quickly prepares ketamine, a drug carried especially by the critical care team to calm him down.
I'll go 30 milligram potentially initially, just to try and get him relaxed.
Okay. Just hold that still for us, mate. Sorry. Let's just get a monitor. We've got the monitor there. Ryan, are you happy with the primary survey?
Sorry, primary survey-wise, yes.
Yeah.
Chest moving equally.
Yeah.
We've seen him move all his limbs.
Yeah.
He's both straight leg raised independently.
Okay, cool.
We'll just sort of talk to him, all right, because with the ketamine, he's going to have a bit of a strange sort of experience, okay?
The man is so seriously injured, he needs to be put into a coma. But there must also be a trauma doctor present to administer the anaesthetic.
I'll tell you what, let's get a bandage over that cannula as well. That's fine. All right, guys. This gentleman's going to go up to sleep. Okay, so just to make you aware, we're going to just prep, get him on there, and then we're going to give him an anaesthetic and set him off to sleep. All right.
So he's got a traumatic brain injury. Is significantly agitated with a low GCS. So we're just waiting for the medic crew with a doctor on board, and the plan is to take over his breathing, and then he'll be going to a major trauma centre. You stay with the patient, man. Make sure we've got a full assessment.
Yep.
I'll set up for an RSI here. Okay?
Yep, that's fine.
While they wait for the doctor, Ryan and Aidan prep for the complex procedure, one that's normally only carried out in hospital.
So what we'll do, the obs are on. We'll get that on a 3-minute cycle, if you don't mind, please.
The cyclist is still in a very unstable and agitated state.
Have you got the ketamine still?
Yeah.
His blood pressure's fine. He's starting to fight us a bit more. Are you happy if I go for number 20?
Yeah.
Guys, just going to give him a little bit more ketamine, all right, just to relax him.
Thank you. Have you got a rough ETA, please?
Aidan checks the ETA of the doctor.
Just for your information, the patient is packaged on a scoop. We are fully prepped for an RSI, so we're ready on your arrival or received.
Any delay could be fatal.
Thank you. 7064-203 over. The patient appears to have a traumatic brain injury, significantly reduced GCS and agitation.
Okay, everybody happy?
Right, okay, guys, so I'll take over from here. So we need 2 people going to do an RSI, so it's going to anaesthetise him. Okay, the doctor's just a few minutes away.
A trauma doctor is en route, while the team at the scene prepare to put the critically ill man into a coma. This should reduce swelling and prevent any further brain damage.
So just pop that out the way, if that's okay, mate. Okay, so hopefully we'll get that reading in a second. We should have everything pretty much good to go. That's okay, I've got it here, yeah. Yeah, so just wait until we get some end tidal. That suction's all good to go. So observations are okay. We're in a good position in that sense. So as soon as we get some more ketamine, it'll stay a bit
a bit flatter and we can prep for the RSI.
Managing the patient's airway during the procedure carries a high risk of COVID transmission, so the critical care team must wear level 3 protective suits.
Okay, I'm going to take over this, okay?
Okay.
Thank you.
Okay.
Okay, are you happy? Happy, thank you. I'm going to go and get level 3, Ryan. Yep. So everything else should be good to go.
With everything now prepped, a second critical care car arrives with a trauma doctor on board. Aidan quickly briefs him.
It's been quite agitated, so it's had some ketamine. Everything's ready, including the drugs. Yeah. So pretty much, as long as you make a quick assessment, whatever,
yeah,
it's good
he's on
to go.
this one now.
All right.
Dr. Jake Turner can now oversee the life-saving intervention.
Okay, guys, I'm going to go through a checklist, all right? Okay. So oxygen supply. Oxygen. End tidal. BVM. Suction. Working. On and working. ECG and ketamine. He has had 100 milligrams already, so now there's 100 left in there.
The doctor now administers the drugs that will temporarily shut down brain function.
Yeah, feels fine to ventilate. He is still breathing a bit. That is still him.
We're happy at the moment. Happy with the air. Happy. He's still saturating fine.
Okay, I think we have apnea now. On the ventilator.
At the point where the man is paralysed and no longer able to breathe for himself, Ryan must insert a breathing tube down into his lungs.
Okay, right.
Thank you.
Suction is here.
Cheers. Got it. Okay, got a grade 2 view, please. Of the bougie.
You have the bougie.
Thank you.
He has just 5 minutes to start ventilating, otherwise he could die.
Hang on.
And the tube,
I have the
please.
bougie.
Bougie through the cords, that's 23 centimetres at the teeth.
Okay, Ryan, you want to hold left hand, right hand?
Left hand, please.
Happy with this?
Happy, thank you. Thank you for that,
I'll
Aidan.
sort the vents inside, shall I?
The team have successfully anaesthetised their patient and taken over his breathing.
Okay, so end tidal 6, so I'm just going to back a little bit more, bring it down.
Okay, guys, vent is set up inside, ready to go.
He's now ready to be taken to the nearest major trauma centre.
So, happy, he's on about 480 volume. You happy to bring his rate up slightly?
Yeah.
Just with that end tidal.
6-2, thank you. Atmos when you're ready.
Aidan puts in a call to alert them of his arrival.
Thank you. Approximately 20-year-old male. Traumatic brain injury. Treatment given. He's had TXA. He's had an RSI with rocuronium and ketamine. ETA to the QE is 12 minutes from now.
Ryan and Dr. Jake travel with the man to provide continuous critical care throughout the journey.
GCS initially, eyes 1, voice 2, motor 5, GCS 8, so he had a high motor score.
The paralysing effect of the anaesthetic lasts for less than 30 minutes, so they have to constantly monitor to avoid any conflict between the patient's natural breathing and the ventilator.
If we can take that further down on his legs, almost. Happy?
Arriving at the Queen Elizabeth Hospital, Birmingham,
Thank you. Can I pass you that? Yeah.
the critically ill man is taken directly to the emergency doctors.
Initially, with the impact in the head injury, the patient can present a lot worse than the injury actually is because of the initial impact to the brain, the swelling, the bruising. So we won't really know anything until he gets a CT scan. And even then, it may be a few days he remains in an induced coma whilst the brain recovers. And he may have a very positive outcome. Unfortunately, he appeared to be a very unwell gentleman at the scene, so I can only hope that he makes a positive outcome.
Ambulance service, is the patient breathing? Can I have an ambulance? Is the patient breathing?
I don't know if the patient's breathing. There's been a gunshot. There's a gunshot. You need to bring an ambulance now. Oh my God.
What's the address?
No, I don't have his name. It's near like a field.
There's another call coming through. Yeah, I've got it. Black Patch Park. Yeah. Did she say what had happened? Gunshot.
Every year in England, around 30 people die and over 160 are injured in shootings. With the possibility of a major incident, the police firearms unit has been dispatched, and so too have the critical care team of Dr. Ravi Chauhan and critical care paramedic Richard Apps.
The information is a bit sketchy. It sounds like the call might have come from the firearms unit saying that shots have been fired, but that's the only information they've got. Then there's lots of other calls that are apparently coming in, but we haven't really got any information on patients at the moment.
So that's firearms that have just gone
flying past us.
Emergency teams are racing to the incident, but in dangerous cases like shootings, ambulance crews and the critical care team meet at a rendezvous point until police make the scene safe.
I'm just going to ask him what's occurring.
Operations manager Jason Lowe is also on scene.
Right, so...
Have we got patient info at all?
Someone I got when I first got the job has been shot in the head. One crew member from that vehicle can drive this one in, so if they are any arrests, we can go and take it.
Yeah.
All right.
Yeah.
I'll just have a chat with Greg on the 17th.
Yeah.
The medical team need to change into full PPE, as resuscitation of the gunshot victim sounds likely.
I will put a Tyvek suit on just in case, but not my respirator, obviously. Because it's a reported shot to the head. So if we do go forward, good potential that it'll be an arrest.
While police search for the gunman and casualties, all Richard and Ravi can do is wait. The critical care team in the West Midlands operate 24/7.
We're on the way to someone who's been stabbed in the neck.
At night, when the air ambulance doesn't fly, a doctor joins the fast response cars.
Look at me. I'm going to get you onto the ambulance, OK?
Tonight, Dr. Matt Rowley is on shift with critical care paramedic Jack Lewis.
Good evening, Grant. We're just going to get some caffeine, mate. Obviously, all checked available and waiting for your call.
Hello, mate. There is literally a job that's come in for medic requests, if you are good to go.
Yeah, send it through.
Hello, you're speaking to the ambulance service at the main end. Somebody's had a car crash. It's completely fucked. Okay, how many cars are involved? He's lost control and it's a tree. Okay. His car's are right off. Can you see whether they are breathing? Everybody's breathing, but he's out of it. Is he responding to anybody? No.
There's reports of a car into a tree, not very far away from us. Potentially multiple patients, one unconscious, we believe. We've got multiple resources on route.
On average, 5 people die every day on Britain's roads, with countless more seriously injured. Jack and Matt's enhanced life-saving skills are urgently needed.
Quick update from scene. Conscious male patient at the present, bleeding from the abdomen. Lots of happened by extreme damage to the car. Update you further shortly.
So, multiple patients, sounds like we've got at least 2, and a male. Sounds like they're still in the vehicle with a bleeding abdomen. I think this gentleman's got potential to be unwell.
On their arrival, police and ambulance are already on scene. One patient, the driver, has just been released from the car.
If you're happy, just continue to the back of the truck and we'll meet you on there. I'll take a look at the car. All right.
He was conscious when the passerby got to him, and they pulled him out of the car, placed him in the recovery position.
The operational commander briefs Matt on the incident.
He's jumped a fair way up that tree, hasn't he?
He really has. So it is a fair way up, and there is quite a bit of passenger space intrusion.
Yeah.
They did pull him from the driver's seat, so his side was quite free.
Right, okay. Cool. How are we doing?
With the driver now on the ambulance, Matt begins assessing the extent of his injuries.
Can you give my hand a squeeze for me? Good. Can you stick your tongue out for me?
Stick your tongue out. Roughly, yeah. Squeeze this hand.
20-year-old Khalil, a restaurant cashier, was driving home from work when he lost control and crashed into the tree.
So unconscious with passerby then, we pulled him out, but then like this with you guys when you got here?
Yeah. If he's got there, eyes are closed.
Yeah.
As soon as he moved at all, track open eyes, track underneath, with no response at all.
Khalil is agitated, but not responding to any commands.
Sit still for me, alright?
Keep your head down. Good man. Alright.
Whatever you want.
Right, try to keep your head down. Good man. Alright.
Jack inspects the car to get a better insight into what injuries Khalil may have sustained.
So significant passenger space intrusion. Driver space looks all right.
The windscreen has a clear imprint where Khalil's head smashed into it.
So he's clearly been unrestrained.
Jack updates the trauma desk.
Airbags have been deployed and it's clear that the seatbelt was not being worn. It's still fastened, so he's been sat on it by the looks of things.
All the indications are Khalil has sustained a life-threatening head trauma.
I haven't got you a full GCS breakdown, but safe to say he's not a GCS 15. It will probably either be the QE. We're just getting him on the back of the vehicle and sorted out. We'll come back to you with some obs and a plan shortly, not behaving normally. We're going to sedate him slightly, but it might be that that escalates to a full anaesthetic. But I'll come back to you with full details in a little bit. Received. Just relax, mate. Just lie back.
Yeah.
Lie back.
All right? Keep your head down for me. Good man.
9660. You want to just snapshot that for us?
We've got BM5.
BM5, cool.
You can see from the vehicle that all the impacts have been taken on the passenger side, which is probably the only reason he's still alive. Although he's not been wearing his seatbelt, so he's clearly been thrown around in the vehicle. We can't see anything obvious in terms of fractures or huge wounds, but his behaviour is certainly not normal, potentially consistent with a head injury, like a closed head injury. So our first step is we're going to just give him a little bit of sedation so that we can assess him properly and calm him slightly. And then if needs be, it might be that becomes a full anaesthetic, but he's certainly gone through a significant mechanism of injury there.
So we're going to give a bit of ketamine, just see if we can get him chilled out a bit.
Yeah. Okay.
If we can't get adequate control of some ketamine, we can put him off to sleep.
Sit still for me. Good man.
You smell any alcohol at the top end?
Maybe.
No.
While giving the ketamine sedative, Matt and Jack discuss his coma scale assessment.
So GCS-wise, we are probably an E3, V1, motor, and then 5 probably, to localise.
Khalil's score is on the border between moderate and severe brain injury.
Is that a fair impact?
Oh, it's massive.
Enough to shake his head around. Can you give my hand a squeeze for me? Just squeeze my hand. Good. So yeah, he obeys commands. So if you're happy, I think we just go. Airway-wise, he's all right, isn't he? He's oxygenating, he's ventilating well. As you said, whether he's a bit shook up because he's had his brain rolled around his head, I think if you're in agreement, I don't think we should RSI him at the moment and just...
His airway's very patent, it's self-maintained.
Just a little bit of ketamine if he gets unmanageable again, and 20 seems to have worked the trick.
Yep, sounds good to me.
After assessing him, Matt and Jack don't think a full anaesthetic is needed.
Up to the QE.
The ketamine has relaxed Khalil, enough to ensure he's safe to travel to hospital.
60.
Yeah, go ahead.
Jack updates the trauma desk, who will alert the Queen Elizabeth Hospital, Birmingham.
We can't find any obvious kind of musculoskeletal injuries. There's no abdominal guarding, chest seems clear, and nothing to the head. It's had a small amount of ketamine sedation, but doesn't require anything further from us. So we're going to be escorting to the QE with an approximate ETA of probably about 20 minutes. So.
Yes, that is all received. I'll give them a shout for you.
Khalil is still in a life-threatening condition, so both Jack and Matt stay on the ambulance to closely monitor him, ready to intervene on the journey if necessary.
Can you give my hand a squeeze for me? Good. All right, well done.
He will open his eyes if you ask him.
Yeah. So we're going to take him into resus at Queen Elizabeth Hospital. He'll get assessed by their trauma team. They'll reassess his airway, breathing, circulation, and then he'll probably need to go for a CT scan of his head and any other bits of his body that the team feel appropriate when they have a look at him.
At the Queen Elizabeth, the critical care team hand Khalil over to the trauma doctors for the next stage of his emergency care.
It's a massive impact, massive mechanism. Even we don't see that type of mechanism that regularly. And although we get a lot of RTCs, generally if people are wearing their seatbelts, they generally do okay. But as soon as people stop wearing their seatbelts, those are the ones that tend to come across our door a little bit because they generally have more significant trauma, more significant injuries that require our support. Anyone involved in that type of incident is lucky to be alive. You know, if the car had hit the tree on the other side, then, you know, he probably would, you know, that would have probably been a fatality.
Ravi and Richard are in Smethwick, responding to multiple calls reporting a shooting. Police have been searching the area for the last 20 minutes.
There is evidence of a party, but there's no sign of any shooting, no sign of any patients, no sign of any disturbance.
It could be a malicious call, but the emergency team need to be sure no one's in need of their help.
Try and get us cleared.
They've gone in, done a sweep round, there's nothing there. So I had to go on the phone and say that we need to go and do the sweep round.
It does sound like it's going to turn out to be a hoax. Or, if not a hoax, a misunderstanding or misheard gunshots. So we'll, at the moment, I think we're going to stand by with the first crew, but we may get stood down ourselves shortly.
Another search of the area uncovers nothing. It's a frustrating but not uncommon false alarm.
So the firearms unit, they've probably got a few of them roaming around, and then obviously, yeah, we've got 2 crews, 2 officers and ourselves here, so yeah, it's quite a lot of resource for these kind of things. Fortunately, lots of them don't turn out to be anything. The majority don't, so, which is a good thing.
In the 25 minutes Ravi and Richard have been on scene, West Midlands Ambulance Service have received 70 genuine emergency calls. In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to Stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, 2 lives are in danger after a double stabbing.
Life-threatening, potentially life-changing.
His ankle is off by his head.
A pedestrian is run over by a bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Matthew, open your eyes.
A driver collapses after a high-speed crash.
He's just not responding to pain. We're going to put him to sleep.
Can you hear it going on?
And a man is left battling for life after a city centre fight.
(7062).
7062, good morning.
7062, good morning. I'm here. You can book me on here all day.
It's the start of a 12-hour shift for critical care paramedic Jack Lewis.
I am relatively apprehensive about what we're going to get today. I was on the trauma desk yesterday, very, very busy. This car particularly, with a range of stuff from quite nasty trauma to some unfortunate medical incidents. I think we're going to be the same today.
Ambulance services to patient breathing.
He's just been stabbed.
Okay, what have they been stabbed with, do you know?
A knife.
Okay, are they bleeding heavily?
Yes.
And how old are they?
But adult.
Do you know where the stab wounds are?
One's got one in the stomach, one's in the chest, and one's in the stomach. The one's got 2 stab wounds, losing consciousness.
Are you if he's lost about 2 mugfuls of blood?
It's close to.
Okay.
Can you just send an ambulance,
Yeah,
please?
it's not delaying any help, sir, okay.
62 Whiskey Romeo.
A stabbing is one of the most challenging situations a critical care specialist can face. If an artery has been severed, a patient can bleed to death in minutes.
Been deployed to reports of a double stabbing, 2 patients, one with chest injuries, one with chest and abdominal injuries in a park not too far from the QE, so hopefully it'll be a case of a rapid assessment, major hemorrhage or like, you know, life threat control, and then a rapid extrication. 60, thank you. ETA approximately 3 to 4 minutes.
The critical care team in the West Midlands deal with more than 30 stabbings every week. Reducing the number of deaths is one of the service's main objectives.
Police en route. So you'll be first on scene.
Roger, that's all copied.
We are having updates soon with these patients are unconscious. Please today, their ETA was 2 minutes.
Roger, given the severity of their potential condition, I am happy to make scene with a dynamic risk assessment received.
With 2 patients' lives on the line, every second counts.
Updated report from police has come through that they're both unconscious, so potentially this is going to be 2 traumatic cardiac arrests.
7062, did you receive over?
60, that's all copied, just pulling up behind, 4634, and that's Romeo 55 now.
On arrival, it's a major incident, with multiple police and ambulance teams already at the address.
Hi, Rob. Yeah. Roger.
2 neighbours have been attacked. Simon, who's outside, was stabbed while trying to defend his friend. "41-year-old Matthew, who has collapsed in the stairwell, has been stabbed twice.
Come on. Breathe. Go on, deep breath out. Come on, you can. Okay.
He is struggling for breath. The stab wounds are close to his lungs, and they are in danger of collapse.
They put Kettle on, I've not looked at wounds.
That's fine. Is he on O2? Hi, mate.
He's on O2 from police, not ours.
The wounds have been sealed, but with internal bleeding and potential organ damage, he's at high risk of going into cardiac arrest.
GCS 15, chest seal applied, oxygen on, and we're just going to get him gone and gone. He's got a good chest wound and a good abdominal wound.
All right, we'll put him straight on 463
Yep.
the crew are with him. The second crew, I haven't seen this guy's wound yet, but it's abdominal.
I'll have a quick
So I'm going to get this crew to bring
look.
their stretcher up, and we'll get this guy's.
If we just load it both and just get them all just gone straight off. I'm just going to grab an apron because I'm half PPE'd.
Once in protective PPE, Jack can make a close assessment of the other victim.
Rob, whilst they're dealing with him, I'll just have another look through this guy.
54-year-old Simon has one small but potentially deadly incision.
All right, can I have a little look, sir?
You okay, mate? Just you okay,
Okay, good.
You're right.
It's a bit of bowel, but it looks it looks like there's too much there with lots of vein through it. It potentially out his bowel, but
The stab wound has gone so deep, his bowel is now protruding out of his abdomen.
You okay, mate? Just you okay,
good.
If his bowel has been cut, he's in grave danger of sepsis, which can lead to organ failure.
So, hello, sir. My name's Jack, okay?
Oh, yeah.
Do you have any pain anywhere else? Have you been hurt anywhere else?
Yes.
Can we get this bag off you? Is that all right? And your hat? I'm going to get this top off you, mate, okay? Just to check and make sure you've been stabbed anywhere else, all right? Okay, let's have a look in your arms. Nothing in the back. You definitely weren't stabbed anywhere else? No, there's no obviously bleeding, there's nothing into the wounds. Fine. Okay, good.
You all right?
Yes, happy for this gentleman on your stretcher. Is that the plan, Rob?
Let's get him, because the sooner he's moved, we
Yeah, let's go.
Suddenly, a fight breaks out amongst the bystanders, threatening not just the care of the patients, but the safety of Jack and the ambulance crew.
Ambulance service, is the patient breathing?
I don't know though, I think he's underneath the bus.
Someone's been run over?
Yeah? With the fire engine coming as well, because they might have to lift the bus up.
Yes, I have requested for fire as well.
Hello, I'm actually a nurse. I spoke to the gentleman under the bus. He said he can breathe. However, his arms are trapped. He can't free his arms to get from underneath the bus.
Okay. We are coming to you on a blue light response and we'll be with you as soon as possible.
With a man run over by a 12-ton bus, the risk of catastrophic injuries is huge. So critical care paramedic Colin Apps is immediately dispatched.
So Colin, just so you're aware, so it's coming through one patient. Man is still conscious, but still trapped underneath the bus. You have got a crew in attendance and OM is about to book in as well, over.
That's all copy, thank you. We're about 8 minutes away at the moment. Helicopter, helimed is going as well.
He's not trapped under the bus. His ankle is not by his head.
Sounds like he's going to have some injuries, doesn't he?
The incident is so serious, the air ambulance has also been scrambled.
Sounds like this is peeling clam is empty. Because very little space to get him out from underneath the bus. Have to drag him out and have an investigation on it.
12 minutes after receiving the call, Colin arrives and is briefed by the operations manager overseeing the incident.
He's just been trapped underneath this bus here. His ankles were literally by his head. This is as tight as you could get the bus.
Okay.
And we've literally just had to drag him out. It's literally 4
Yes.
drum and half underneath.
GCS 15 still? But...
GCS 15, yeah.
And you don't think he looks very well?
Peeling clamming from what we could see. We couldn't get any oxygen. So we literally just got him out.
Thankfully, just before Colin arrived, firefighters were able to free the man and he's now being assessed by paramedics.
Has he said he's got any pain anywhere?
In his arm. Where's your pain?
Andrew, relax yourself.
Guys, take his clothes off completely. Get full monitoring on him. We need an ECG on him so we can monitor his accurate heart rate.
Yeah.
All right?
We've got a blood pressure, yeah, 101 over 69. Good radial as well.
44-year-old Andrew was travelling to meet his wife when he stepped out in front of the bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Although Andrew is conscious, Colin is concerned. If he's broken his pelvis, he could have life-threatening internal bleeding.
So he's got no bleeding under there, but his leg was, you say, quite up above his head, yeah?
Up by his head, yeah. It's kind of bent over onto this leg was above there.
As a catastrophic internal hemorrhage can cause death within 5 minutes, Andrew's in need of urgent transfer to a major trauma centre.
60, could you just update me? Is HeliMed en route over?
How old are you, sir?
54. In Birmingham, critical care paramedic Jack is working to save the lives of 2 men who have been stabbed.
So I've got no odds on him other than he's got a good pulse. He's looking a bit pale, as you can see. Single isolated wound.
With 2 patients on his hands, Jack decides Simon is in the most stable condition for the ambulance crew to take over.
I've not taken his trousers off. It looks like there may be some bowel vein. There's like a nice vein through part of the flesh, so it could be quite fatty, but I'm not prepared to say it's not bowel.
Yeah, no, sir.
All right.
The other victim, Matthew, is still in the stairwell and in more urgent need of Jack's critical care.
I can travel with either. Probably this chest guy. Probably stick with him because he's going to be the sicker guy.
A bit longer, and if there's anything going to go wrong, it's going to be with him.
Yeah.
Okay.
I'm guarding these for their safekeeping. Please do not say anything. Stay there.
With tensions running high, police officers make a cordon to shield the paramedics from harm.
You guys have to get him on, and I'm going to start drawing out some TXA. Stand by. Life-threatening.
Life-threatening, okay.
Potentially life-changing. Yeah, you get him gone, get him gone.
Get him onto the truck, yeah?
I'll meet you there. Yeah.
So the dog ambulance can take you down to the ambulance.
It's vital Matthew is kept as calm as possible. With 2 deep stab wounds, any rise in blood pressure will increase the speed of blood loss and he could go into cardiac arrest. With a police dog escort as protection, Matthew is quickly evacuated to the safety of the ambulance.
Let him go now.
Yeah, go on, I know, yeah.
Try and get these doors. Yeah, I'm going to get one. Sorry.
6-2, go ahead. Very disordered scene. Can you pull yourself forward, mate, with my help? Matty, give us a hand. Now push yourself as far back as you can and get yourself sat up nice and high for me. Get your legs planted in, you've got good movement. You're doing really well. I know this is a really distressing time, but we're going to get you through it, all right?
Once on board, Jack gives Matthew a vital injection of tranexamic acid to try and stem the blood loss before updating the trauma desk.
I can't breathe.
So I have got a 41-year-old male. We've got 2 wounds. Okay, 1 non-sucking chest wound to the right anterior and 1 wound to the right lower quadrant.
They will alert the hospital to expect 2 critically injured patients who will need urgent surgery.
He's had TXA oxygen applied. The other patient is on the other vehicle. He has an abdominal wound, potentially a spat of small bowel visible. We are leaving scene now for the QE. ETA approximately 6 minutes.
While travelling on blue light, Jack closely monitors critically ill Matthew.
Is that pain a bit better? Yeah? Feel a bit easier? Good. Are you able to take a deep breath in for me? And now, sore on that side? It's all right, I know, I just need this chassis to stick a bit. Otherwise, it's not doing a huge amount. I don't think you damage your heart, I think it's your lung, essentially, or the space where your lung should be, okay? When the call came in to say we had 2 patients, both stabbed, potentially both unconscious, I'm thinking traumatic cardiac arrest, I'm going to have to really prioritise who's going to get my help first.
Yeah, just twice.
The trick with these patients is get going while the going's good and don't waste time. We're not going to fix their problems on scene. If they arrest on scene, we're in a whole world of trouble.
30 minutes after the emergency call was made, both stab victims are handed over to the major trauma team at the Queen Elizabeth Hospital, Birmingham.
Either of those wounds could potentially kill someone. The gentleman that I was with, he had air in his chest that was taking up space that lungs should have been taking up, so compromising his ventilation. The other gentleman, if he's nicked his bowel, that can be really quite complicated. Both are going to be at least life-changing and going to require significant recovery.
You got pain here? Pain there?
In Dudley, critical care paramedic Colin is dealing with a major incident at a bus station.
Do you take any medicine for anything, don't you? Epilepsy? OK. You haven't had a fit at all, do you know of?
No.
Andrew stepped out in front of a bus and was trapped under it for more than 20 minutes.
And we'll get more for you on the truck if you guys are happy. Yeah.
You will just give us the IV paracetamol for now.
Paracetamol going in, guys.
Andrew, you still here?
Yeah.
Good man.
Colin is concerned he may have life-threatening internal injuries.
Can we grab another crew?
Angie, where does it hurt?
Just sat down, it's feeling pretty shaky. And his shoulder. In your shoulder is
So is it you have the TXA or was that just being drawn up, yeah?
Colin gives Andrew tranexamic acid to help stop excessive bleeding.
Just chuck it over this side, I'll pop it on this side.
Although they've managed to stabilise Andrew, they need to get him to hospital fast.
7062, what's some HeliMeds ETA now over?
Colin checks the whereabouts of the helicopter.
What do you think about leaving scene to the QE? Because I don't think HeliMed's going to do anything extra now.
No, it's BP 91 over 6.
It's come up a little bit, so don't worry about the fluids for now, we'll do it on the way.
Rather than wait for the air ambulance, Colin and the crew decide it would be best if he escorts Andrew to hospital by road.
Nice one. Thanks, guys. See you later.
A patient with internal injuries can suddenly deteriorate, so Colin's critical care continues throughout the 20-minute journey.
How's your pain now? Does it hurt anywhere? What happened? Do you remember?
At the Queen Elizabeth Hospital in Birmingham, Colin hands Andrew into the care of the emergency doctors.
Okay.
All right, Andrew. Just at the hospital now. All right.
Quite a serious job, especially in terms of the mechanism and potential a serious injury. I suspect he's injured something, I'm not sure what, which is why he's having a CT scan so he can find out. In terms of his observations, he didn't seem terrible, but I'm sure he's got something wrong with him.
As night falls, there is no let-up for the critical care teams.
So just have a check that there's nothing that's out of date.
At base, Dr. Ravi Chauhan and critical care paramedic Richard Apps have just checked in for their night shift.
It's not going to be a normal hot Friday weekend, and I think that's just because of what's happening with COVID, with lockdown and social distancing. But I suspect today will be probably quiet to begin with, and then maybe some RTCs.
I think you're being very optimistic that people are still behaving with lockdown. I don't think they've behaved for weeks. They've all gone mad. The job numbers are all back to stupid again now.
It's not long before Richard is sadly proved right.
Ambulance service, patient breathing.
I don't know, there's been a fight. He's dead cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear it going on?
Yeah, okay, so male adult.
Male adult by the looks of it, yeah.
And you said that he seems unconscious.
He's dead cold, love.
Have you got any idea what's happened at all?
It looked like it was a fight. It all happened really quick, and then all you heard was this crack. And I'm reckoning his head on the tile floor. He's bleeding. Or he's been sick. whatever it is, it's not looking good. Can you hurry up with the ambulance, please? They're doing CPR. They're doing CPR on it.
They're doing CPR, okay. We are coming as quick as we can, blue lights.
An ambulance has been dispatched, but the man's injuries are so severe he may be in cardiac arrest and in need of enhanced critical care from Ravi and Richard.
We are going to central Birmingham to reports of an unconscious patient following an assault.
500 yards. Hi, thanks. Just a quick update from the scene. There's a few crews in attendance. The patient you're going to has a GCS of 3. He was hit over the head with something. He has his pupils, trismus. They report the scene as being very chaotic. They're scooping the patient and loading him onto the back of the ambulance. They're going to try and get bilateral IV access ready for you.
Yeah, that's received. If they are having airway issues, I would suggest that they go to nearest whilst we make our way.
Yes, absolutely. They were still on scene when I spoke. I think, from what I heard, you are going to make scene before they're ready to leave. Received.
Yeah, many thanks.
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain and to other organs. So if we're struggling with that, then we may have to act pretty swiftly. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
I haven't seen the vent or anything. Just sort of pushing through these checks in case we get an early job.
It's 7 p.m. and Dr. Polly Haywood is getting ready to start a Saturday night shift.
It's payday this weekend, so we could expect it to be busy, but obviously we don't know if people are not socialising as much as they might do with coronavirus.
Tonight, she's paired with full-time critical care paramedic Sarah Foley.
Yeah, that's the third one. Have you checked it's got enough masks and stuff in, or...?
No, the blue kit.
No, I'll have a look.
So this is a brand new car, so we're just kind of familiarising ourselves with it. We've got burns kit, maternity kit, including the slightly unlikely nerve agent protection. We've got snow socks. I hope we don't need those.
Don't think so.
Midlands service, is the patient breathing?
Yes.
Are they conscious, awake?
No.
He's not responding to you?
He's not responding, no.
If you gently take his shoulder, does he wake up in any way?
May, can you wake up for me? May, can you wake up for me? No, he's not.
Okay.
He's been in a car crash, and a very big one. By the looks of it, he's lost control and is driven into a lamppost and then a tree.
Okay.
He was up and around for sort of 5 minutes. He lay down and then he sort of passed out through.
Okay. We are coming to him on blue lights.
A man suddenly collapsing after a high-speed road collision is a Category 1 emergency. An ambulance has been dispatched, but critical care backup from Polly and Sarah is also needed.
The patient has driven into a lamppost, then a tree. Only him involved. Patient was walking around after the RTC, then lay down. When you crash into motorway furniture or lampposts, they're all designed to deform. A tree is not designed to deform.
With over 1,700 deaths on Britain's roads every year, the team have to be prepared for the worst.
Hi guys, high-speed RTC, still GCS 3. He's got some contusions to his head that might possibly be isolated head by the sound of it. Blood pressure 134 over 82, making respiratory, but they're quite busy on feed.
That's absolutely fine. Just keep us updated before they leave the scene. It sounds like patient would require an RSI.
Sarah and Dr. Polly are highly qualified to perform an RSI or roadside anaesthesia should it be needed.
Is there enough space in here? Yeah, I think there is. Yeah.
When they arrive, the injured man has been moved to the ambulance.
Right, we're both going to have to double level 3, aren't we?
As Polly and Sarah may need to put a breathing tube down into the man's lungs, they both must wear the highest level of protection against coronavirus.
So, really fine mechanism. It's a little bit weird. Something that's quite adequate, to be fair.
While they dress, the paramedic updates them.
And he's come out of the car. He's been walking around for about 5 minutes apparently.
Yep.
Witnessed by bystanders.
Yep.
And he's just collapsed. So he's been GCS of 3 with us.
A GCS, or Glasgow Coma Scale assessment of 3, is the lowest level of consciousness and a sign of possible brain trauma.
Hello, buddy.
Now in COVID protective suits, Dr. Polly and Sarah begin their close assessment of the patient.
My name's Dr. Hayward. I'm one of the merit team. I'm just having a feel across your chest wall, sweetheart, OK? He's got like a laceration there.
Yeah. So anything to suggest that he's under the influence of anything? What's that?
Bit of a lack there, like a seatbelt lack. He's got a very firm belly, but all his numbers are normal.
Completely perplexed.
Although the man is unresponsive, his vital signs are good.
What's his name?
Matthew.
Matthew, have you taken something? Hold your arms up for me, buddy. Hold your arms up. See, there's tone in there. Hold your arms up. OK, hold it up there for me, buddy.
To assess Matthew's brain function, Polly checks his arm reflex.
This is all very odd, isn't it?
Yeah.
If he's unconscious, his arm should fall totally limp without any reflex. But as she drops it, Polly can feel the muscle tense, which is very unusual for someone unaware of what's happening.
So it seemed to walk at scene, but then...
Yeah, he got out of the car for about 10 minutes, was complaining about pain in his back, was fixated about finding his phone, and then by all accounts he sort of sat down on the edge of the road and then collapsed and was in this state from that point.
It's a mystery Polly needs to solve fast. Time could be running out for Matthew.
Let me just have a listen to his chest. There's nothing here on his numbers that makes me want to put him to sleep.
Dr. Ravi and critical care paramedic Richard have been dispatched to Birmingham city centre, where a man has been seriously injured after a fight. He's now on an ambulance. The crew brief Ravi.
What's going on?
Yeah, this is Julian. He's obviously assaulted in the head.
Yeah.
I'll step out with GCS3.
Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
He's right here. He's got serial amounts of congealed blood. Pupils, left side sluggish and 3s.
Yeah.
Right side was reactive and 3s.
Julian is completely unresponsive and bleeding from his ear. All the indications are he has suffered a traumatic brain injury.
He's trismus. We couldn't get an OPA in, so we've popped an MPA in.
Yeah.
On the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access. He's been blood pressure stable throughout. And we've given him 1 gram TXA.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and it seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. As the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation stable, and have anaesthetics on standby? We're not going to RSI here, but he'll probably need us. Okay, cool. All right, so that's bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, you know, we won't really know what his outcome's going to be.
In Oldbury, critical care paramedic Jack Lewis is making a mid-shift pit stop.
Never know how it's going to pan out doing this type of work. Could well get 1 or 2 more jobs before the end of the shift, but in case we don't, it's about kind of preparing, taking the opportunity while we can to get the car ready for whoever's on tomorrow, who might be rushed first, you know, out first thing. So we've still got a couple of hours left for things to happen.
Is the patient breathing?
No, I don't know. An old man just dropped and collapsed on the floor. He's heavily bleeding from the head.
Is he making a grunting or?
Yeah, definitely.
Yeah. Okay, is he awake?
Hello? Hi. No, you're not awake.
No, it's fine. We've got the help on the way for him, okay?
CKC Bell 2144, please come through the Cat 1, unconscious, noisy breathing. ETA is about 10 minutes, received.
Roger, all copy, no worries, I'll give you an early update, thanks. ETA approximately 3 minutes.
A man who has suddenly collapsed and reportedly unconscious is part of the reason the critical care team was set up.
We're about a minute out, we'll probably be first on scene. There's a crew also en route, but they're probably about 8 minutes behind us.
They are highly trained, able to administer life-saving treatments at the roadsides over and above regular ambulance teams.
Male in his 70s, unconscious, sounds like a collapse. Patient collapse, hit head. Hi guys. Hello, my name's Jack from the air ambulance. How are you? What's your name? Tony. Do you know what's happened, Tony?
Tony, a retired engineer, was on his way to his local shops when he fell and hit his head on the pavement.
Do you remember what's happened at all? No, you banged your head, you've given yourself quite a clock, I think. Yeah. Have you got any pain anywhere? Nothing at all? OK. So you don't remember what's happened, you've been seen to walk down the street and you've gone down and you've clocked your head. I can see you've got a nasty wound to your head there. Do you think we can try and roll you onto your back, sir?
I've got some shopping to do.
That's OK, we can do that a little bit later. Let's make sure you're well first. OK. Can I give you a bit of a check over, Tony?
Yeah.
Although Tony has regained consciousness, he has no recollection of what's happened.
Yeah.
How old are you, sir? Give me a rough idea. 64. And do you suffer with any medical problems?
Nothing.
Nothing at all? Do you take any
He's also very confused. Tony is 75 years old, not 64.
I'll sit up next to you, it's whatever you'd rather. Do you think we can get this jacket off? I think you're probably a bit warm.
It's 27 degrees, and Tony is dressed for winter. Overheating may be one reason for his collapse.
Let me come behind you. Sit up for me. Good, ma'am. Tony, can we get this jacket off? Just give you a bit of a check over. Have you had much to do? Any food, lunch today? Anything to eat? No. Much water? No.
Jack needs to be sure there aren't any other underlying causes, particularly seeing he already has another recent head injury.
Do you take any medicine to thin your blood? No. OK.
Tony's displaying some concerning symptoms.
Do you take any medicine for anything at all? Nothing. OK.
His sudden fall, difficulty speaking clearly, and confusion could all be signs of a stroke.
Very flat, isn't it?
In Shrewsbury, Dr. Polly and critical care paramedic Sarah are dealing with a puzzling case.
Buddy, come on, matey.
Matthew has had a high-impact car crash and appears to be deeply unconscious. But Polly thinks he may have some awareness, and for an unknown reason, can't move or respond to her.
Inside of the vehicle.
Have we got big intrusion? He has got a shift there, hasn't he, into the centre console.
The back and there.
To try and establish what might be causing Matthew's paralysis, she looks at photos of the crash to see if she can glean any clues.
By all accounts, it was into a lamppost, then onto a tree.
So with those scene photos, we need to go to major trauma centre. The options are we tube him, or we take him straight and we tube him if necessary. His numbers are perfect. He looks good. He had voluntary swallow. Been watching him swallow.
Just not wanting to respond to it, is it?
No.
Having examined the scene, Polly suspects Matthew has internal injuries. She tries one last time to wake him. She gives his skin a sharp pinch to see if he has any response to pain.
I think on paper we are GCS3. I have given a really big painful stimulus.
Big mechanism.
Big mechanism of injury. He's got voluntary eyelash reflex. He's got some swallow. Yeah. But I've given a very painful stimulus and no dice. Right, we'll go to Stoke, walk us into sleep.
I'll just tell the OM and exactly what we're doing on our setup. Hi, you're right. So it's a long journey to Stoke. We're going to put him to sleep, but something doesn't add up here. He's just not responding to pain.
We're doing the RSI here then, are we?
Yes,
okay,
yeah. Is that all right?
Concerned Matthew may have a brain injury that could have life-changing consequences, Polly decides to put him into an induced coma to reduce swelling in the brain, protecting it from further damage.
Our journey time up to Stoke is about 35 to 40 minutes, so we're just going to quickly pop him to sleep for the journey, and then he can go straight into a CT scanner to assess him for his injuries. Although we can't physically see any injuries on him at the moment, he's not waking up.
Matthew! Matthew! I'm having a look at his airway. He's got a smallish chin, but that looks pretty reasonable.
There is always a risk putting a patient into a coma, but doing it on an ambulance, 35 miles from the nearest trauma centre, the stakes are so much higher.
We'll optimise our airway position.
So the ventilator's working, I'm going to turn it off for now.
And what have we got there? Ket, rock, a bag of fluid for flushes.
So I think we're pretty much there now.
The checks are done, drugs drawn up, Polly is ready to anaesthetise.
Oh, hello. Oh. All right, buddy. That's about on time.
When Matthew suddenly comes round.
Matthew, open your eyes. Hello, buddy. You're on the back of an ambulance, sir. Matt, open those eyes for me again. So we've had voluntary eye opening, that's great. Obeying commands, 9. Can you talk to me, buddy? My name's Dr. Hayward. We're near Shrewsbury, fella. You've been in an accident. Hi, Matt. I know we're dressed up like out of something like out of ET, all right, but you have had a period of being unconscious. Do you know where you are? No. So I think what we'll do is we're all ready to go. If we give you a nod, we can RSI on the way. There's no indications to put this patient to sleep.
As Matthew is now conscious and responding to Polly, the anaesthesia is aborted.
Have you got pain anywhere?
Everywhere.
Everywhere? Where hurts, fella?
There.
Your back and your neck. OK, sweetheart. So if you can bring that neck a little bit straighter, we're going to just tape you here to keep your neck nice and still, buddy, OK? Have you got pain in this tummy? Are you OK? Or is it in your back? Belly in your back. All right, sweetheart. Right, let's just leave sooner rather than later.
Matthew may have spinal damage. He needs an urgent CT scan to check for any fractures in his vertebrae, which could cause paralysis.
We have a 28-year-old male who was a driver of a car, high speed, impact into a lamppost and a tree.
Sarah updates the trauma desk on Matt's condition and to alert the hospital of their arrival.
Was a GCS of 3, but still had eyelid reflexes in the way of blinking when you touched his eyelids, but there was no response to pain.
Dr. Polly continuously monitors Matthew during the journey to Stoke.
Thank you.
Got it. Okay.
All good, yeah, thank you.
Okay, just monitor.
50 minutes later, the critical care team can finally hand Matt over to the waiting trauma doctors.
Blood pressure's good. You are quite tacky. I think you're probably quite dehydrated.
Critical care paramedic Jack Lewis is treating 75-year-old local resident Tony after he collapsed unconscious in the street.
Have a little bit of water for me.
He has a nasty head wound and may have a bleed to his brain or suffered a stroke.
This is Tony. So Tony's fairly regular fixture around here.
An ambulance crew has arrived to take him to hospital. Jack briefs them on his initial assessment.
He's walked down the street a bit unsteady, held onto that and then collapsed, fell to the pavement, hit his head, as you can see, with a brief period of LOC. On my arrival, GCS 14, sat himself up, no obvious neck pain, not complaining of pain anywhere else. Wound here, not actively bleeding, a bit boggy and a bit kind of angulated.
Right then, Tony.
We'll get you on this stretcher, Tony.
You on our stretcher? Legs together, that's it.
Ready to push? 1, 2, 3. Good man.
Tony needs an urgent scan and full investigation into the underlying cause of his collapse.
I'll pop you up to Russell's Hall to get your head looked at. Why? Because you've cut your head.
That's 3 or 4 days more.
It's not. You've done it today.
You've got a nasty bump as well.
Not today.
All the blood on the pavement says otherwise.
Jack knows there could be many reasons for Tony's confusion. Heat exhaustion, dehydration, or something more life-changing.
GCS 14 initially.
You don't remember falling at all?
Not today.
No. Okay.
Even more reason to pop up the hospital then. Need to get that looked at.
After updating the trauma desk on his assessment, Jack has done all he can for Tony at the scene.
Take care, Tony. Feel better soon, sir. OK.
And hands him into the care of the ambulance crew for the journey to hospital.
Better.